Rosemary, we have quorum.
Yes, we do. You can proceed.
Okay. Good morning. Welcome to the Vancouver City Council meeting of Tuesday, October 13th, 2020. This council meeting is being convened by electronic means authorized under Part 14 of the Procedure Bylaw, the City of Vancouver Electronic Meeting Regulation, in the order of the Minister of Public Safety and Solicitor General of the Province of British Columbia, Emergency Program Act Ministerial Order number M192. As such, council members are participating by phone, and as chair of this meeting, I'm also participating by phone. Please note that if my connection is lost during any portion of this meeting, we will recess the meeting until my connection is restored. If council loses connection during the voting process, we have staff on hand to facilitate getting you back online quickly while we suspend the voting process. The contact information has been circulated to you. The live stream of this meeting will continue with audio only. Presentations and vote results will be projected to viewers when available. Council are also reminded that we need to ensure there's quorum during the meeting, so please make sure that your video is enabled. We acknowledge that we are meeting on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. We thank them for having cared for this land and look forward to continuing to work together in partnership as we continue to build this great city together. I also want to take a moment to recognize the immense contributions of City of Vancouver staff who work very hard every day, particularly these days, it seems, to help make our city an incredible place to live, work, and play. Clerk, may we have the roll call, please?
Mayor Stewart is on a leave of absence for civic business. Councillor Carr. Councillor Carr, are you able to hear me? Councillor De Genova.
Present.
Councillor Fry.
Here.
Councillor Swanson.
Here.
Councillor Harwick.
Present.
Councillor Weeb.
Present.
Councillor Boyle is in the chair. Councillor Dominato. Councillor Bly.
Present.
Councillor Kirby-Young.
Present.
You have quorum, Deputy Mayor Boyle.
Thank you very much. Here is the plan for the day. The public is strongly urged to listen to the proceedings via the city's website or YouTube link, and to follow along on Twitter at @VanCityClerk for updates on the progress of the meeting. Any comments on agenda items can be sent to council using the web form on the city's website, and the link to that form will be tweeted out on @VanCityClerk. Today, we will deal with Report 6, including hearing from speakers to this item. Council will be reconvening on Wednesday, October 21st at 3 p.m. to deal with the remaining items on the agenda, including unfinished business 1, Report 2 and 4, including hearing from speakers, and motion B1. We'll begin with an item of new business, which is a request for leaves of absence from Mayor Stewart for civic business from meetings today, October 13th, 2020, from 9:30 a.m. until 2 p.m., and Councillor Dominato for civic business from the meetings on October 15th, 2020, from 9 a.m. to 5 p.m.
So moved. Councillor De Genova.
Thank you, Councillor De Genova. And can I get a seconder?
Councillor Kirby-Young.
Thank you, Councillor Kirby-Young. We'll do a verbal vote first on this. All in favor?
Yay.
Yay. And any opposed?
Yeah, I got it. I don't have the second one yet, though.
Councillor Carr, I think that you might need to mute. Thank you. So that passes. And we will move on to Report 6, modification of lease for supporting Women's Alternatives Network, One Vancouver Society, and the lease for Rain City Housing and Support Society for overdose prevention site, both at 1101 Seymour Street. Sandra Singh, General Manager of Arts, Culture and Community Services, is here to introduce this item. Pass it over to you, Ms. Singh.
Thank you, Chair Sandra Singh. We understand that Council has received, and we also as staff have received considerable communication with regard to this report, and in particular the recommendation around the lease to support the establishment of a BCH-funded OPS on this site. We put together a brief staff presentation to present the context for the recommended and reiterate the context for the recommended short-term lease for this overdose prevention site in the downtown south. Most simply put, the context is the ongoing overdose crisis, which has been impacting the downtown south for years. And OPSs are public health interventions that have been demonstrated to save lives. And so we feel that this is an important contemplation for Council. In making these comments, I would be remiss to not acknowledge local neighborhood concerns about the downtown south since the summer, when BC Housing leased hotels for relocation of people who are experiencing homelessness. While the establishment of these public housing services added important emergency housing stock for vulnerable and marginalized community members, these are new neighbors into the downtown south, and we recognize that the established local neighborhood residents have expressed significant concerns since the summer. As Council knows, BC Housing has established a community dialogue group to hear and discuss any community concerns, and city departments such as ACCS and engineering are working with BC Housing, the operators, BCH and DPD, and others to mitigate concerns. Despite these challenges, which we continue to work on with community and partners, I cannot state enough the need for overdose prevention services in the downtown south predates the summer's hotel deployment, and that an OPS will save lives. As you'll hear from staff, extensive work was undertaken by BCH in the city to try to find a location, and there has in fact been a mobile OPS operating in front of this site since May. The recommendation today brings the service indoors instead of leaving it in a van alongside the sidewalk. In the presentation today, staff and partners will outline the establishment of an OPS, citing requirements and processes for establishing an OPS, and will provide some additional information that we hope will be helpful for both Council and community members who are here today to speak and to listen. Mary Claire Zach, our Managing Director of Social Policy and Projects, will provide the staff presentation. And joining us for the presentation today and to answer questions from Council are Chris Van Veen, Director of Strategic Initiatives and Public Health Planning from BCH, Guy Felicella, Peer Clinical Advisor from BCH, Isaac Malmgren, Department Manager for Rain City Housing and Support Society, and we also have Bill Spurn, Acting Superintendent for the Vancouver Police Department. So with those very brief opening remarks, I'll turn it over to Mary Claire Zach to start the presentation.
Thank you, Sandra. We also have John McCormick is here from Fire, and Diana Herker will also be assisting in responding to questions. So we could go to the next slide. That just really summarizes the report recommendations that we're here to talk about today. And one of them is to negotiate and execute a modification of Swan's existing lease, and also to approve recommendation to approve Rain City Housing Support Society to create an overdose and operate an overdose prevention site at the space where Swan is currently located, and then to authorize the Director of Real Estate to negotiate and execute this lease. And I just wanted to comment that the reason why this space became available is because Persons with AIDS Society decided after many, many decades to shut down its operations. And it's very unusual for us to be able to actually have a space given the dearth of social and health service spaces in the city generally. In the context of the overdose crisis, this next slide shows the local health area, the year-to-date calls that Vancouver Fire and Rescue Services has received. As you can see, the majority of the calls are in the downtown east side, but the second highest number of calls where our fire and rescue services are pulled to are in the vicinity of 1101 Seymour. The next slide just demonstrates that this area of Vancouver is in demand for an overdose prevention site, and the area of downtown south has the second highest of all local health areas, second highest number of calls, including almost equal to all other health areas, services outside of the downtown east side. And you can see that's consistent from 2017, from the time that the overdose emergency was declared by the province. This slide shows the Vancouver and Fire Rescue overdose calls locations starting since the epidemic was declared January 1st through to October, showing that overdoses do take place across the city, but again, the vicinity around 1101 Seymour in the downtown south is the second highest area of demand for calls for fire. And the next slide here just really reinforces that Vancouver continues to be dealing with the dual health emergency, the emergency around the overdose crisis. Vancouver is still in the epicenter of it, and it has been worsened as a result of linked to COVID as well. So what we're seeing is a spike and an increase in overdose deaths that is similar to what we experienced in 2018 after seeing a decline in 2019. And this slide here shows that the number of annual overdose deaths in the city of Vancouver across the city. And what you'll see in 2019, as I mentioned, there was a reduction in the number of deaths, and we know one death is one too many, but we're still seeing some improvement. And what we're seeing now is in 2020 through to the end of August, this slide shows that we are more on track to be reaching death rates that are as high as 2018 levels. And again, this slide just shows the overdose deaths in the city, and again, looks at the connection between the public health emergency of COVID-19 and overdose deaths, partly due to the fact that the supply has become more lethal, social isolation, and other issues that VCH can also speak to. In terms of the response, it is a public health, city and community response that we are looking at here. As Sandra Singh mentioned, overdose prevention sites, they are funded by the city. They are typically operated by nonprofit or community health providers. They are part of the city's approach to work with Vancouver Coastal Health on the 4 pillars approach to drug policy, which is decades old in the city. And the site will secure spaces for drug users, also provide them with access to treatment and safe supply. So and then further addresses stigma as a key barrier to service access. When Vancouver Coastal Health was looking for the selection of an overdose prevention site, they provided staff with these criteria. And as you'll see that the space that was identified for Vancouver Coastal Health and for Rain City to operate fits within this criteria. And as Sandra Singh mentioned, that the need and the demand for this space was actually predated COVID even. And Vancouver Coastal Health has been looking for space here for quite some time. Next slide. This slide just shows the proximity of the overdose prevention site. They're showing that in May 2018, the first overdose prevention site located outside the downtown east side was in a tent located at the Thurlow Street entrance outside St. Paul's, also operated by City. And since May 2020, Portland Hotel Society has operated a mobile van located outside 1101 Seymour. And the hours of operation are there as well. And just to note that there was a consultation done on the location of this and the siting of the van that has been in operation since May 2020, both with fire, VPD, as well as community. Our next step that if should council approve the staff recommendation, staff would work to negotiate a lease terms, both with Swan as well as with Rain City Housing Support Society. And we would be looking at actually the service agreement or the lease terms are actually much shorter than we normally would have for other types of social services. Normally we'd have a 5 or 10 year lease with options to renew. So this space, the lease terms are actually much shorter than what we would typically be providing. We know that Rain City has well-known expertise in cultural safety, in gender inclusivity, and that their approach to operating spaces is to really work with the neighborhood to make sure that the service works well, both for people who need to use the site, for people who use illicit drugs, as well as for the community. If council chooses not to approve, Vancouver Coastal Health, they will continue to operate the mobile van that has been operating since May. It will, however, impact the quality and the quantity of services that people who use illicit drugs are going to be able to access. VCH will continue to look for an indoor space in the neighborhood based on the need. And there won't be an indoor location at the moment where drug use can be relocated until a new indoor space can be found. And that is going to be a challenge because the staff did do a very thorough review of where to operate and where an overdose prevention site could potentially be operated. So the last slide, I'll just go over what other sites that were considered looking for the service. There were a number of other sites that were considered, identified here, including the Three Bridges Clinic as a clinical site, which is over capacity, and it would not be as a clinical space, not appropriate for an overdose prevention site. Inside public housing building, converting housing units or rooms, which are also not appropriate location for overdose prevention, and because it does require a storefront. Did staff consider the proximity to the park or other local services or community service providers? Just a note here that there are no restrictions on the locations. The zoning in this area does permit social and health use, and that the city has very limited space available in the downtown, and the service fits well with other services in the building. And the service providers in this building at 1107 were willing to move to make space for the overdose prevention space and site to be operated there. The other question that council has received and that we have heard is, why was there no community consultation as to the use of this location? It's because it is an OPS site. It's a temporary emergency health services. It's response to a public health crisis. It certainly fits the zoning in the area so that VCH can lease the site that meets its service needs. VCH does typically inform the neighbors close to at the beginning of an overdose prevention site, and Rain City, as I said, typically does work with the neighborhood in ensuring the safe operation of its services. And we would also expect that the VCH and Rain City, as I mentioned, they would engage the local neighborhoods and address any impacts if there needed to be any kind of mitigation. Also, just a reminder again that there was consultation and review at the time when the van was situated at the same location, just next to 1101 Seymour. Okay, that concludes the staff presentation, and we have presentations also from Vancouver Coastal Health and Rain City.
Okay, great, Mary Claire. So I'll go from there. Chris Van Veen, Director of Strategy and Public Health Planning at Vancouver Coastal Health. And through the chair, I'd like to make a few remarks, just in some cases reiterating things that staff have said in their report, which is quite detailed and very accurate from our perspective. I'd just like to reiterate that historically, but also in the context of COVID, looking at the breakdown of overdose events and overdose deaths around Vancouver, the city center local health area has always had the second highest number of overdose events. But really, in the context of COVID, and as you would have seen in slide 8 from staff, we have had a substantial increase in overdose deaths since the public health measures have been put in place. And so I think the need in that neighborhood has never been more urgent from our perspective. This is also consistent with engagement that we've done with the Community Action Team in Vancouver. That's a team that's led by the city, co-chaired by Mary Claire, Zach, and I. Over the past 3 years, consistently, one of their top 4 priorities at the CAT has been to work together to establish additional overdose prevention services in neighborhoods outside the downtown east side, where roughly half of the deaths are occurring, and yet services. Service access is scarce. So in response to that and the rising overdose deaths throughout the pandemic, in May, we did make the decision to deploy the mobile OPS to the same block as 1101 Seymour. From our perspective, that service has been well used. The feedback that we've gotten from service users in the neighborhood is that they would continue to use an overdose prevention service, that there's a need for the service, but they would prefer an indoor option, especially as the weather starts to turn cold. So if granted the lease, our plan is to move the mobile OPS to another part of the city. This is the kind of logic behind having this mobile service in our toolkit, is that we sort of move it around the city and determine whether or not uptake of the service is good. And then if it is, we look to establish permanent services in those neighborhoods. And conversely, if we find that people aren't using the service, that we move on from that site and look to establish one in a different neighborhood. So with the OPS moving, to be very clear, if the lease is approved today, there's going to be no net increase of service to the neighborhood. Things will continue status quo. If the lease isn't approved, we're going to have to keep the mobile OPS service in place there because people are now relying on it for life-saving services. Having an indoor option in the neighborhood is going to provide safety for people who use drugs to come indoors and use highly toxic, dangerous substances under the supervision of staff and peers who can provide them with support. It's also going to provide an opportunity for people to safely discard harm reduction equipment like syringes, preventing them from having to discard those in nearby parks, alleyways, and on business enclaves. At the site, we're also going to be providing access to our overdose outreach team at BCH. This is a team that's new, quite innovative, and is really pro at connecting people to treatment, safe supply, and other social supports vital to help people stabilize in their lives. So the OOT team will work with Rain City to get people safe supply and treatment, other supports, if and when they need them. Rain City, from our perspective at BCH, is absolutely a highly skilled, experienced, trusted service provider, and we have full faith that they'll be able to run this safely. And I say safely not just for the participants and the staff of the program, but also for the neighborhood. Rain City has, done an excellent job at making inroads into many communities around the region. I've had the opportunity to work with them in the Sunshine Coast and seen the skill and tact and relationship building that they've demonstrated in launching new services there. And I think, we feel very confident that should any neighborhood issues arise, that between Rain City and BCH, we can respond quickly with key contacts for community members and local businesses, and we'll be quite willing to work with them in good faith to troubleshoot any issues that come up. And however, I think, as you'll hear today, there are going to be people who are opposed to this service. These services are still contentious, often when we're looking to set them up. And, as we go forward, like I said, we're willing to work with the neighbors in good faith. But at the end of the day, we are in the midst of a very serious public health emergency, one that's killing more people than COVID right now, that represents the biggest risk of unnatural death in our city and in the province. This is a neighborhood with a particularly high risk. And so I think it sort of behooves us as government partners to work together to challenge stigma by approving this lease and working with us to demonstrate that, just like the Dr. Peter Center that exists up near Nelson Park, it's absolutely possible for overdose prevention services to operate safely and to bring benefits to neighborhoods outside the downtown east side. And so with that, I'm going to turn things over for some brief remarks from my colleague, Guy Felicella, who's our peer clinical advisor and has a wealth of lived experience when it comes to accessing these services, and has been a real harm reduction champion for our organization, but also for the province.
Hi, everybody. Thanks for having me. So overdoses are up, overdose deaths are up, poverty's up, homelessness is up. In a recent coroner's report, there are more drug overdose deaths than homicide, car crashes, suicide, and COVID combined. COVID-19 has had an extreme impact on our homeless population, but also our drug-using population, with many services being limited, coffee shops only for takeout. People don't have a place to actually go. So they're using storefronts to stay dry or underground parking lots to stay warm. And it's just really, made it so challenging and hard on people that are already struggling with many social issues that an OPS in this facility would be life-changing. And, it's near and dear to my heart that both the supervised consumption site and OPS not only saved my life, but it changed it. And it's actually the foundation for the recovery that I've had today, because without this facility, I wouldn't be alive today. But also, which is really vital, is that my children wouldn't be alive today. And it basically gave me the ability to build a relationship with people in the facility. And I was struggling immensely for many years trying to get off drugs. And this facility gave me that relationship with people and the confidence and the ability to actually, look to improve the quality of my life. And not only did it improve the quality of my life, it saved it, changed my family's life. And not only that, but changed the lives of many of my friends that have followed a similar path. We're in a public health emergency, and drug users deserve health facilities. And this is really a health facility for drug users to move forward, to have a safe place, to have a warm place. But most importantly, because of this contaminated drug supply that we're dealing with, it gives the ability to build relationships with other health services. And a lot of the times, people that are using alone, isolated in back alleys, parks, or in the street, they're not connected to any services. And so an OPS in the area of Yaletown will actually help people connect to other services that are vital in, helping improve the quality of people's lives. And I think if we can get past that, the stigma and the discrimination that these sites are, the scientific evidence behind them is undeniable. It saves lives, it's changed lives, and it's done there's never been a death. And the stigma and discrimination from our society is actually adding layers of trauma to people that don't have the ability to use these places. They're using alone and dying because of it. And these are preventable deaths. And this OPS in this facility, where it's a high concentration of drug users for many years, decades. Drug users have been there before buildings have gone up in that community. It's been a high populated drug using community for many years. Obviously with COVID, it's compounded the situation where it just seems to be everywhere, but it's always been there. And having an OPS will give people that vital opportunity to go in, build relationships, and improve the quality of their lives. Thanks for listening.
Thank you. Thank you very much to staff and to all of our presenters. We have questions from council now, and I'll just remind council you have 5 minutes. You can let me know if you can't see your timer, and I'll give you a 30-second warning. And we will begin with Councillor DiGenova.
Thanks, Chair Boyle. I have a number of questions, especially after those excellent presentations, and I'm hoping to move for 2 rounds of questions right now.
Okay, that is, you're right. Do we have a seconder to that?
Yes, Councillor Dominato.
Seconded by Councillor Dominato. We can do a verbal vote to begin. All in favor of doing a second round of questions after we finish a first round of questions, say aye.
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 Any opposed? Okay, we will do 2 rounds of questions, and Councillor Dominato, Councillor DiGenova, you can start on your first round, and I will start your timer now.
Thanks so much, Chair Boyle. My first question is, and I really appreciate the presentation, But in trying to sort of understand the data and the numbers, I'm wondering what the proposed location on Seymour Street, it's downtown. I'm wondering if this is where an overdose prevention site is most needed, because we're talking about one location, sort of a commercial permanent space. And I'm wondering who could tell me what areas of the city currently have the highest incidences of overdose deaths right now. And overdose, I suppose overdose deaths would be where I'd want to start with that.
It's Sandra here. Maybe I'll ask Chris to speak to that from BCH.
Yeah, thanks, Sandra. Happy to. So through the chair, thank you for your question, Councillor DiGenova. It's undoubtedly the highest numbers and rates of overdose deaths are occurring in the downtown east side. However, that's a neighborhood where we have many overdose prevention sites currently in place, both indoor options where people can come and inject safely under supervision of staff and peers, and also where people can inhale their drugs as well. In addition to the downtown side,
thanks. That's just not my question. My question was specifically about stats. So who collects the overdose death statistics and information?
The BC Centre for Disease Control holds the dashboards regarding numbers of ambulance calls, overdose deaths around BC, and we have access to those dashboards. It's clear to me from those dashboards that the downtown side has the highest number of deaths, and the downtown local health area where we're proposing to establish this site has the second highest by a significant margin.
Okay. All right. And I was specifically looking for some numbers or some statistics, but I suppose you don't have those. Would anyone else have those?
Yeah, Councillor, it's Bill Spearn from VPD. We have those numbers.
Councillor DiGenova, we also have the numbers from the BCH and BCCBC. Okay. We can send those to council.
All right, that would be great. I was hoping to have them now. So, I mean, I'm not sure who just said they have them, but also just looking to see if, what neighborhoods and areas are experiencing the highest numbers. So was that Inspector?
Yeah, if I could, Sadhu, City Manager here, if I could jump in. We did send a memo to you this morning from Sandra Singh, which does have all the data in it. It was just sent about an hour and a half ago.
Thanks very much. Wondering sort of from an overdose prevention site perspective, VPD, do they have data on this? And I'll try and review that before my second round of questions, but also just wondered if VPD had any perspective on that in terms of public safety and where this is most needed in the community. Is there someone on from VPD? I thought I heard there might be.
Yeah, it's Inspector Bill Spearn, Vancouver Police.
Great. Do you have any information on that, or where we're seeing the most overdose deaths? Or
yeah, I do. Since the pandemic was declared, there have been 203 overdose deaths in Vancouver. The northeast quadrant of the city, which we refer to as District 2, has seen 122 overdose deaths, 60% of the total number of the deaths in the city. Of those 122 deaths in District 2, 110 occurred in the downtown east side, so well over 50%. The next highest area of the city for overdose deaths is actually the southeast quadrant. The VPD refers to that area as District 3, with 35 overdose deaths since the start of the pandemic, which is 17% of the total number of deaths.
Okay. So I have one more question for staff, and then I'll hop back on in hopes I can take a look at that, if that's all right, Inspector.
Yep.
My last question for staff, sorry, I'm just getting short on time here, is I was just wondering if there was any consultation done with Covenant House ahead of time, as we've received a letter from them.
It's Mary Claire Zach speaking. No, there was no specific consultation done with Covenant House for 1101 Seymour site, and I'd have to ask Diana or Chris to let us know if there was any specific consultation done with the mobile site with this.
Okay, perhaps those are a hint of my questions when I come back, and thanks, and sorry to cut anyone off, but I'll go back on the queue for those answers. Thanks.
Okay, thank you, Councillor DiGenova. Councillor Kirby-Young, you are next.
Thank you. Good morning. I'd like to start with a question related to slide 9, and that's the one that outlined the VCH criteria for OPS sites. And I understand that from VCH's perspective. Obviously, the city has to, manage communities and try to have harmonious communities that are accepting of all people. I'm wondering why there's no reference to any City of Vancouver criteria, such as trying to not locate near playgrounds, et cetera.
It's Diana Herford here from Social Policy. In terms of public consultation, this is a health service and a social service. So in terms of other types of recreation or retail services like cannabis or liquor stores, those are where there's proximity guidelines. There isn't proximity guidelines for a health service like a radiology clinic or another health service that would go in here. Certainly, we are looking to fulfill public health orders and in emergency overdose crisis, seek to kind of be rapid in response here. So this isn't the same comparison as it would be to a retail location such as cannabis or where supply is bought and sold. So this is clearly different.
So the city doesn't have any proximity guidelines. So we have no concern about location near playgrounds?
This is a health service, so it would be compared to any other health service.
Okay, I'm going to move on to slide number 12, please. And I know it said what other sites did VCH and City look at for the service, and one was mentioned was the vacant lot behind the Howard Johnson. I don't see commentary there. Can you speak to why that is not an option, or was not selected, or could not be considered?
So as this is a continuation of service, most of the consultation occurred with locating the mobile van. So this would be an additional in the Howard Johnson site. It was not available for this type of service. We're again looking for moving towards an indoor location, and that would be an outdoor location, and that's a private site not available at this time.
But would it be available for a mobile, or because it's private, it's not available at all?
It's not available for this service.
Because it's private? I just want to be clear. I'm not fully clear on the response.
It was not available at the time of consultation for a mobile or any kind of overdose prevention service.
But that consultation was done a couple of years back, I believe, according to the slides. Was there any recent discussion?
No, it was done in the spring during COVID to find a location for the mobile van.
Okay. In terms of consultation, and it did note also in the presentation that some is done by Covenant, or sorry, not by VCH, and I'm hearing feedback that the neighbors didn't feel that happened, and I do appreciate note that the rep from VCH said that they're willing to work with the neighbors. I'm wondering, further to the comments around trying to overcome stigmatization, why that appears to be an after the fact approach, as opposed to trying to work with the neighbors ahead of time and work on education or community forums or bringing people together, as opposed to let's do the lease and then we'll work with the neighbors afterwards.
It's Chris Van Veen from VCH. I could maybe speak to this a little bit. We obviously, when we put the van in the neighborhood, we did talk to local VPD officers, staff at the gathering place, other adjacent organizations, hotels, and so some consultation was done there. Staff have also been attending these community dialogue events where this topic of overdose prevention services has come up, and we've had an opportunity for dialogue through those sessions. And again, I mean, I think thinking of these services in the context of the emergency and the severity of the emergency right now, it's just that under the Public Health Act, we're required to set up these services very quickly, and consultation should not take precedent over getting services running to save lives. You might think of it like a gym that's appropriated to host people who are experiencing a forest fire in their community that could cause them death. There isn't consultation in those situations, and so similarly, under this public health order, we try to do our best, but our priority is setting up the service as fast as possible.
Okay. Thank you. I appreciate that. I'm going to keep going for time. I have a follow-up question for Inspector Stern. I just want to get some clarity. The VCH just mentioned there was consultation with local VPD officers, but the council had a briefing with Deputy Chow, who stated that the VPD had not been engaged or consulted in this discussion on the site. Can you clarify those conflictual statements for us, please?
Yeah, that's correct. I spoke to Deputy Chow this morning, and he confirmed that.
He confirmed that VPD had not been consulted.
It's Sandra here. Maybe I could clarify that that staff are clarifying that they consulted with BPD on the location of the van, but we did not redo that consultation on moving the service inside from the van into the building that it was parked in front of.
Okay. Thank you. That clarifies Deputy Chow's statements. I appreciate that. And also with respect to the stats, and I'm looking at some of the ones where you broke down the neighborhood sort of impacts and referenced the impact on the downtown east side, and they seem to run from January. I'm wondering if anybody can provide more detailed insight as to whether the overdose health calls went up after the location of folks into the Howard Johnson Hotel. Do we have a sense, because that period runs for the stats from January on? I'm just wondering if we saw a spike when the housing was located, when those hotels were utilized or opened up in July.
Perhaps Jonathan from the Vancouver Fire and Rescue Service could answer that.
Hi, Jonathan from Vancouver Fire Rescue Service. Can you clarify specifically what you're asking?
Yes, the stats that were presented for the neighborhoods, it says VFRS overdose calls January 1st through to October 4th, and it shows the downtown area as having the second highest with 410. I'm wondering if that's a consistent pattern all year, if we saw a spike when the house was opened up at the two hotels, including the Howard Johnson.
I'm not aware of a spike that occurred because of the relocation to the Howard Johnson. The calls have been consistent throughout the year and throughout the previous years, the division between areas of the neighborhood. The one thing that I am aware of is that when we connect with people that are looking for support services, over 50% of the people we're connecting are outside of the downtown east side. So that clearly indicates that there's a need for those support services in areas other than the downtown east side.
Okay, and then my final question right now relates to Covenant House and some discussions had with them and the letter that was mentioned that council has received. They're primarily youth serving, and I know that they have concerns around locating a more sort of, even though I know that these are temporary, but they tend to stick around for a longer period of time, a service like this within a block of youth who they're trying to put on a good path. Can staff speak to that?
Diana Herford, Social Policy, VCH, and Chris probably wants to add some more, but we know that that service or that housing site is down the street, and that given Rain City's strong relationship with youth, this also connects to services for the youth at Covenant House and those that are seeking to access that service. Maybe I'll ask Chris if he could jump in.
I think that's my time, so I'll come back on the second round for that.
Yes, thanks. And I'll just remind councillors to try not to ask a question right when your time's running out so that we have time for answers. Councillor Fry, you are next.
Thanks, Chair. Just off the top, just to clarify a comment that was made earlier, I think Mr. Van Veen possibly, if council were not to approve this location, is my understanding correct that there would be no change in the St. Paul's site would continue to operate in the meantime, so we would see no change in existing service from right now?
Thank you, Councillor Fry. The St. Paul service has moved indoors to serve patients of the hospital, but the main service that would remain in place is the mobile overdose prevention service. So we would need to leave it on that block because people are accessing it and it's saving lives. So if the lease is not approved, we'll keep the van there, meaning that there's still going to be this conspicuous, unideal option that will be on the street. So yeah, that's correct.
Okay, thank you. And Ms. Herford, you mentioned the consultation regarding the Howard Johnson adjacent parking lot was in the spring. So am I to understand that this was before BC Housing purchased the building and the parking lot in late June?
It was prior to, yes, Councillor Fry. It was in regards to looking for a place for the mobile van and to extend and enhance OPS services in this area in the spring, so April, May. So, and
my understanding is currently there is now just open an overdose prevention in the Howard Johnson itself in the mezzanine lobby. Is that correct?
There is services for residents, yes, in the Howard Johnson.
For residents, yeah, okay.
Correct.
So I'm curious a little bit about operational. There's not a lot on the operational side of this presentation, And I know from conversations with PHS when they were running the mobile van, I attended a number of times at Helmkin there because there was a number of complaints around this sort of street scene that had operated under the awning on the Helmkin side, and folks were concerned about that and met with the PHS operators, and they suggested that, in fact, the service model of delivery, and I've heard this from our staff as well, needed to be more focused towards folks smoking crystal meth, because that was more the population base in this vicinity. And as I look at 580 square feet for operational space for this proposal, where does inhalation happen? I know that OPS on Hastings has, a space adjacency for a tent, and I know the Insight has, a smoking area and obviously a lot larger footprint. How does this work operationally? How do we and do we have more crystal meth smoking? Is that more of a strategic approach? How's that going to work for people smoking meth?
Thanks, Councillor Fry. I think I can take a stab at answering that. You're absolutely right that we are seeing a large number of people who are choosing to inhale their substances, whether they're stimulants or opioids. That's consistent with the coroner's reporting as well. I think that there's some operational challenges around every site that we have, to be frank, around safe inhalation. Insight, for instance, does not have a safe inhalation area because the footprint is largely inside and there's no adjacent outdoor space that has sufficient distance from the back door to do that, although Sarah Blythe's site on Hastings does. We definitely need to establish more smoking services. At this site, it's going to be challenging to do that because there's no obvious outdoor area where we can section it off in sort of like a courtyard or a contained area. So that's still going to be a gap, but it's something we're working on across the city is implementing more opportunities for safe smoking, and we do have some funding to look at those options too. So we just need to be thoughtful about those and do them in places where they're outdoors, they don't violate smoking bylaws, and they're safe and discreet from the neighborhood.
Okay, so if we're not going to be doing smoking at this location, what is the operation for this location going to look like?
Injection and oral consumption of substances, so similar to like at Insight or the Maple or the Molson overdose prevention services.
So 500 square feet, this still seems, or 580, sorry, so it still seems quite small for operational and storage and all that kind of thing. How do we anticipate folks will they be lining up on the street to affect physical distancing? How are folks going to physically attend this location?
Yeah, good question. I think our assumption so far, and whenever you start a new service like this, you learn as you go, but our assumption so far is that this site is not going to be as busy as the sites on the 100 block of the downtown east side. I think our patient volume will be lower. The space itself will provide opportunities for a few booths. Rain City will manage the flow through. If there are folks waiting outside, we will put down sort of queues to keep physical distance. And it's just fortunate that the sidewalk happens to be quite wide in that area. So there'd be kind of safe ability for them to line up there, like if they were at a coffee shop lining up to get in, and people would be able to pass by without breaking the 2-meter barrier. But I'd be surprised if we had big lineups every day. I don't think this is going to look like Insight. I think it's going to look like a much more smaller, more quiet service.
So 2 questions, and can we collate inhalation with injection? Can we co-locate them? And if you had a magic wand and a perfect space, what would the perfect space for this kind of operation look like?
The perfect space for me is an indoor opportunity for people to use, especially when they're using orally or injecting, along with a fenced-in outdoor open air area that's private, adjacent to a site where people are able to inhale their substances. That's absolutely perfect. It just so happens that when we look at the space available to us, either through the city or BC Housing or Series or through the market, it's tough to find sites that fit that bill. So we've been looking diligently. We'd like to set up a couple more smoking sites this year, but it's been a challenge to find those sites for sure.
So if we had a 6,000 square foot provincially owned site just a block away, that might fit the bill. That was outdoors and could facilitate.
Okay, that's the time. Thanks, Councillor Fry. Councillor Bly, you are next on the list.
Thanks very much, Chair. Thanks to staff for the presentation. I just have a couple questions and one to continue on from Councillor Fry's. What is the capacity with safe physical distancing inside this proposed site?
Thank you, Councillor Bly. We have not come up with the operations plan or COVID safety plan yet. The first step was to get the lease secured, and then Rain City, we would work with Rain City to draw up the contract and approve the COVID safety plan. Because we're working with them directly, their COVID safety plan will be reviewed by VCH environmental health officers, ensuring that it is following all the best practices that we have, including the—
Got it. Thank you. Understood. Yeah. So just questions around, further to that, I'm assuming it might be the same answer around the conditions of the lease. In speaking to other experts who have successfully integrated safe consumption sites in this neighborhood, they seem to think that it was a bit premature to approve the site without ensuring that the lease would sort of appropriately place the accountability on Rain City to manage the site so that it did integrate positively into the neighborhood. And I see the conditions on one of the slides there around the criteria. And it's pretty vague on details in terms of what those lease conditions are. So I wonder if you can comment, is this typical process? It seems a little backwards for me to be able to confidently make a decision, and wondering if we can get any more insight there.
Yes, it's a good question. We do also, in our VCH contract with the service provider, have language regarding safe operations of the site, which does take into account impacts on the surrounding community. So we would include some language like that on our end. Typically, those aren't on the lease end. In my experiences with these contracts, it would be from the funder. But I think Isaac from Rain City is on the line. He may want to speak to this as well.
I wonder if we could just actually get some language sent out to council would be really helpful. I'm just mindful I don't have a ton of time. But it's more about the provision of sort of the specificity around lease requirements to manage the site and any sort of knock-on effects appropriately. But I'm going to continue on. It'd be great to hear back from people as we go through the day here. I have a question around a broader strategy to decentralize the downtown east side as it relates to ongoing supports for vulnerable people. Are we working on some sort of broader strategy here to decentralize what we see as a concentration of challenging and complex aspects to the downtown east side and find a better way to manage it?
Maybe I'll start and I'll invite Mary Claire or Diana to join in. But generally, we have experiencing homelessness or mental health and addictions all across the city. So what we try to do is site services where people are, but rather than necessarily requiring people to go from their neighborhoods into the downtown east side for service. But Mary Claire and Diana, would you like to speak to that as well?
That's Mary Claire, Zach here. That's the ideal situation, is that we site services where people are at. And given this situation, we tested the service just outside of this site, which it made logical sense to us to recommend that the site move indoors after this testing period.
Okay, thank you very much. One final question for Vancouver Coastal Health is, how are we doing with access to safe supply in terms of the new rollout by Dr. Bonnie Henry in the last month, and who's allowed to, nurses and doctors and people who are allowed to prescribe? I'm curious about an update. I've heard some mixed reviews on the accessibility and that rollout. So curious if you could just comment on that, please.
Hi, it's Guy. We're continuing to work with the College of Nursing and the College of Physicians on the rollout of safer supply, and are right now in the midst of working with the pharmaceutical division to see what drugs are accessible that we can roll out for the drug using population.
Do we have a number in terms of how many in that population have access to safe supply in the last month?
We do not at present, because we're working with some academic physicians on doing an evaluation of the project, so combing through medical records to determine that number. As soon as we get it, we'll bring it to council in our next sort of broader update on the overdose crisis. But it does, early results indicate that more people are receiving it in Vancouver than anywhere else in BC for sure.
That's my time. Thank you.
Thank you, Councillor Bly. Councillor Carr, you're up next.
Yes, thanks, Madam Chair. My first questions have to do around the size of the space versus whether or not it meets the needs. So the first floor of the site at 1101 Seymour is 580 square feet. How does that relate to the size of the current facility at St. Paul's?
Yeah, Isaac from Main City Housing here. I can speak to that. It's actually slightly larger than our current floor space. We are operating out of a 12 by, I believe it's 24-foot trailer at St. Paul's, about a third of which is currently storage space and egress pathways. So the actual usable area is about 150% larger than our current location.
Okay, good. And in terms of the people that will be using the space, my understanding, explain this a little better maybe, is that St. Paul's is planning to use the site at St. Paul's to be moved internal and used by people who are within the hospital. So right now, the site at St. Paul's must be being used by people within the hospital and people in the community. Can you break down for me about the different percentage, like how many people are from within the broader community versus inside? So about how many people we know there's 410 calls or whatever, but how many people are we talking about that actually do really need these services?
Yeah, so I can speak to that in a couple different ways. I mean, when we started operating the service at St. Paul's Hospital, we saw numbers in the realm of about 20% of service users at the site who were currently inpatient at St. Paul's Hospital. And the intention of that location was always to serve people who are accessing hospital, to make sure people were able to maintain sort of good care and still get safe consumption services. That's changed as our numbers have gone up. The percentage of people accessing the site who are inpatient or accessing services at the hospital has decreased. So numbers before COVID were looking more like 5 to 10% of service users who were inpatient, and the rest were coming from community to access that site. Since COVID and because of new infection protocols at the hospital, there's basically been a complete separation of those two service user populations, which is the reason that St. Paul's Hospital has started to operate internal services. Essentially, people are not able to leave the hospital to access safe consumption anymore. So the entirety of the service user population at that site is now people coming from community to access overdose prevention services. And just to give kind of a snapshot of numbers, because I think there was a question about that in there, we're sort of looking at between 50 and 70 unique visits per day on our busiest days. So as Chris mentioned, the numbers are really different than what we'd see at a downtown east side setting.
Right. Okay, that's good. That's helpful information. And these people who are coming from the community, they're coming from where? The West End, Granville Strip, Yale Town. Like, what's the, where do they live?
Yeah, I mean, it's, we don't have exact numbers because a lot of the data that we have is anonymized. We don't ask people to sort of disclose exact locations or addresses, but anecdotally and sort of via the relationships we have with service users, the majority of people are coming from the West End and Granville corridor. So people kind of right on the Granville Strip and then into the West End and sort of either supported housing or, a pretty good majority of our population are people who are not currently housed.
Okay, good. Thank you. And in terms of the timing, the lease was November 1st. What is the timing for the cessation of services at St. Paul's for people who are coming from the community and the opening up of the services at 1101 Seymour?
VCH may want to say more, but I believe the intention is to have that be a seamless transition. So the cessation of services at St. Paul's wouldn't take place until we were fully operational at a new location.
If I could have a confirmation of that from Vancouver Coastal Health, that would be great. Thanks.
Thanks, Councillor Carr. Yes, Isaac is correct. So we'd want to make sure that there was no days of service interruption and that transition was seamless. So it's just going to depend on our end if we receive the lease, just how quickly it takes us to install the equipment and storage and doors needed. But I suspect pretty quick.
Great. Thank you. Thanks. That's my time. Thank you.
Thank you, Councillor Carr. Councillor Dominato, you are up next.
Madam Chair. Yeah, a lot of my questions have been asked, but I do have a couple of follow-ups. One is just with respect to if we've given any consideration to additional mobile units. One of the things that emerged in past briefings we've had on the subject of overdoses is that in many cases, as you know, people are using alone, but that we haven't actually had great accessibility across the city. And I'm just curious, we obviously have the mobile unit there now, but have we considered additional mobile units both in that area as well as in other parts of the city?
Thanks, Councillor Dominato. Excellent question. We have considered it. To be honest, they are quite expensive to build and then to operate. So were we to get more provincial funding for overdose prevention services, we would consider it. But I think at this point, we have a couple of needle vans that go out and work with drug users to distribute supplies and come up with safety plans and give them naloxone. But this is our one overdose prevention site that's on wheels where people can actually come in and use. So I think we're going to keep deploying it in this way to other parts of the city that currently don't have services but are likely to need them based on the overdose dashboards that we get from the BC CDC. So yeah, I wish we had a couple more for sure. But in the meantime, I think this van so far has been really helpful in identifying which neighborhoods might work for this. So we're gonna keep working with partners to find additional locations to have the van parked for trial periods. And staff have been amazing helps on that front as well. I just got to give kudos to them.
Okay, no, thank you. And I mean, I think it's an aside, but I think there are some private partners that would be willing to partner with you, the Public Health Authority, around additional mobile units, but that's a different conversation. My other question is with respect to provincial health policy and the COVID response. Dr. Daly briefed council a few months ago and indicated in that briefing that there was an acknowledgement that provincial response may have contributed to the increased number of opiate overdose deaths because of the locking down and closure of social facilities, health facilities where people are gathering and able to use safely. Has that policy framework shifted now that we've kind of reopened the economy and the intent to sort of keep these critical services open, even if the numbers escalate beyond what we're seeing today, so that people are not using alone, so they do have a space to go?
Chris Van Veen from BCH. Yeah, absolutely. I think that early on in sort of March, the public health message around, self-isolate if you can, avoid crowded places or people that aren't in your immediate bubble did lead to more people using alone, undoubtedly. We saw our visit volumes to the overdose prevention services plummet. We've worked really hard to nuance that message to state that the relative risk of COVID and overdose for people who use illegal drugs should really be weighted to the overdose side. Overdose prevents a way, way more grave risk to their health at this point. So we have been encouraging people to come back to the sites. We've got great COVID safety plans at the sites. And we have seen visit volumes come up a bit, but they are not where they were, sort of pre-COVID. So I think we do still have a lot of work in terms of outreach and encouraging people to come back and feel comfortable and to understand the risk and to see the safety of using at the site. So yeah, working very hard on that every day.
Okay, thank you. I'll pause there.
Thank you, Councillor Dominato. Councillor Swanson, you are up next.
Yeah, I have two questions. Maybe I'll ask them both in hopes that the answers can both get made. The first is, has there been any sort of community uproar about the St. Paul's site? And the second is, when people assume that drug users as a group are criminals or a danger to kids or that they shouldn't be using the same parks as other people, what is the health impact on people who do use drugs?
I could speak to both of those. So the first question around concerns about the St. Paul site, there have been some concerns and complaints from community. We've been engaged with BCH and St. Paul's Hospital around a number of kind of responses, including the addition of security, addition of staff to sort of be able to usher people into the site in a safer way. I will say that a lot of the concerns that have come up have been around visibility of people waiting outside the site to access services, and those have all happened after sort of what's being called the lockdown at St. Paul's Hospital. So historically, service users were able to spend time in the hospital, use the washrooms there. There were a number of other places in the community where people could congregate, and as Chris mentioned, a lot of the public health orders and sort of direction around COVID has discouraged or completely precluded the possibility of people being able to congregate anywhere other than directly outside a service like this. There has also, unfortunately, been some pretty violent and unacceptable sort of responses from neighbors, including people in buildings adjacent to the site throwing eggs on service users waiting to operate.
Oh my God.
Yeah, so I mean, for sure, some response, but we've been, as an operator, Rain City takes this stuff really seriously, and we know kind of however misguided the responses can be, it's really important to make sure that we're building bridges with all of our neighbors, right? So we participate in a weekly meeting with St. Paul's BCH to address any community concerns. We make ourselves available as an operator for direct concerns that come up, anything related to safety. And then, to address the second point, yeah, like I think historically there is a dynamic where when sort of the safety of youth is incurred in conversations around services like this that carry a lot of stigma, it can create a lack of safety for service users. But more importantly, I think we need to mention the fact that youth are service users, right? And the same people who may be accessing a service like Covenant House and working on a recovery plan and doing their best to sort of, get on a new path, as people have mentioned, may also have moments where they need to access an overdose prevention service. And if those services are not accessible to them, the outcome for them is going to be the same as it would be for anyone else who suffers a fatal overdose, right? Regardless of their intentions or the other really great services that are being provided to them. And we've seen that dynamic over and over again in so many of the harm reduction services we offer. And we know that, we have strict guidelines around age limits for people, and anytime someone who we see as being vulnerable or who may be in need of different kinds of services presents themselves, we do everything we can to make sure that they're getting good connections to those services. But ultimately, assuming someone fits our mandate, we're never going to turn someone away if what they need is an overdose prevention service.
So in the stigma that goes along with these generalizations and stereotypes, what impact does that have on people's ability to get the help they need?
Hi, it's Guy Felicella, peer clinical advisor for BCH. The stigma and discrimination that impacts substance users, and even in my own life, was just as powerful as the substances themselves. I'd used in the Granville, Yaletown area, Robson area for decades. And without those services, and also the backlash, the trauma that's impacted from our society towards drug users really isolates you further. And the reason why people are dying alone is really the driving force. It's not just the drugs, but it's also the stigma and discrimination that exists in our society. And if in fact that facility was located, or if a facility existed in that area when I was using substances, I would have definitely taken advantage of using it there, just the same way as I took advantage of using Insight when it was implemented in the downtown east side.
So the stigma increases the risk of dying alone. Thank you.
Thank you. Thank you, Councillor Swanson. That is your time. Councillor Hardwick, you are next up.
Great. Thank you very much. We had a presentation from the
Councillor Hardwick,
board recently saying that crime.
Point of parliamentary procedure?
Yes.
I couldn't hear Councillor Hardwick's question there,
Yes.
Chair Boyle.
Councillor Hardwick, I'm going to start your time again. Your internet seemed to cut out for a moment, so try again from the beginning.
How about now? Can you hear me?
Yes, go right ahead.
Thank you. My question is, we had a presentation from the police board saying that crime is up across the city. Do you have any idea? I mean, everyone thinks that the community feel that this is going to attract more crime to the neighborhood. It will, even though we're talking about safe supply, it will attract drug dealers. I know the VPD is on the line here. Can you comment on what your expectation might be around increases in crime in this area?
It's Inspector Bill Spear in Vancouver Police, Councillor. Well, when it comes to these type of services, we are still forcing people to use contaminated street drugs and to buy those from the street in order to use inside of these facilities. And unfortunately, without a safe supply option on site, that's going to attract, predators to the prey here. And we expect to see drug dealers, come to these services if there's things like safe supply not available.
Wow. So the answer is we do expect more crime by putting this here because we don't have safe supply. Do you expect that there will be more need for VPD and sanitation resources in the area? Do you have any idea of the estimated costs of additional VPD and sanitation resources?
As far as VPD resources go, I would expect, like I said, without access to safe supply, we're going to see an increase in drug dealing and things like that in that area. And I don't have a figure, but I would expect we're going to have to deploy more members.
And someone else answer my question about sanitation, please. Anybody? Sanitation?
Sorry, can you repeat the question?
About sanitation. I'm wondering about additional sanitation requirements and costs.
Councillor Hardwick, it's Sandra here. I don't think that we're anticipating the need for increased sanitation. However, we'll keep an eye on that. The idea is that this will move some of the drug use inside versus sidewalks. So hopefully there'll be opportunity for needle collection here. One thing I do want to flag, though, is that we do anticipate there being access to safe supply at this site through the overdose outreach team. And I just wonder if Chris can maybe speak to that briefly.
Thanks, Sandra. I mean, and also on the sanitation front, we will be redeploying the Spikes on Bikes team, which is a mobile sort of harm reduction supply litter needle pickup service to the park and to the surrounding area, corresponding with the service. So that will help, and that comes from BCH's budget. On the front with the safe supply, it is true that if people overdose at the site or express a desire to get on treatment or safe supply while at the site, we do have strong connections to our overdose outreach team who can come. Get access to those clients, assess them for their addictions, and either take them over to the Rapid Access Addictions Clinic at St. Paul's or connect them with the primary care provider in the community that's able to provide those treatments and safe supply supports. So there will be that connection there.
We're talking about safe injection, so needles, but I also heard that we were talking about smoking crystal meth. So it's more than just safe injection, it's all drugs. And the sanitation that would be implied by that, right?
Yes, and the Spikes on Bikes crew are trained to recognize any harm reduction equipment. By harm reduction equipment, we mean pipes, syringes, wrappers, anything like that. They're a traveling team that cleans up parks and areas in the public realm, and so we would deploy them to this neighborhood corresponding with the launch of the
Thank you. In my last 30 seconds, we have City of Vancouver purchases and leases entire apartment buildings for client groups and housing similar to the Lugat and the Hostel International. And the ops site is located on Seymour Street. Do you have any concerns for public safety in this regard?
Councillor Hardwick, Diana Herford here from Social Policy. We, of course, have concern for all public and all safety, including drug users. And this is really where we've seen some really supportive and aligned safety increases, especially with our gathering place, the city's community center across the street, which is in most proximity to the proposed OPS location. And we're seeing actually an increase in addressing public safety with this centralized model for an OPS indoors, where everyone will likely experience that public safety increase with more support, more wraparound, more access to safe supply and other social health services, and generally an increase in the health of drug users for the health of the greater community.
Thanks. That is beyond the 5 minutes. Councillor Kirby-Young, you are up next. It looks like we're on to a second round of questions. Go ahead.
Thank you very much. I just wanted to follow up on some of the points earlier raised with respect to what's happening in the neighborhood and Councillor Blythe's questions around sort of lease requirements and managing the service. And it was mentioned with COVID that obviously people may need to be lining up outside. I'm wondering about the unique aspects of this location. I was there most recently yesterday afternoon, and the lineup with COVID restrictions for the gathering place stretched from before Helmicken all the way down past Nelson across the crosswalk and into the next block. And then, as mentioned, it's another one block down going south towards Covenant House. And so, you know, with COVID with us for a while, we're going to potentially see a 2-3+ block lineup for services of people outside. And it did take up the entire sidewalk there. I've observed a lot of people needing to cross the streets, but also wondering about the proximity to Covenant House. I wonder if considerations have been given to how that would be managed with this proposed site with those different groups and uses.
It's Mary Claire Zach. I can comment. I think one thing that's important to note is that Aunt Leah's is located at 1101 Seymour Street. They also serve youth, similar populations of youth as does Covenant House. And as was said, we would be looking to Rain City to be establishing those relationships with Covenant House as well. Aunt Leah's had no issues with the service being provided at 1101.
It's Sandra here. In addition, the gathering place will be heading into kind of phase 3 of restart, which will see expansion of services and kind of getting their operating hours back to normal, to pre-COVID levels. And so hopefully we'll also start to see less queuing around gathering place as that happens.
Okay. I'm going to keep going for time because I want to switch on to another question. And that's really around sort of the fact that we don't do consultation because of the emergent health nature of this and the fact that these are temporary sites. And I think that was stated a few times in the staff presentation. I'm wondering if we're at the point where we need to sort of change our perspective around this, because the opioid crisis and issues have been with us, as we saw from the charts and the stats, for a number of years now. So it's unfortunately not going away anytime soon, and everybody's doing their best to manage it. We're moving towards safe supply. But what has been the average tenure of those sites in the downtown east side? Because when they're temporary, they sometimes move locations due to leases, but they have been around for a number of years, haven't they? And do we need to take a different approach, recognizing that this has become a pretty consistent component of the harm reduction strategy, and find a way to better engage and work with the community as opposed to just suggesting it's emergent health response? Because it existed before COVID for some time, for a number of years, and it will exist after.
Chris, would you like to start?
Sure. So yeah, Chris Van Veen from Vancouver Coastal Health. You know, I think it's a fair question. The sites have been open now for give or take 3 years between all the different sites that we have. We have not done community consultations with the sites. We have not had this level of complaints, I'll be very honest, with these sites, including in areas, towns, or neighborhoods where they had never had these services before and where they were very new to them. So the backlash to this one, I think, has been unique. You know, I still think that the way in which we're being funded for these services behooves us at DCH to get to, once we have the funding for the services, to set up the services as fast as humanly possible. Now, of course, we want to do that through consultation with our immediate neighbors to establish a key point of contact for neighbors to send any complaints to, who commits to responding to complaints promptly. And Isaac and folks at Rain City are just such sweet, responsive, caring people that I think we feel very confident that they'll be able to manage those complaints. And if they need to pull DCH into those conversations, obviously I'm happy to be there to support them as well. But I think delaying a site for months to undertake a giant community engagement process really is going to lead to a number of deaths that we could have prevented.
So, could I just jump in with the last minute that I have? Because you did mention there would be no net increase in service here, and the mobile van is operating. And to the sort of the experiences you shared of what had happened at St. Paul's and some of those challenges, would it not be in VCH's best interest, as well as others, to try to consult with groups like VPD ahead of time, Covenant House ahead of time, to try to put plans in place and mitigate some of those outcomes when that experience has already happened? And it's not like we don't have the service in the neighborhood. As you said, this is not net new. This is a shift to an indoor site. So would it not be in everybody's best interest to try to work some of those issues and plans out ahead of time?
And today we're here to approve the lease. So once the lease is approved, we move towards the operations plan and start to work towards how we're going to staff and run the service. And at that point, we would work with partners and engage them to come up with any plans to mitigate unintended consequences for the community.
I don't think that addressed my question.
Thanks. That's the 5 minutes. Councillor Bly, you are up next.
Thanks very much. Yeah, I have a couple of follow-up questions to what has been asked. And one of the things in our presentation talked about relocating drug use. That was the phrase. Can I just get a little bit more information about what we mean when we say relocating drug use? I guess, is that outreach where we're out in the community and for people to come and receive support and sort of safety supervision and things like that, just to ensure that they're safe? Or is this more, we have a door open, we have a space, if they choose to come in, they can?
It's Sam here. I think I'll ask the team to jump in, but my understanding is that there would be some outreach to encourage people that are using outside, like on sidewalks or in alleys, to come inside. But Mary Claire, Diana, Chris, could you add to that?
Chris Van Beem from BCH, I can jump in. Yes, to answer your question, yes, we do sort of like active promotion of the services in the neighborhood through various outreach workers. I mean, to be honest, the VPD are often a very excellent partner in this regard, in redirecting people that they find using drugs in the public realm to the services that are close by. The Spikes on Bikes groups that I mentioned earlier also provides education for people about where nearby harm reduction services like OPSs encourages people to attend, and as would the local nonprofit organizations in the neighborhood. We have a regular Thursday overdose community of practice call attended by dozens of organizations where we update people on new services, send out flyers, information. To their clients and encourage them to use.
Great. Okay, that's helpful. Thank you. I have a question around the requirements. I think the language was that this type of service requires a storefront, but I also heard quoted a really great example of a well-integrated service in the community is Dr. Peter Center, and they definitely do not have a storefront. Their safe consumption site is embedded in their wraparound services, where they have meals and programming and counseling and things like that. So why are we teasing out this piece and requiring the storefront?
Again, I can speak to this briefly. There's a number of different models that have developed, really mostly in the past few years around overdose prevention services. Some of them are what we call HOPS, Housing Overdose Prevention Services. Those are often permit access for people who live in social housing units. They're great. They aim at reducing deaths in those units. We also have the community ones that are open and accessible in a storefront manner, like many of the ones in the downtown east side. And then
what I'm understanding is it's a different model. It's confusing, I think, for the public following along when we use an example like the Dr. Peter Center, when it's a bit of apples to oranges. So we need to compare this to other storefront locations as a sort of baseline comparison for us to be able to appropriately consider this. So I just wanted to really make that, so this is a different model than, say, the Dr. Peter Center model or others that provide more background services. So I just want to make that really clear.
Yeah, and this one also is adjacent to one of the busiest inner city community centers. So we do see it as having synergies with existing services, both in that building and directly across the street, where many of the people who will be using the service also get other services, similar to what happens at the Dr. Peter Center.
Right, okay, and I know there's a lot of services, so which outreach community center are you referencing there?
Place, which is across the street.
Gathering Place, yeah. Okay, and then the final thing is around the BC Housing engagement as it relates to the Howard Johnson, and we've actually received a number of emails from people who had initially reached out in the spring looking for more engagement and were recommended by City, and we as councillors were recommended to direct them to BC Housing, and there was a community engagement that somebody referenced. And what we've heard is those people have really not been engaged, and I just wonder if we can understand a little bit more about what that process looked like and how it seems some people who may have missed it could get caught up on what that community engagement was like and what it resulted in.
So it's Sandra here, and maybe I'm not sure if Diana or Mary Claire have further information. So the community dialogue groups that BC Housing set up were specific to the operations of the hotels that they had leased. In terms of my understanding is that what they did is they set up their dialogue group, and that's the main focus of their kind of direct discussions. I can follow up with council and get some additional information about how they're engaging with or how they're sharing information with people that contact them. But my understanding is they try to be responsive. This service,
that's actually well over the 5 minutes. Sorry to interrupt, and I'll just remind councillors not to ask questions right as your time is running out. But Councillor Fry, you are up next.
Thanks, Chair. So I'm looking at the Katy site for the St. Paul's OPS, and they identified one of the challenges as not having an option for safer inhalation services at that OPS, although they do give out screens and pipes and tubes. How do folks currently inhale at the Katy OPS at St. Paul's? Is there an outdoor space available for people to smoke?
No, there isn't. So the St. Paul's Hospital grounds is a fully non-smoking facility, so we've never been able to offer any kind of safe inhalation on the site, which is the reason that we give safer smoking and harm reduction supplies for people to take with them. But yeah, as you mentioned, it's always been a struggle because, of course, more and more people are switching to smoking as a method of ingestion, as a form of harm reduction.
But now, and Karen Ward helpfully shared a coroner's report from earlier this year that pointed to inhalation overdoses are increasingly on the rise, and in fact, intravenous overdoses are on the decline. Is this accurate? Are we seeing more overdose deaths as a result of inhalation, and we're not addressing that as a service?
We are seeing, Chris Sandine from BCH. Yes, indeed, Councillor Fryer, we have seen increased deaths related to inhalation. And we have been instructed by the ministry, and are working hard to establish more inhalation services, not just in Vancouver, but around the region. So this site, obviously, just given the space constraints, isn't going to be able to provide those services, but we are looking to establish additional ones in Vancouver and in other cities across our region.
So that'll be a secondary piece that we're going to be looking for is a safe inhalation location nearby.
Yes, corresponding to this work. So whether that's tagged on to another existing OPS or in a new one in close proximity, I think we still have a lot of work to do ahead of us here.
That's worrisome, because if these trends that were shared with me from the coroner report seem to indicate an upward trajectory, does this proposed facility have a chill out space? I note on the Katy site that it has a place for folks to chill out after consumption. Will this facility offer the same?
So sorry, I just was reviewing a question from a councillor member about this topic. Could you repeat your question?
So on the Katy site, it describes the OPS at St. Paul's as having a chill out space for folks to relax after consuming. Will this proposed location have a chill out space on site?
I'm wondering if I could ask Isaac to respond to that, or Chris.
This layout, because we don't have police yet, we haven't been able to go in and do that work. But as mentioned, the square footage is larger than our current operations, and we are able to offer a small amount of kind of chill out spaces, it's called, so people can be observed post-use. So I would anticipate that we'll be able to offer the same at this location if the lease is approved.
And the St. Paul's is partially in a tent though as well, right? It's in a trailer and an adjacent tent?
The St. Paul's currently is just a trailer. There's been talk of adding a tent, but currently the outdoor space is not sheltered.
Okay. Mr. Van Veen, you mentioned stigma, and just with the sort of remaining time here, and I do appreciate that there's a lot of anxiety around this, and how are we, if this fails, what does that say for stigma reduction, and how do we better address the stigmatization through best practice?
Yeah, it's a good question. I mean, I do think if this fails, there is a risk that many in the population will view this as failing as a result of stigma, and neighborhoods sort of, electing to organize to push out life-saving services in the context of a very serious public health emergency. So I think, we do need to do much more anti-stigma work. There's been some sort of provincial campaigns. Our Vancouver Community Action Team has done a number of different initiatives over the past couple of years to get at that stigma, but I do think it's deeply entrenched in our culture and in certain neighborhoods in the city. So the best way, from my perspective, to overcome it is to implement services, prove to communities that they can be done safely with minimal impacts or positive impacts, and change people's minds. And I know I've heard this from many DPD officers who opposed Insight, and then, a decade later, were great supporters because they were able to see the benefits of the site once it came to the neighborhood.
Thanks. That's the 5 minutes. Sorry to interrupt. Councillor Wiebe, you are up next.
And Councillor Fry just asked a couple of my questions. The one on the stigma, I know that there was a comment made that this would be like a coffee shop where people will be lining up outside, but recognizing the stigma associated with, and that some of the drug users might not feel comfortable being aligned in the community, are we looking at different ways to ensure that we have larger sites that people would be able to line up inside, or in a place that they feel that they might not be thrown an egg at, which was commented earlier?
Yeah, absolutely. We consider that with each of our sites. Although I would echo Isaac's comments about the clients, number of unique clients that visit the hospital site each day. And I don't actually envision in my mind giant lineups in the streets. We'll cross that bridge if we get there, but I don't think we'll need to. I think at present, certainly accessing the mobile van on the sidewalk is much more conspicuous. Is much more visible both for neighbors, offers less privacy to participants. So having an opportunity for people to come up in the site, and maybe it is that they come to the door and see it's full and go for a walk around the block and come and check back when it's 5 minutes later to see if they can get in. But I don't anticipate a huge lineup in the street. If there are, like we've seen in some cafes, we'll manage the physical distancing and mediate any conflict that could come up with neighbors, but hope that people treat each other with kindness and compassion.
And Isaac from Main City here, just a quick add. It's worth mentioning that the proposed space also has a pretty substantial lobby area that's inside the building, which would be able to accommodate at least a couple service users waiting for service, not on the sidewalk.
Okay. And then I'm also concerned about inhalation and that component of this conversation. It was stated that no net increase in services, and I'm just wondering, with the increased overdoses and increased deaths in the area, why are we not looking at increasing the amount of services available, including ensuring the safe supply and outreach? I'm just wondering why we're going to have a no net increase in services.
I think the answer to that is, well, we are trying to build a comprehensive infrastructure of addictions treatment and harm reduction services across the entire city and region. But historically, there's been very low investment in harm reduction and addictions treatment services. So we are really sort of like building the plane as we fly it. Getting that mobile service into the neighborhood was a great first start. I think it's proved to us the acceptability of the service in the neighborhood. Establishing a permanent site will fill a need, but not all needs. So we'll look to, subsequent to that, scale up access to safe supply and make sure that people who attend all overdose prevention sites are able to access that supply. that's the work that we have under our new regional addictions program. This is our totally our priorities for the next 2 years. And so we'll look to do that in other neighborhoods in the city too, but it was just very clear to us that this is the next neighborhood on our list in terms of where the needs are.
And you don't see a growing need?
There's a growing need in the context of COVID, but I think that my hope is that as time goes on, we're able to encourage people to feel comfortable to come back to overdose prevention sites and that our visit volumes are similar to rates that we had seen in 2018 pre-COVID. Then I think we'll start to see the numbers of deaths come down, because it's tragic right now that people feel like they need to use alone in their rooms in ways that are totally unsafe. And when we really need to do a better job at reaching people.
Okay, and we talked about how there's OPS sites available at the Howard Johnson. There'll still be some at the hospital and some other locations around the neighborhood. And then we're not increasing services. So I guess this question to the police: why would we think that by bringing something inside and making it safer and having access to safe supply and outreach, that we're going to need an increase in police when there's not an increase of services and we're providing safe supply and having more visual connection to these people?
Yeah, it's Bill Spearn from Vancouver Police Counselor. I guess the model of OPS that we're using, or supervised consumption site, is something that we've used since, back in 2003, which is allowing people to bring street drugs in. And, once again, we've progressed well beyond that now, where these sites should have safe supply, like right inside them. Like you said, services should be increased, and these sites should be in places where the deaths are occurring. And, simply put, there's other places in the city where deaths are much higher than where this site is being placed right now.
Okay, thank you very much. I don't have time for to ask another question. Appreciate the answers.
Thank you, Councillor Weeb. Councillor Dominato, you are up next.
Thanks, Madam Chair. I just want to follow up on a comment. I think it may have come from BCH staff, and it was around sort of the ideal scenario would be to have an indoor space as well as an outdoor space. And I'm curious, while the subject of the Lugat and Howard Johnson property has come up, I'm just curious if there was any exploration of, there's a restaurant that's part of the Lugat that's not used at this time, and whether that was explored as an indoor space, and then you would have the adjacent parking lot, which also belongs to BC Housing, as an outdoor space. It may require some renovation, but I'm just curious if that was explored as an option.
Diana, can you speak to this?
Thanks for the question. I'm not sure. We'd have to look back with CCH on that specific site. In regards to the ideal, I just also wanted to flag that often it's very difficult to find indoor and outdoor spaces adjoining, especially with smoking bylaws and other things to consider for an outdoor inhalation site. So while we are continuing to partner with CCH staff to find perfect sites, there's often some other considerations that are challenging for the inhalation sites. But we will follow up on that question directly, Councillor Dominato.
Thank you. My follow-up question, again, as well to BCH, is around the subject of stigma. Councillor Swanson raised it, and I agree that there continues to be a lot of stigma around substance use and addiction and mental health. And I'm also a believer that engagement helps break down stigma, and that opportunities for reciprocal dialogue and engagement and to foster understanding and education. Do you see an opportunity, or did you see an opportunity to do that in advance of this report coming to council?
Hi, it's Guy Felicella. I've actually spoken, I'm on a community dialogue group with the residents of Yaletown, and actually been reached out with a few of the members from that group who suggested and what would be better moving forward. And I said, well, you live in the community, and how many times do you walk past the same people without saying hi? And so we've come up with an idea and a plan, and I'm working right now for us to get together and bring some food, buy some food and some donuts to actually, meet the people in the community, because, when we do this, we build relationships with the people that are that are there. And, you know, a lot of the times when you hear people share about their stories and their struggles, you develop, you know, some compassion and understanding towards, you know, why, and understand a lot more that, you know, substance use is really one of those things that we live in a culture that uses substances, and getting to know the people and their stories is really a huge way to remove the fear that people have when they see it.
Great, thank you. That's it for my questions.
Thank you, Councillor Dominato. Councillor Carr, you are up next.
Yes, thank you. Several of the comments that have come up before and questions that have come up before prompted a few others, so thank you for indulging the second round. One of the things that was raised was Aunt Lee's place at 11 West Seymour, which are, of course, services for youth in foster care and single moms. So I'm wondering what the thoughts of staff are in terms of co-locating the safe ingestion site with the services provided by Aunt Lee's place.
Staff did, it's Mary Claire Zach speaking, staff did a lot of work with the existing tenants to ensure that their level of comfort in co-locating this space. And so that's what I can say about that, is that Aunt Lee's was fine with it, as were the other organizations, AIDS Vancouver, as well as Swan.
Okay, that's great to hear. Thank you. Second question, in response to the comments made, I think, by people from Vancouver Coastal Health regarding client safety at the St. Paul's site, and some of the very disturbing comments made about egg thrown and the need for security. Has the potential need for security been discussed in terms of the planning for 1101 Seymour?
I might pass that question to Isaac from Rain City to answer.
Great.
Sure, yeah. So, I mean, you know, the security was put in place specifically as a measure to respond to some of the new infection protocol that was brought into place at St. Paul's Hospital. And yeah, as you mentioned, in order to keep service recipients safe as they were waiting for services and accessing services, making sure that, you know, it's worth mentioning that our current service is located in the middle of the parking lot of St. Paul's Hospital. So there's actually a fair bit of foot and vehicle traffic that goes by. So the security is also there to make sure people are waiting in a safe area. I think for the new model, we would hope that security wouldn't be necessary. We've been able to engage additional staff whose sort of main role is to work with people as they're accessing the service. So that would include people who are waiting. And you know, our understanding is that trained support staff and peers are significantly more skilled around engaging people in a safe and kind way, and making sure that any sort of potential conflict or potential safety concerns are addressed, while also wrapping people into the services that are existing at the site, right? So I think security is never the best option in a program like this. Yeah.
Got it. What about the washrooms? A comment was made around the fact that at St. Paul's, people who had been waiting or whatever were using washrooms in St. Paul's, and of course COVID, and then couldn't, and there's been some difficulties in terms of access to washrooms in the community. What about the availability of washrooms for people wanting to use these services? In other words, washrooms in the immediate area.
Yeah, so that's one of the huge positives about this proposed location is that, first of all, the gathering place offers a number of services, including washrooms and showers, but also at the proposed location in the lobby directly adjacent to the main entrance of the space, there's a publicly accessible washroom. You know, one of the big struggles of St. Paul's has been that since the onset of COVID, essentially, we haven't been able to offer any washrooms to people who are accessing the service, which we understand is preventative for people even coming by and using overdose prevention services. So having that accessible washroom that staff would be able to safely and effectively monitor is a huge bonus for us.
That's great. Good information. And finally, in terms of, I think a comment that was made in answer to another question around the mobile van that's been there, that in fact, I think it was stated that that mobile van has verified the acceptability of services at the site. So my question is, there have been few or no public complaints about that van?
Yeah, correct. Today we have fielded few comments on it, although we've been keeping tabs on social media, and I have seen some negative tweets about the van, but no direct comments about specific incidents. The PHS who's managing that van is also an extremely skilled service provider. And so I think from their perspective, the fit with the neighborhood was good. They're able to manage sort of any of the conflict and relationships with the neighbors. And also just feedback from people who have come to use the service is that, oh my God, thank you, you're here. We've always wanted a service like this in the downtown core. The only way that they can go and get services is either to, walk several blocks over to St. Paul's or to take transit to the downtown east side. So I think we're going to be locating this service where people live and spend their lives, and this will be convenient and easy for them to access.
Thank you.
That's the time. Thank you, Councillor Carr. Councillor DiGenova, you are up next. Councillor DiGenova, you may be on mute.
Sorry, I was. I'd start asking my question. Oh, do you mind resetting my timer, Councillor Boyle? My apologies for being on mute there. My first question, I'd like to pick up where we left off. Oh, there we go. All right, Councillor Boyle, can you hear me? Can you hear me?
Yes, we can hear you, Councillor DiGenova. Keep going.
Well, if you could reset my timer, that would be great. Sorry, I was having some technical difficulties there. So I have it at 30 seconds. So
yeah, go right
hoping
ahead,
that's all right. Thank you. Just wanted to pick up where I left off. I believe the inspector was answering a question that I'd asked about overdose deaths, and Vancouver Coastal had answered, our staff had answered. But hearing that some of the higher instances are in Strathcona, and I wrote down South Vancouver unless I'm wrong, and just wondered if there are overdose prevention sites there.
Councillor, wondering if VCH might be able to answer in terms of time frame that data is collected and
perhaps. Yeah, that would be great. I'd just like to let the inspector finish answering the question though, because I had to cut him off because my time was running short, and then perhaps VCH could answer if there's time.
Hey, Councillor, it's Inspector Bill Spearn, Vancouver Police. So like I said earlier, 60% of the overdose deaths since the start of the pandemic, which is March 18th, have occurred in the Northeast, District 2. And, most of those are occurring in the downtown east side. I think 110 out of 122. The other concentration we see is in the Strathcona area. Second area of concern to us is the southeast, which is referred to as our District 3 area, where we have 35 overdose deaths since the start of the pandemic, which is 17% of the overall total for the city. And then that's followed by the downtown core, District 1, at 14%, and they have 18 overdose deaths since the start of the pandemic. So the downtown core is actually second to the bottom, really, when it comes to the number of deaths, and there are other areas of the city that have significantly more.
Okay, and Inspector, do you happen to know, and I'll ask VCH this afterwards, but I do have just a question on that, is does VPD have a position? Sorry to put you on the spot. Maybe you can send some more information to council after with a little more of those numbers, because I couldn't jot them all down. But just wondered, would you think in your experience that overdose deaths might decline if there were more mobile sites, to Councillor Dominato's earlier question? If that was able to come online in those neighborhoods, would that be
sure,
where the biggest need is?
Yeah, I'm willing to share these stats and send them out to you. I would say that the great thing about the mobile sites is that they can move around. They can go to where the hotspots are. That mobile van, before it ended up at 1101 Seymour, it was commercial and Broadway area for a while, which I still see from the map that was presented today is still a hotspot. So when it comes to services, we'd like to see these services where the deaths are occurring. We can't help people when they're deceased, and there are still some spots in the city that have much greater deaths than the area being proposed right now.
Okay, and then just a follow up to Councillor Hardwick's question on, I suppose, some safety issues or crime. Looking at property crime, and if there's not complete safe supply at this site, would you be concerned that there'd be property crime or increased drug trafficking? Has VPD seen that in neighborhoods, or is that an issue or not?
Yeah, it's an issue, and once again, we're using a model that was created pre-opioid crisis, and we're opening these sites without having, let's say, a MySafe machine on the inside where people can access safe supply, and then they don't have to commit crime in order to get the substance that they need. So, I mean, we'd like to see these evolve with the times and increase in services inside these places.
Okay. Maybe if you can send me some of that info too, or send all of council all of that info, that would be great.
Yeah, I'm happy to do it.
It's Sandra here. I wonder if maybe Chris Van Veen could speak to this as well.
Maybe Chair Boyle would also give me an extra 30 seconds since I was on mute for the first 30. Thanks. Of course, I'd love to hear that.
I restarted your time. Thank you. Go ahead, Steph.
I'd just like to clarify a few points there. So, we use local health areas. The VPD uses their districts for data. I think we can look back at the city slides that indicate hotspots for overdose calls in the city. It's very clear that the downtown core is the second highest rate there. And I think, deaths is one indicator. Overdose calls from ambulance and from fire is a better one in terms of looking at where people who use drugs live and who's overdosing. And so I think we can provide that data as well, which really builds a strong case that it's obvious that that's the best neighborhood to move.
Yeah, but these people are living.
Yeah. But we're seeing high rates of death there as well. So I'm happy to send over the verified.
I'm excited to get all of the information. I understand that's my time.
5 minutes. Okay,
I might go back on if I need to. Just a point of parliamentary procedure.
Yes, go ahead.
I just wanted to make sure that after speakers, will Vancouver Coastal and VPD be available to answer questions again?
Yes, we can do another round of questions after speakers if that is the will.
Will they be available? Is my parliamentary procedure question.
I can direct that question through to them or the city manager around availability.
I'd love to know because I might go on for a third round.
Yes.
We do have Vancouver Coastal Health on the speaking list, so we would get to them shortly once we finish the questions to staff.
Great, thank you.
Okay,
thank you, Clerk.
Thanks.
Councillor Hardwick, you are up next.
Thank you very much. Can you hear me okay?
Yes, we can.
Excellent. My understanding is that the objective here is to locate services where people reside. We're saying that this would serve people in the West End and this part of the downtown core. What do you say to the concern that people will be attracted from other parts of the city, other parts of the region to this location?
It's Mary Claire Zach. I'll start and then perhaps Chris can follow up. I think that the test pilot that's been going on for the last number of months has probably demonstrated that we're not getting massive numbers from outside of the area. Chris, can you comment on that?
I would agree with that, Mary Claire. Yeah, the people who are living and residing in that direct area are using the service and using it well.
I would hope there wouldn't be massive numbers of people coming into the area. I think it remains a concern, but I'll move on to my next question. The VPD gave us a presentation, including their work on counter-exploitation with this OPS and SWAN in proximity. Are there any specific considerations or concerns related to this for their respective client groups? Point is page 5 of the report states, SWAN is the only Vancouver-based sex work organization that focuses solely on indoor sex work with some of the most marginalized women, including newcomer, migrant, immigrant, and transgender women. SWAN advocates for sex workers' rights by providing advocacy. So there, again, with this OPS and SWAN in proximity, are there specific considerations or concerns related to this for their respective client groups?
Councillor Hardwick, it's Diana Herford. Just to reiterate the common theme here around criminalization of marginalized folks, and the need for us to really centralize and focus in intentionally on the services that folks need in this area and amongst client groups. So really recognizing this is a really important and safe place for people, including folks who are accessing SWAN, the need for privacy, for space, for access to washrooms, for access to services that are really going to address some of the key issues that are being raised across communities in a way that is dignified and with integrity.
It's Mary Claire Zach speaking. There's also a letter from the SWAN Board of Directors supporting their relocation, saying that it offers more privacy for folks who are using their services.
Thank you for that. We're very concerned about stigmatization and the impact on marginalized people. How do we balance this with the people in the community? I mean, this is the question, is it not? We seek support and respect for people that are using. What about the folks that are impacted, including their children that live there?
Councillor Hardwick, I think just to reiterate that the safety of the overall community is benefited by this type of service coming indoors and being more greatly supported by operators such as Rain City and really responding to those immediate needs. So again, we're looking at improving the public safety overall and looking at how that impact can greater benefit safety for all.
But what happens when they walk out the front door? It's great that you've got that inside space for people, but if you walk out the front door and you're high, is that not going to have an impact on the surrounding community?
Hey, Isaac Momgren from Rain City here. I think it just bears mentioning that, as we've mentioned a number of times, the people who would be accessing this service are currently residing or spending a large amount of time in these neighborhoods, right? So at St. Paul's Hospital, as I mentioned, the vast majority of service recipients are located within a, pretty small radius around.
But wasn't there someone recently killed? Wasn't there somebody recently killed there? I mean, this is having an impact outside, notwithstanding, if you're in the neighborhood. So what are you going to do about that?
So the point that I'm making, Councillor Hardwick, is that all of the behaviors associated with illicit substance use are currently happening in the neighborhood of the Granville Corridor and the West End, and the folks who are accessing these services, including survival behaviors that might result in violence, as you've mentioned, are people who exist in the neighborhood, are currently neighbors, are currently significantly more visible in the community than they would be if they were accessing services indoors, which is what we're proposing.
And the drug dealers. Okay.
Thank you. That is the time. And that is all of our questions to staff for now. So we will move on to hearing from registered speakers.
I just had a point of parliamentary procedure there.
Yes, go ahead, Councillor DiGenova.
I just wanted to know, after speakers, who's available to answer questions, like along with the staff team, just like they presented along with the staff team. Usually if they presented along with the staff team, they would be here to answer
questions. I understand your question. Clerk or City Manager, are you able to answer who might be available for a round of questions from Council after registered speakers? It sounds like based on...
Sorry, can you hear me okay?
Yes, we can.
Yeah, this is Saudi City Manager. Sorry about that, Chair. Well, I'm not sure about Vancouver Coastal Health, but definitely we will endeavor to have ACCS staff available. And I don't know whether VPD will be available. 100 speakers could take a very long time, so it may end up being later at night. So at this point, I'm not in a position to commit to the VPD, but we'll definitely have the ACCS staff available.
Okay, but would fire also be able to attend? at ACCS will be, and possibly Vancouver Coastal, they'll be invited back? That's my question.
We will invite all of them back. Yeah.
Okay, thank you very much. Then I don't need to request a third.
Okay, thank you, Councillor DiGenova. Seeing no other councillors on the speaking list, we'll move on to registered speakers, and a reminder that councillors can ask questions after each speaker. And I will also just make a reminder, as this is a challenging topic, to please maintain respectful comments and conversation, and I will monitor that to make sure as well. Our first registered speaker is a public body representative, Dr. Patricia Daly. Do we have Dr. Daly on the line?
Chris Van Veen here. I think Dr. Daly could not make it. She's managing the daily COVID huddle, so she sent me in her place. So you can take my remarks as hers.
Okay, your remarks that we have already heard. I just got a message from the clerks that Dr. Daly should be on, so just want to double check before we move on that that's accurate. But thank you,
Okay.
Mr. Van Veen.
I can check in.
Okay, thank you. We'll just give it a moment to see if we have Dr. Daly on. Okay, it sounds like we don't at this time, so we'll move on to Public Body Representative number 2, Isaac Malmgren from Rain City. Do we have Isaac Malmgren on the line?
Isaac's been speaking. Isaac, do you have more comments to make?
Sorry, yeah. No, I didn't speaking as well as the comments that I've made. So I think I've said about as much as I was intending to say today, and thanks so much.
Okay, great. Just wanted to make sure that we were covering everyone here. So Public Body Representative number 3 is Deputy Chief Howard Chow and Inspector Bill Spurn. Is there more to add from Deputy Chief Chow or Inspector Spurn?
It's Inspector Bill Spearn here. I have nothing else to add.
Okay. Thank you. So we will move on to speakers from the public. Speaker number 1 is Tamara Fraze. Do we have Tamara Fraze on the line?
A reminder was sent to Tamara, but she hasn't joined.
Okay. Speaker number 2 is Catherine Hallenzy.
Hello, I'm here.
Yes, we can hear you. You're a bit faint, so if you don't mind speaking up, you have 5 minutes. Go right ahead.
My name is Catherine Hallenzy, and I oppose the motion. First, I'll speak to community consultation. R6 was put on the agenda for October the 6th, and that meeting began with a presentation on a city plan, a vision, if you like, for Vancouver. This vision relies heavily on data accumulated through public engagement. One of the key takeaways from that has been citizens mentioning their eroding faith in local governments, a lack of transparency of local governments, and communities not having a way to get heard. I can understand that. The past 6 months have left me feeling extremely disappointed with some elected officials. The conversion of the old Howard Johnson Hotel to the Lugat Safe Injection site speaks volumes. There was no public consultation, in fact, just secrecy and obfuscation. We tried heavens hard to find out what was going on, phone calls, internet searches, visiting the Howard Johnson itself, and finally we got some information. $55 million, 110 ex-Oppenheimer residents, unvetted, and it's all temporary, under cover of COVID. A building housing a dilaudid vending machine, almost unprecedented in the whole of North America, is now in our neighborhood. And as far as the mobile addiction services van is concerned, for the Brava building and other buildings and businesses, there was no, I repeat, no consultation for those living right next to it. And now this. I am part of a community dialogue group. I had to ask about rumors that a safe injection site was going into 1101 Seymour. And it was confirmed immediately. And that's a community dialogue group. This neighborhood has declined massively in the last 6 months, and the LUGAT and the Mobile Addiction Services van is a part of that. This neighborhood has become a mecca for all sorts of increased drug activity and crime. The LUGAT has 2 injection sites inside, and I still see people using right outside on the street. We also see many dealers in big cars. Granville Street is now a war zone. Let me tell you what it's like to live here. Here is just October the 5th, which was yesterday of October the 6th, of course, when we were going to talk about this the first time. I leave my building from the back alley. I smell urine. It's strong. I feel nauseous. I walk into Granville. Outside the 7-Eleven near Nelson, 4 young men are sharing a crack pipe. I cross the road and I'm talking to some people I know when a young man, obviously psychotic, walks by shouting out a diatribe to no one in particular. A man walks by angrily and punches his fist at a shop window. I flinch. And by the way, smoking crack on the street on Davie, I saw that for the first time a few months ago. The man had a bike with him. My friend admonished him since there were children around. He shouted back. Then my friend and I continued walking up Davie. We're waiting to cross Burrard when suddenly a bike goes past and a bottle of strawberry pink milkshake is thrown at me. He speeds off hurling insults. That's his revenge. An assault in response to hearing a few words asking him not to smoke crack on the street. I am not stigmatizing. I am not marginalizing. I am feeling a normal human response to such behavior. That's how the world works. We are people here. We are not saints. We are not stereotyping. We have experienced many things that nobody who wants to feel safe in their neighborhood should experience. I lived in Crosstown for 17 years and left traumatized. Why did I stay for so long? Fear of making the wrong decision again as to where to live. And I hoped the neighborhood would get better. It didn't and hasn't. It's a war zone. And Crosstown has its safe injection sites, and I believe a dilaudid vending machine facility. And these facilities haven't helped law and order in that neighborhood at all. I'd like to add that I've talked to other women who lived in the Gastown neighborhood and came to Yaletown to feel safer. They feel as let down as I do. Many people are leaving Yaletown, but not. I'm not. I just moved here. I can't get out. And why should I? This is my neighborhood too, and I will fight for it. Why is this family-oriented neighborhood being saturated with these addiction services? I demand to know why St. Paul's, which already has an overdose prevention site and is so much better equipped to deal with the multifaceted demands of such a site, is not being used as it once was. And let's not forget that Thomas Donaghy, a worker at the St. Paul's overdose prevention site, was murdered at 8:30 p.m. in July in daylight. Do you want the same thing to happen next to a children's playground? I demand the respect due me as a resident of this neighborhood. I demand community consultation. I demand a vision for the future of Vancouver that works. Again, I refer to the findings from public engagement with communities as their vision for Vancouver. Like them, I too desire a 5, 10, 15-minute neighborhood access to green spaces. We have so few and such small urban green spaces. Emery Barnes Park is vital. It too is something to preserve and love. It's vital to family. It is and will continue to grow.
Thank you. That is your 5 minutes. And you have questions from Councillor DiGenova. Councillor DiGenova, you have 3 minutes for questions.
Yeah. Thanks very much. And I'm sorry, Councillor Boyle, I wasn't sure where we are in the speakers list. The speaker is?
Speaker number 2.
Number 2. Okay, of course. Thanks so much for speaking. Just trying to, I'm not sure what the background noise is there, but just had a quick question for you. Just thank you for sharing sharing your thoughts. And of course, we are in an overdose crisis, and there needs to be solutions. That's been noted, and that's why we're considering this today. I'm wondering, do you feel that consultation may have helped you to feel? I'm assuming you're speaking in opposition to this from your comments. I don't want to put words in your mouth, but do you feel that consultation with the community, having a way to have a dialogue or input may have been helpful in finding a site that you could have supported for this in your neighborhood?
I think that's the least we can ask for, because what's happened is the neighborhood has changed and people are left wondering what is going on. And there has been a marked increase in breaking and entering, serious assaults, thefts, all sorts of things. And we're just left bewildered by what's going on. So yes, there has been an attempt at community dialogue, but it's really just explaining to us what's going on with the Howard Johnson Hotel, and not really asking. We need some community dialogue at the very least, yes. And by the way, I want to speak quickly to this idea of the parking lot next to the old Hojo being used, Howard Johnson, as a site for a mobile van. It is right next to the Scotiabank Dance Center, which has hundreds of young girls and boys coming to dance every day, and they're losing customers. And they say that because of the inadequate management of the Lugat. So that's also, this is a family-oriented neighborhood. There are children everywhere. There's no good.
And do you, thank you for sharing that. Do you feel that there was an opportunity for you to share the way you feel and the fear that you feel? And, as you'd mentioned, some of the experiences that have brought you to feel this way. Like, for instance, when you had just mentioned a drink being thrown at you.
Oh, I didn't feel that at all. No, I have not felt that. I've just felt that I'm being asked to stop stigmatizing. I'm being asked to stop marginalizing. I'm being asked to just accept behaviors. And I think that was an assault on me. So,
thank you. And I'm sorry, I only have 30 more seconds or less now. Just wondered, do you feel you might feel differently, or you might be able to get behind something in your community to meet the need here with an overdose prevention site if there was true community consultation, as you've noted what that is to you?
Yes,
do you think that would be helpful? Okay. Thank you very much for your comments. Thank you.
Thank you.
Thank you. And those are all of the questions from Council for you. Thank you for taking the time to sign up and speak. We're moving on to speaker number 3. Thank you. Speaker number 3 is Michael Geldert, Director of Safer Vancouver. Do we have Michael Geldert on the line?
Good morning. Michael Geldert here.
Good morning. We can hear you just fine, and you have 5 minutes. Go right ahead.
Good morning. My name is Michael Geldert, and I oppose the recommendation to modify the lease for Rain City Housing. I believe an overdose prevention site at 1101 Seymour must be rejected by this council today. I speak today as a husband, a small business owner, a neighbor, and a father living and working several blocks from 1101 Seymour Street. As a husband, I'm being told by my wife for the first time that she doesn't feel safe in the streets and parks around our home. And before 2020, she'd never had occasion to phone the police, but in 2020, she's told me she has VPD on speed dial. She is the most fierce and courageous woman I know, and I am immensely frustrated that she no longer feels safe in our community. As a business owner, I believe it is critical that we support all local businesses in this community. COVID-19 has forced us to adjust how we do what we do to give us a chance to continue doing it in 2021. Many have not survived. Many more are on the brink of insolvency and surrender. Many of our clients and customers have been driven online, and at this critical time, we cannot afford further decline to walk in business. This sector of the community, a sector that brings money into the city, feels ignored. These are businesses that will depart the community if their needs continue to be ignored. As a neighbor, I'm told by more and more seniors that they do not feel safe talking and taking walks in the community that they've enjoyed for decades. Stabbings in parks, daily public overdoses, and aggressive and threatening behavior by people they don't recognize are forcing them to stay indoors. At a time when a walk through one of our parks may provide a singular and necessary reprieve from the feelings of isolation brought on by COVID-19, my neighbors, my friends, our elders are retreating into their homes and they are locking their doors. As a father, I've been increasingly concerned about the increase of open drug use in the area around my home, particularly in 2020. This concern turned to outrage this summer when my 2-year-old picked up a used needle while playing in the children's playground at Emery Barnes Park. It was only luck that allowed me to intervene before any harm was done, but it is a visual I will never be able to forget. And I do not want that for another father or mother in this community. Our city is facing a terrifying crisis. My neighbors, friends, and family who moved to Vancouver on the promise of living in one of the world's best cities are now actively seeking a way out. They feel ignored. They feel like second-class residents. Homelessness is growing in our city, but it is not the only crisis. And I want to be clear, No one should lose their life due to untreated mental health or addiction issues. And no neighborhood should feel unsafe because of this problem. Steps to address addiction issues must also ensure community safety. This council is tasked with maintaining this balance, hoping to work towards harm reduction solutions while ensuring the further decline in community safety is the issue being voted on here. And why are we speaking today? We're speaking today because of the surge in interest from within this community to speak to council. However, many of my neighbors couldn't be here today. They've told me via text message or via email that they took 1 day off work last week and 2 days off work was simply impossible. They regret not being able to speak today. We're speaking today because the playing field remains compromised. Our mayor's website's been updated to provide a fill-in-the-blank form, with the most important part being pre-filled, namely, and I quote, "I write to ask you to vote in favor of approving a permanent indoor overdose prevention site." In fact, you're unable to submit the form if you don't agree with the mayor's vote in favor of the site. On behalf of myself, my wife, my fellow business owners and neighbors, I ask that this council address this bold attempt to interfere with the voice of the community. We're speaking today because there is already an OPS at St. Paul's in the former Howard Johnson Hotel, and it seems obvious that a much larger site is required than what is proposed at 1101 Seymour. With social distancing, these sites don't appear to have the space to operate safely, and absent community buy-in only increases the risk of stigmatization. It appears the only guarantee of new OPS sites is the need for more OPS sites. And finally, we're speaking today because the community dialogue remains virtually non-existent. Safer Vancouver exists today because of that. Characterizing this site as emergency health has ensured that the only requirement to engage in meaningful dialogue has simply not happened. Many of my neighbors are afraid to speak publicly because they are afraid of being labeled NIMBY, and many are tired of calling the Vancouver police only to be told frankly that there's nothing that can be done. Apathy and outrage needs to be measured, and we don't have that in the statistics that are before council today. Community safety has been allowed to get out of control in our neighborhood. Open and meaningful dialogue with all sectors of the community must be a precondition before this council considers adding another overdose prevention site to a location that is some 100 meters from where children play. There are a range of solutions that will require significant support from the public to implement. There will be a range of costs, and I believe consultation with residents in Vancouver is a necessary step to securing the evidence, the truth, and the buy-in required. Thank you.
That's your 5 minutes. You have questions from councillors. First up is Councillor DiGenova.
Thanks very much for making the time to speak and sharing your personal experience on behalf of your family. I'm going to try and steer away from sort of the public safety questions because I actually have a motion on the agenda that I'd put forward that will come up at a later date, but I put forward not even knowing this would be on the agenda. So my question to you was, first of all, you had noted something about you have to sign something in support before sending it, and if you don't, it won't be sent. Can you share a little more with me on what exactly you're talking about? Because I'm not exactly sure about this.
Sure. I in consultation with a few of my friends here this morning in preparation for the call today, we looked at the mayor's site, and there's a sub-page set up asking for people to complete the form and communicate with council, but it actually doesn't allow you to submit it unless you agree that you want council to vote in favor of the overdose prevention site at 1101 Seymour.
Okay, so you can't submit just any comments to council.
No, and that's critical. That's absolutely critical because Safer Vancouver has not, in communication with anyone who've reached out to us, been advocating or telling anybody to vote one way or the other. We're saying, speak, tell your stories, make sure that council are in the best possible position to know exactly what is going on so that they can make an informed decision on your behalf.
Okay, thanks. Well, I have said I'm not criticizing anyone who's not here, and I won't speak for anyone who's not here. So I'll leave the questions there at that. But I do have a question for you on sort of the same question that I had asked the speaker before you, which is, had this been done differently, and I mean, I have said that I'm very much supportive of safe injection sites and the 4 pillars, so I think that's fair. But looking at the neighborhood to kind of support it, or else we might, start at a place that's not good, that might not set this up for success. Is that a concern of yours? And do you support, safe injection sites overall? Would you have been able to support this? As you said, you were in opposition. if there was more consultation or if you felt that your opinion was asked for or considered in this.
I think Ms. Lanzi spoke really well before me this morning, and I think much of what she had to say echoes what I'm here to say, which is I'm one person and my voice matters, but I think council needs to be in a position to hear from as many voices as possible and in a way that really allows them to assess, look, are the four pillars actually working? What paradigm shift might we suggest that would allow for more effectiveness? We don't want more. More isn't better.
I have 20 seconds left. I'm sorry to cut you off, but is it troubling to you that Covenant House was not consulted in this?
It's troubling to me that there isn't consultation, meaningful consultation with everyone who's in a position to help.
Okay, thank you very much. Thanks for answering my questions. That's all my time.
Thanks, Councillor Kirby-Young. You are up next. And before I start your timer, I will just let the public know that council will be recessing on this item from noon until 1 for a lunch break, and we will come back at 1 to continue hearing from speakers. Councillor Kirby-Young, you're next, and I'll advance you now.
Thank you. Hi, Mr. Geller. Thanks for being here to speak to council. I know the date change was challenging for people. I just wanted to ask a clarifying question of something you said when you referenced that you had received an email from the mayor, and it positions this as a permanent indoor overdose prevention site. But we heard from staff today that these are temporary sites or emergency health measures and responses. So, did you find that confusing, and is that correct? You're referencing the mayor's email that calls it a permanent indoor overdose prevention site?
Thank you for the questions. I didn't receive an email, but I did have the mayor's site, which I reviewed myself this morning, which had it up. I find that incredibly troubling, to really answer the point. I believe that, and I agree with your comment this morning, engagement does break down stigma. And that's really where I'm standing today. What I'm most furious about is it seems to me that trying to impose from 30,000 feet down into this community, a piece by piece answer to a proposed solution is the wrong way to approach this. And what it tells the community, it certainly tells me, and this is how I feel, that I can't be trusted, that I'm someone who stigmatizes others, and I'm going to have the wrong things to say when it's actually quite the opposite. And I can say from the people that I've spoken to in this Yaletown community, that's absolutely incorrect. And there's a significant risk if you continue to tell people what they think and what they feel, that in fact they're going to leave or they're going to simply come around to the possibility that maybe that is how they should feel. And that's what I don't want to happen. That's what the mayor's attempt, at least at what it looks like to me, actually risks.
So you do feel that maybe it's changed the paradigms about actually having meaningful discussions with the community as opposed to just saying, well, this is a health measure, so we should put these in, because they do, to my question earlier, seemed, unfortunately this crisis is with us and we have to deal with it, and the temporary nature has been pretty long duration and it doesn't seem to be going away. So you really do favor community engagement? Is that right?
I favor community engagement, and I don't consider, a 1 year, 5 month lease to be temporary. I agree with what appears to be on the mayor's site, which is that this is a vote in favor for a permanent site, which I do oppose.
Okay. Do you have any comments on what you heard earlier around the fact that we're continuing with the same model, if you will, of line picking and street drugs, but the statement that was made earlier that this doesn't include a MySafe machine, or trying to pivot towards safe supply in a more robust way?
I think, as I understand it, I'm certainly nowhere near proficient or knowledgeable in this area as much as I'm hoping to become in the weeks and months to come. But I believe that community outreach and community safety is one of the 4 pillars. And I think absent that, you're going to end up with a table that's going to fall. And it's going to fall at tremendous expense to the public. And it's going to fall at tremendous expense to the people who absolutely appear to need significant and meaningful services, which I'm not satisfied.
That's the 3 minutes. Councillor Carr, you are up next. I will advance you now.
Thank you, Mr. Geldert. I just have one question, and it's around the fact that you have mentioned that the local residents, yourselves and others in your area, have seen an increase in open drug use, needles, threatening, aggressive behavior. I'm just using the words that you used. Can you tell me over what period of time you've seen this increase?
Thank you for the question. It's dramatically after Oppenheimer closed. It was. I've been in the community renting here. My home has been here 13 years, and the last 6 months it's noticeable. So that appears to have been the trigger.
Okay, thank you. I will do follow-up questions to staff around that, but thank you for coming to speak to us.
Thank you, Councillor Carr, and thank you to the speaker for taking the time to sign up and speak. Council, it's just a few minutes before noon, so I'm going to suggest we get a motion to recess for lunch.
To recess for an hour.
Motion to recess from Councillor DiGenova. Do I have a seconder?
Second. Councillor Dominato.
Thank you, Councillor Dominato. We have a motion to recess for an hour. We would come back at 1 o'clock to continue hearing from speakers, and the next speaker on the speaker list would be speaker number 4. We'll do a verbal vote on this one. All in favor, say aye.
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 And
Aye.
any opposed? Okay, that motion passes. So just to let the public know, to be clear, we will now break for an hour. We'll be back at 1 o'clock to continue with speakers, starting with speaker number 4. Thank you, everyone.
I think Councillor Swanson is there. Yes, I see her. Yep, you're ready to go,
There she
Councillor
is.
Boyle.
Okay, I will call this reconvened council meeting back to order. We are on the speakers list on speaker number 4. Do we have speaker number 4, Teresa Mund, on the line? Speaker number 4, Teresa Mund.
We're
Good
just
afternoon. Thank you for joining the teleconferencing line. The meeting will reconvene momentarily. Please stand by. Thank you.
we're ready for speakers now.
Okay, thank you, clerk. Speaker number 4, Teresa Mund. Are you on the line, Teresa Mund?
Hello. Yes, I'm on the line.
Yes. Great. We can hear you now. You have up to 5 minutes, and I will start your timer now.
Okay, thanks. Hello, everyone. My name is Teresa Mund. I'm opposed to having an overdose prevention site at 1101. This site is directly across from Memory Barnes Park, where children play. I have 2 grandchildren who play in this park. I know friends who have children, friends who walk their dogs in this park. I don't believe this location is the best choice for the overdose prevention site. Parents especially rely on the playground, but many people are no longer going to the park. Feelings range from feeling uncomfortable, they're to downright afraid. I've seen and heard things that no child, let alone an adult, should hear. For example, about 2 weeks ago, there was a man in the playground shouting, F you, and threatening a parent. I saw and heard this from my balcony on the 25th floor. We already have so many addicts who are now lying in a park and sleeping off the effects of being high. Understandable, but very difficult for local residents to deal with. And another thing, if you're looking at the parking lot next to the old Hojo, that is not the acceptable place. The Scotia Bank Dance Center, where hundreds of young girls and boys come to dance every day. These people are already losing customers thanks to inadequate management of the Lugard. If you care about our neighborhood, please realize what is happening here. If Yaletown and downtown South neighborhoods deteriorate, it will affect the whole downtown. If the whole downtown deteriorates, the effects of the city and its worldwide reputation are at stake. Face reality. There are far more sensible solutions than this proposal. One of them would be St. Paul's Hospital. Location. Move people to the overdose center that is already sent up there. People who use drugs can be safely monitored and treated immediately if they overdose. They have doctors there if you need to be revived, if you need oxygen. St. Paul's Hospital provides harm reduction supplies along with harm reduction education and referral to health services, addiction services, and other social support services at this hospital. I've heard that St. Paul's space is too small, not enough footage to have the facility there, but why can't it be considered? Why can't an inhalation tent be set up for crystal meth users instead of saying across from our park? It's well documented that these safe sites have violent incidents, and also well known there's a common element of underlying criminal elements that are around these situations at overdose facilities or near these facilities. Instead, put in place policy and protocols. There was a death recently in July of a young man that died who worked at the St. Paul's Hospital. He was stabbed to death. He was involved in a fight outside the facility. If the 1101 Seymour site is improved, who knows what can happen near the park where our children play with this injection site. A QP rep called Andrew Ledger was saying for St. Paul's workers, he speaks and he says there appear to be few standards when it comes to reporting and assessing violent incidents at overdose prevention sites. He says it's very discretionary. There isn't a clear policy or protocols around violence and how to document evidence and how to determine if something or someone is a violent act. At St. Paul's, there's a rapid access addiction clinic where people can get help. There's an infrastructure set up already. And once again, medical doctors. So instead of debating safety standards, you should have a standard for workers. 3, a recovery plan. We talk about the 4 pillars, but all we're hearing is harm reduction, nothing about recovery. Prevention, treatment, harm reduction, enforcement, and support from the community. It appears to me all BC cares about is harm reduction, more safe sites. Well, what about recovery? In 2013, Margaret Ford built a hospital or an apartment around 2nd Avenue. The community complained. Community spoke to Rain City, who runs that facility, but said there was no issues, there was no problems. The community showed members from Rain City that there was needles everywhere, but they were told from Rain City that there was no evidence. This individual went to City Hall, said there was, and showed him his evidence. He showed him the problems that was going on in the area, and he said he was told by City Hall there was no problem exists. Rain City has no accountability
that is actually
towards the community.
Sorry to interrupt. That is the 5 minutes. You have questions from Councillor Carr. Councillor Carr, you have 3 minutes for questions.
Yes, thank you so much for speaking to us. I really just have one question, and in describing the number of people who are there, the users in the people who are using benches in the park to sleep, etc. How long has that been going on for in your in the park and your neighborhood? Has it been constant over time, or has it escalated? Has it been
it escalated after the Howard Johnson came in, the Lugard, as they called it now. Evidence right then. Ever since then, you see the whole park.
Okay. And did it instantly escalate, or just escalated over time, and it's getting increasingly, more people? If you can just describe that process to me.
Well, I think it has increased because after COVID, we came out in around April, May. Well, then we started talking about it. We started seeing these incidents happening. We've seen the aggressive behavior. And it's still there. It hasn't changed. Our infrastructure is to call the police now when we see them, or to call the city department to pick up needles. Well, now we're putting in more layers for that.
Okay. Yeah, appreciate your responses. Thanks so much.
Thank you.
Thank you. And those are all of the questions for you. Teresa Munn, thank you for taking the time to sign up and speak.
Thank you.
Council, I understand speaker number 5 has withdrawn. We'll move on to speaker number 6. Just before we do that, a reminder to councillors to please keep your videos on so that we can ensure that we have quorum. Speaker number 6.
Point of privilege?
Yes, Councillor DiGenova, go ahead.
Thanks. I just sent a note to the clerk, and I think Councillor Hardwick was experiencing a problem earlier as well, but mine echoes, so I've been turning it on and off throughout. Is that okay with you, Chair Boyle? Because if not, I can't hear and I get disconnected.
Yes, as long as we can, the clerk can see periodically that you're there. Thank you, Councillor DiGenova. Speaker number 6 is Matt Rowan. Matt Rowan, do we have you on the line?
A reminder was sent to Matt, but he hasn't joined.
Okay. Speaker number 7 is Brianna Price. Brianna Price, do we have you on the line?
You do indeed.
Okay, great. And we can hear you clearly. You have 5 minutes. Go right ahead.
All right. Hi, councillors. My name is Brianna. I'm a resident of Vancouver, and I'm speaking in support of this recommendation. I'm someone who's been privileged enough to avoid needing the safety that overdose prevention sites provide. And so I'd like to speak a little bit to those who have similar privileges. I'm in support of the overdose prevention site because I believe that people who need help should receive the help that they need. We've heard those in unhoused and addiction communities talk about how overdose prevention sites provide that help and save lives. We've seen the research that backs that up. We know that overdose prevention sites work, and we know that they make communities safer than when there is open-air drug use, which, as many speakers have indicated, there already is in the area. We also know that this isn't a new site. It's just one being moved into a more stable indoor location that will be easier for those in need to access. With this being the case, I suspect that many who would speak against this site are not saying that the site would be ineffective. I suspect that many of them do believe that this site would help people, but they just don't want it here, in their neighborhood. They think it'll bring society's ills to their doorstep and that it might affect them directly. The truth is, most people don't have that choice. Poverty, addiction, and homelessness already affect a lot of people directly. We need to engage with those people and support them. We need to have resources for them in our communities. We're not more valuable than the people who need this site. Your life is not worth more, counselor, neither is yours, neither is mine. This is a public health crisis. People are dying, and we need to reckon with that. We have a responsibility to support people, and not just through individual donations to charities or giving them food or whatever we have convinced ourselves that they need. We have a responsibility to listen to those who've been living through this crisis and to those people say that this site is needed here. We have lived too long in a society that lets those of us with privilege look away, that lets us ignore our own complicity and say that it's their problem and not ours. Face it. People who do drugs are not the monsters you want to believe they are. They are human beings, deserving of love and care, with brilliance and beauty and community that is in peril because the city lets them die. And because you're scared of them and disgusted by them, you are arguing that more of them should die. That is wrong. If you want to make Vancouver safer, then focus on helping those who are the most unsafe, the people who are going to benefit from this site. Because when there is a crisis like this, safety is not just a lack of needles on the ground. It is lives saved. It is humanization. It is stability. It is exactly what this overdose prevention site can help. Listen to the people on the street. They matter as much as we do. Thank you for your time. Please vote to save lives.
Thank you very much. And you have questions from councillors. The first councillor up is Councillor DiGenova. Councillor DiGenova, you have 3 minutes.
Thanks so much. I first of all just want to address, you had said you had used the term "you" in saying the monsters that you want to believe they are. Were you referring to, can I ask who you were referring to?
Yeah, sure. I mean, in this case, I'm referring to the general sense and stigmatization of those who are drug users, especially by those who say that overdose prevention sites, don't want these specific resources and helps in their neighborhoods. That is the particular you, but it is a generalized you.
Thanks so much. And I do have another question. Of course, you don't have to answer it, but I wanted to clarify that I very much don't see drug users as monsters. I see them as vulnerable and marginalized people. And I feel that we have to do what we can to support them, which includes bringing community support on board for them in whatever way we can. So with that said, my question to you is, with information, I'm trying to put this all together, but I understand that the most deaths that would inform where overdose prevention sites, I'm not saying downtown isn't needed, but if we needed more of those sites and they were expensive and we could have mobile locations in Strathcona, and I believe it was in South Vancouver, was the other answer we were given today, would you support all 3 of those locations?
Absolutely, without a doubt. I would support locations basically anywhere that drug users need them.
Okay. And do you think that we should consider putting them in places where there's the most overdose deaths as well?
Sorry, can you repeat that one?
Where there's the most overdose deaths, should we consider if there's not a safe injection site or a overdose prevention site?
I think we should put it where, I think that we should put it where drug users and where people involved in unhoused communities are telling us to put them, which might be where there's the most deaths and might be where there's people who are the most at risk of death, where there might be deaths soon. That is, you can't just look at what has already happened. You have to think about what is going to happen.
But if we're obviously, and that's why we use data to inform that. And then just lastly, do you think that, getting the community on board sometimes or including them in consultation might help to move things forward though? Even if something is going to go in their neighborhood?
Yeah, I mean, I think it's important to get communities involved, and I think that it is important to talk with them and to reach out to them and to make those connections. I also think we need to move quickly because people are dying every day, right? There's estimations that say 4 to 5 people are dying a day, right? This is a really contemporary issue, and bureaucracy takes a lot of time, and
that's my time. I know Chair Boyle had asked us to keep it within, so I just want to thank you for your comments and thanks for answering my questions.
Thank you. Councillor Swanson is up next. Go ahead, Councillor Swanson.
I just wanted to thank you for your great presentation. I don't really have a question. Thanks.
Thank you, Councillor Swanson.
Okay, thank you, Brianna Price, for making the time to sign up and speak to council on this. That's all the questions from staff, from councillors for you. I'm told that we don't have speaker number 8 or speaker on the number 9 on the line. So we'll move to speaker number 10, Jennifer Bradshaw. Jennifer Bradshaw? Do we have you on the line? Hi, we can hear you. Great. Go right ahead. You have up to 5 minutes.
Great, thank you. Good day, Mayor and councillors. I just wanted to really take up as little space as possible because I agree with Brianna Price on everything. I strongly feel that our voices, the ones that are privileged and not in danger of the effects of the opioid, the toxic supply crisis, we're not the voices that should be centered in this situation. It should be those users, the people that use drugs, the people on the street. All those people are the voices that should be centered here. I think that we are all being publicly consulted right now, so I find it quite ironic that people come here publicly consulting and complain about the lack of consultation. I think that this is frankly a strategy to try and delay to try and get this location, which is perfectly adequate and exactly where these people who need it are saying that this should be here. Well, I think that this is a strategy to make it to have this location. These Safer Vancouver people are trying to make it make this location not happen, which is a sentiment that I see all the time in anything from rental housing to affordable housing to social housing to supportive housing. I see the exact same sentiments in East First and Clark. I am adamantly against this. I think that every single location that people who use drugs say they need overdose prevention site, that it should happen. Thank you very much.
Thank you very much for speaking, and you have questions from Councillor DiGenova. Councillor DiGenova, go ahead.
Thanks so much, Jennifer. Is it okay that I call you that?
Yeah, of course.
Okay, I've been trying to call everyone by their first names to make sure I don't mislabel or misgender anyone, but thanks so much for your comments. My question is about, sort of considering how do we bring people together in, support for communities? I know you've spoken before to council, and as you'd mentioned, sort of housing and rental projects, but do you think that, offering more information, at least in a public hearing, I can say there's been a certain amount of consultation because you have to tick those boxes, not to say that we don't need to move fastly or swiftly, but when we hear that, organizations that are trying to also support the 4 pillars like Covenant House haven't been consulted, do you think that it might almost help to engage in consultation with the community to also provide some education in hopes that we can bring people together and that sort of services such as this, safe injection sites, up for support?
So I think that I'm not suggesting that we should get rid of consultation completely. That's definitely a strong man of my position. I like I said, I'd like to center the voices that have historically not been centered. So people like property owners around this location, those are the usually, and including for social housing, those are the people that the system currently will favor. They will specifically reach out. There are resources committed to reaching out to these people that will, frankly, are most likely to oppose it, rather than, yes, like you say, reaching out to Covenant House or to the people on the streets, the people who are using drugs, that we don't necessarily have systems, like the system doesn't devote resources to reaching out to them, or not nearly as much. And what I'm saying is that we should, and racialized communities and etc., all these marginalized voices, these are not historically the ones that are centered. These city hall hearings, on the other hand, are absolutely resources, yours, mine, everybody's, all of city hall. These are the resources right now that we're spending to listen to these people, and that's not equitable. And so I'm in favor of equitable consultation and reaching out to communities that are most
everyone's voices.
Sorry, what was that?
Okay. Hello? And do you also be just speaking? Can I ask? Do you also read, reaching out to social media and other channels, such as, also having sort of input from people who traditionally don't have a lot of time in their lives, and in addition to the community that traditionally have, maybe not felt that they are engaged in consultation. I don't want to speak about whether or not our staff have done that or not. I've asked them, but racialized communities is what you had mentioned. And you talked about homeowners. Do you think renters are also sort of a group that need to be consulted on this? If I may ask, you don't have to answer my questions, but I appreciate your words.
Yeah, no, I'm very happy to answer. I'm sorry, you were breaking up a little bit, so it's hard to understand. But I think that you were asking about renters. Yes, of course, renters.
I'm so sorry, I couldn't have that, Scotty. Yeah, thanks.
Yeah, no worries. Yeah, no, absolutely. Low-income people, renters, people who are historically marginalized and don't have access to wealth and connections. Racialized people, like I mentioned, transgender folks, LGBTQ community, etc. So, and of course, in this case in particular, the people who should be centered are people who use drugs, people who are most at risk from the toxic supply.
Thanks, and that is the 3 minutes. Thank you, Jennifer Bradshaw, for signing up to speak to council. And councillors, I'm just going to friendly remind you that the question period is for questions, not statements. There'll be time for statements when we get to debate and discussion. Next up is speaker number 11, Garth Mullins. Do we have Garth Mullins on the line?
Yep, I'm here.
Great, we can hear you clearly. You have up to 5 minutes, and you can start whenever you're ready.
Thanks. My name's Garth Mullins. I'm a member of the Vancouver Area Network of Drug Users. I also make the Crackdown podcast about the overdose crisis. And obviously, I'm speaking in favor of the motion. I just, I think about that part of the city, and I remember when I was a teenager, buying and injecting cocaine about 100 feet away from where the proposed site is. And I wasn't the only one. There were a lot of younger people around there and around Granville Street. This is when Granville Street was not the entertainment district. Wasn't remodeled. This was the old, seedier version, full of porn shops and the old Capital Six and all that. And so when people say, "Oh, this family-friendly neighborhood is changed," well, I've actually seen it change from before. So the more gentrified aspect of the neighborhood, that's new. People who use drugs were here before, and so either we make services available for people, or you're suggesting displacement. So this idea of people who use drugs coming into the neighborhood, it's not really true. It's more like developers came in. We were already there. I want to also remember one other time when I was a lot younger. I've been around long enough to obviously remember the Capital Six, but also to remember the previous overdose crisis in the city. There was a publicly declared public health emergency for strong heroin and lots of overdoses here in Vancouver in the 90s. And I was a heroin user all the way through that. I'm on methadone now, but I used heroin and opioids for most of my adult life. And during that time, there was no safe injection sites. And I was scared, but I also couldn't stop. This is the nature of getting wired to opioids, is you can't just decide to change like that. Not most people anyway. So I was scared. And so when I used, sometimes in my apartment, sometimes in a McDonald's bathroom, sometimes wherever I could find a little place. I would, you tie off, you put the needle in your arm, you get the vein, you flag to make sure you're in it, you slam it home, like you inject the drugs, and then I would put that stuff away carefully, like take my needle and everything, and I would get outside as fast as I could, so that if I fell down, if I had an overdose, my hope was that someone on the street would find me and call the ambulance. And if not, then someone would find my body. And the people who are opposed to this proposal today, they want us to go back there. They want us to go back to when I was a kid and I had to walk out on the street and hopefully someone would find my overdose body. And we can't go back. This crisis is so much worse. And the people who are coming before council today, I think a lot of them are, legitimately concerned citizens, and there needs to be some engagement, but there's also political organizing going on behind the scenes. There is a group of people who have sought to organize themselves to drive people who don't have housing, to drive poor people, to drive drug users out of their neighborhoods, and to use videotaping of us when we're in public, post it online to try and shame us away. And they don't come to you today in council and say their true feelings, their true proposals. Because if they would say a popular one from one of the groups is talking about drug users, quote, they would have been better to bring in a naval ship to set up a barrack somewhere and take them, that is drug users, us, away from the city so that they have to stay there. This is a group that's come before you in council. This is a group that has had support of people, of councillors. This is a group that has connections to one of the political parties' boards of directors. So this is the kind of people who are leading and organizing the opposition to this site. I'm not saying everybody is opposed for these reasons, but the people who are politically organizing. So I encourage people who've spoken out against the motion today and people who are thinking about voting against it, look at who's on your side. Look at who's beside you. And if that strikes you as odious, consider your view. Thanks very much.
Thank you. Thank you for signing up to speak. You have a number of questions from councillors, and Councillor Fry is up first.
Madam Chair, I have a point of order first, please.
Okay. Yes, go ahead, Councillor Caribbean.
Yeah, in just regards to the political comments made by speakers, I wonder if we can refrain, because I don't know, I have no political connections with this group. I don't know which the gentleman is referring to, but I believe he's referring to specific councillors, such as myself. And in terms of political campaigns, the mayor has executed one today also to affect an outcome. So there's a lot of that apparently going on, but I just think it's inappropriate to target this when we're trying to have a discussion in here generally from the community. To come and remind our speakers not to be political.
Yes, okay. We will remind speakers across the board that it's part of the city's procedural bylaws to not speak negatively of other of councillors or members of the public. That is the city's speaker's bylaw, and I will endeavor to enforce that.
Can I actually respond to this for 1 second? I've heard a lot of negative talk about drug users today, and I haven't mentioned anyone specifically.
Yes.
Point of order.
Yes. Look, I appreciate that this is a heated topic, and I will do my very best to monitor for disparaging comments on all sides. I have been conscious of that and will continue to be conscious of that. So appreciate the point of procedure from council, and though it's not part of the process, also the reply from the speaker. I'm going to move on to the speakers and commit to monitoring and holding us all to account in terms of respectful dialogue, and Councillor Fry is up first on the speaker's list. Councillor DiGenova, a point of order.
Yeah, just under section 7.AC, because I know I have to state it, about improper conduct. And And I, just out of respect to you, Chair Boyle, and appreciate your words there. Also, just wondered if you maybe could rule on whether or not, or maybe it's a point of procedure you prefer I do 2 points. So there was that point. In the same breath, though, I'd like to include that I thought speakers were supposed to be speaking to the report here and what the recommendations are in front of us, not speaking about other people.
Councillor Deitch, sorry, can you be more clear? You're asking on a ruling on 6.2?
Sorry, 7.8C. And that was just on improper conduct, and in sort of asking, you had mentioned that speakers are supposed to speak to something very specific, but it wasn't to the recommendation. So I was wondering if that's what you meant by that. Are they supposed to be speaking to the recommendation?
Yes, all speakers are speaking to the recommendation in front of us, and that is among the procedural bylaws that I will continue to keep.
Thanks very much. That's all from me, Chair Boyle.
Okay, you weren't asking for a ruling, you're just...
Oh, I mean, under 7.8C, I thought you required a point, and I was just trying to help out the other councillor who had mentioned the point.
Okay, let's move on to the questions, councillors. I'm going to advance Councillor Fry.
Thanks, Chair. And thanks, Mr. Mullins, for presenting. Garth, we're of a similar vintage. I also remember back in the day when Yaletown was Boys Town, and before there was a school there, and before there was a park there, when the Paradise Squat was on Granville Street, and how much this part of town has changed. Obviously, there was no housing in really east of Burrard, except for SROs in my youth memory. That being said, it's a different place now, and despite the historical sort of context and the population that still exists there, we do have a new population. We've had successive decades of city council direction that have added housing to this part of town, and a school and parks and stuff. So how in trying to achieve success here, recognizing that we now have some quite disparate populations, how do you think we could best achieve success that recognizes the concerns and balances those sort of community needs with both community needs?
Yeah, I mean, I don't know. It's really not my job, you know. Like, I'm just trying to keep me and my community from dying as fast as we are. So, you know, it's like, how much consultation did we have during Canada's response to COVID? Not very much, right? It was a public health emergency, and that empowers people to act on the evidence and to protect the public health. We're having more people dying in British Columbia of overdose than COVID. So why would we have a slower, different kind of response? The only reason was because for us, the wrong people are dying.
Sure, and I appreciate that, but I know that you're well researched in this capacity, and I'm just wondering if you have examples of how sort of successful coexistence can be achieved, and if there's, you know, guidance you can give us in that capacity through observation of other jurisdictions, maybe. Okay, that's cool. Thanks, Ben.
I guess my answer to that would be, if we look at Lethbridge, where successful coexistence was really, there was a tremendous outreach effort from the people behind the Arches Safe Consumption site in Lethbridge, Alberta, to businesses and concerned citizens. And there was an organized movement of businesses and some concerned citizens to shut it down. They were ultimately successful. There's some financial mismanagement at the place, but right now, overdoses are up, and so is needle debris. So, you know, I think people should think carefully about what they win and what they lose.
All right. Thank you.
Thanks.
Thank you, Councillor Fry. Councillor Carr, you are up for questions next.
Yes, thanks so much. Councillor Fry actually asked some of my questions, but I do have another one, and that is related to your experience that you've conveyed, that you had previously gone to the same area and being able to access drugs there, as opposed to, I guess, some of the other speakers that are saying there's a kind of a new phenomena of people coming in now, or more recently, who are seeking drugs, who are addicts. And so, can you just I think expand for me about whether or not you feel that there have always been in this area people who are really in need of a safe injection site in order to be in a less risky position, so that they aren't as much at risk of dying from an overdose.
Yeah, there absolutely are, and I think the statistics over the last since 2016 and before bear that out. I think that the idea of the safe injection site, when we were originally proposing it 20 years ago, I've been at this a long time, actually more than that, was a distributed model where there are services in all parts of the city, not just in the downtown east side, or not just where things are the worst, but where people who use drugs actually are, and people who use drugs are in all parts of the city. And so I think a small site like this makes sense because it sort of understands that what Insight was striving for back in the day was the beginning of a distributed model, the beginning of sites all over the place, small sites, not just one central location to try and attract people to. But that was frozen. The idea of Insight was frozen in time by organized opposition from the Conservative Party in Ottawa, of the Stephen Harper government. And so I just I hear a lot of the same arguments here today, and so I am responding to those as I see them.
Yeah, and can you tell me? You don't have to answer my questions, but I'm interested that when a safe injection site is in place, does that normally result, in your experience, in fewer people having to access drugs on the street through the purchase from individuals, organized crime, whatever?
That was our original vision. I attended meetings in the late 90s about this. We always dreamed of a safe injection site where people could go in and get prescribed heroin. So it would be no need for any kind of black market or buying things on the street. But governments then and governments now actually oppose that. And we have seen some cracks. We have seen some steps towards where you could get prescribed safe supply inside of such a place. But right now, that is not standard.
That's the 3 minutes for questions. Thank you. Councillor Carr. Councillor Kirby-Young is up next.
Yeah, thank you. Thanks, Mr. Mullins. Thanks for being here. Councillor Carr started to touch on my question, and we heard a lot this morning around what services the site would provide and wouldn't. And I'm wondering, it sounds like if you sort of share the same concern that I do, that it's still focusing on street drugs, doesn't have a MySafe machine, or we're not evolving enough the model of these sites towards safe supply. Do you agree with that, or what are your thoughts?
I won't have us divided and ruled like that, though, right? I mean, we fought for, since the 90s, safe injection sites with safe supply. We weren't able to win it, so we just had to keep moving forward and fighting for and defending safe injection sites. We are still fighting for safe supply. That very phrase comes from us, from the drug user movement. I've heard it around the table a lot today. It's great to hear that. But what we've learned is governments will move incrementally on this stuff. So it's not all or nothing. It's you build a safe injection site and you fight like hell for the safe supply to go with it. And that fight has been half of my life. So for sure, I want more. For sure, safe injection sites by themselves aren't enough to address, all the social problems that are out there. And certainly they don't address the toxic drug supply without safe supply. So that's the fight. That's what we're in the middle of right now. But we also need to expand safe injection sites as they currently are practiced.
Do you think that, I hear you on the need for both and expanding, do you think the council should be pushing back, though, when we're only getting these proposals for the traditional standard sites without an enhanced or an incrementally better setup?
Well, let's be clear. A vote against the proposal today would not be pushing back and pushing towards a better deal for drug users. It would just be pushing back against drug users. It would just be pushing back against people like my young self. So, no, I think you should approve the motion, vote for the motion, and then put another motion forward that says, and let's have safe supply.
Yeah, we have advocated for that. It's just like, it's just not happening as fast as we'd like to see it. But thank you. Appreciate that. That's it for me.
It's not happening as fast as I'd like to see it either.
Yeah, I'm with you. Thank you.
Thank you, Councillor Kirby-Young. I have put myself on the list and will start my own timer. Mr. Mullins, thank you for coming to speak. I'm wondering if you can speak a bit more to the critical health need for these services. I know, as you mentioned, we've heard a lot of comments about drug users, but this is a health facility, and I'm wondering if you can give us all a sense of the need to be thinking of these services as health services and what shift that makes in supporting people and also in keeping them alive.
Yeah, I mean, it is kind of important to see it through a public health lens, because in any neighborhood where people choose to reject a safe injection site, they're basically saying that their whole neighborhood will continue to be an unsafe injection site. Right? So nobody's proposing an option on the table that stops that. And so this is, an important step. Not only does it help keep you alive, a lot of overdoses are reversed in safe injection sites, thousands. But it helps people with the transmission of infectious diseases. Vancouver was known in the 90s, when I was really young, as the place with the highest AIDS transmission rate in the industrial world. And that was because people fought back against needle distribution programs. So people like me, I had the same needle for sometimes a month at a time. I had to sharpen it on the Max Striker. My veins are all completely collapsed because of that. And people shared needles. And so we had high rates of infectious disease spread, Hep C and HIV. And in safe injection sites, people get new syringes and they get to dispose of old syringes. But that public health doesn't just apply to drug users, because I think we've all learned that infectious diseases viruses don't obey strict boundaries. They jump from group to group. And so for everyone living in a neighborhood, it's safer when everyone has safe, needle practices, don't share needles and have access to safe equipment. So, I think that's an important health consideration that we shouldn't forget. And then there's also other services that people can get. When you go to a safe injection site, you actually might have your only contact with health professionals too. And it can be the beginning of a really productive relationship with doctors and nurses and people to help other aspects of your life.
Okay, really, really appreciate all of that answer as well. I'll take myself off the queue, and Councillor Swanson is up next.
Thanks.
Yes, thanks, Garth, and thanks for bringing your perspective, which is really, really important. I just have two questions. One is if you could expand a little bit on the impact of gentrification on people who use drugs. And then if there's time, if you could just maybe say what you think are all the components to get a real handle on the problem. Safe supply, safe injection, what else?
Sure. Thanks, Jean. I think the housing situation, housing crisis in Vancouver has just made the issue that a lot of people are concerned about, which is public drug use, has just made it very much more pronounced. And so has the pandemic. So every time we get a shock into the system, if you're marginalized or if you're just hanging on, if you're just able to pay rent, you can get shaken off of that. And so the gentrification and the gentrification of what's now called Yaletown is a big part of the problem here. So if we're looking at trying to solve it, you can't solve it without housing. Housing is definitely part of it. You got to keep people alive too. So safe injection sites are a big part of it. But really, governments at all levels have stopped building public housing, stopped subsidizing housing in a major way, over the last several decades. After World War II, the United Kingdom government was broke, but they built masses and masses and masses of public housing. Surely we can do the same thing. And, I think that we have to realize that the beneficiaries of this housing crisis, because a lot of people have made money, a lot of people have put equity and done well. I know there's a lot of people who have condos who are really struggling too, who are just like underwater with the mortgage and just getting month to month, and they're just paying a expensive mortgage instead of an expensive landlord. But for the people who have benefited from the housing crisis, it's really incumbent to think about not further victimizing the people who have lost from it. And I think that that's what we see politically, certainly during this election campaign, and sometimes around this table, is a polite version of a class war. And I think I'm not trying to be rude. I'm trying to surface that. I'm trying to allow us to see the forces that are at work here so that we can better address this. And so I think housing for sure, and safe supply for sure, and putting the people who are most affected by these two crises, at the policy table to help make decisions about this. Most people aren't going to say, what's your solution to the housing crisis? Oh, you should buy the Howard Johnson's hotel. Most people aren't going to say that, right? We need to actually be involved in determining the solutions to the crises that affect us. I mean, as a drug user, I can say safe supply and a proper prescription heroin program is going to do that. And that's why we're fighting for every day.
That's the 3 minutes. Thank you very much. Councillor DiGenova is next up with questions.
Thanks very much. And I do appreciate your answers to other councillors. It's helped to narrow my questions down. But considering we saw the Naomi trials kind of started way back in the first meetings on that were 98, and it was very short-lived in Vancouver. Why is it taking so long? I mean, I'm asking you this because I support that. I've supported it since the Naomi, since the Salome trials, and understanding sort of that, the heroin assisted therapy can cut out the money laundering, the drug dealers, the organized crime.
Just a reminder to focus on a question.
I'm just trying to get that all into there. Thanks, Councillor Boyle. You haven't been doing that to others, but just wondered if you might be able to comment on that.
Sure. I agree. When we saw the Naomi and the Salome studies, we were just so encouraged. And then the results they showed, these are pilot, projects, research to determine what is prescription heroin? Is it good? And it's so good. It's really great for people's lives. It's really great for all of the issues around the table that people are concerned about. But it's a good question. Why is it taking so long? Why don't we have that now? These studies were started 15 years ago. And I'll tell you, it's because all of the levels of government are reticent to take action. It's a shared problem. The drug war is a shared phenomenon, and each level of government can do something in its own jurisdiction. But what governments love to do is point to another level of government that it's their responsibility. And so, Vancouver, for example, can take measures around policing.
I do have one more question for you after, if you don't mind, but thank you.
Sure. Go ahead.
Sorry, I only get 3 minutes, but I'd love it if you would send your comments in too. You and I had gone back and forth a little bit on social media there, but I'm just wondering I was trying to get across in my questions, and I want to ask you this. If we're hearing that the most overdose deaths are in sort of the areas of the northeast side of the city and South Vancouver, do you think that they deserve a mobile overdose prevention site too? Just like we're seeing in Portugal. I know Portugal doesn't have fentanyl, but they have mobile sites in many neighborhoods. Do you think that that's fair to offer in those areas where people are overdosing the most?
Are you opposed to this motion?
I'm not allowed to answer questions from that. That's why I'm listening to all of this feedback. I said, in addition to this, would you be supportive of that?
Sure, I'm always for more services. Yeah.
Okay. I just wanted to ask, and you didn't have to answer my question, so thanks. I do appreciate it, and would love to hear any more information you have on the Naomi trial.
Sure.
Because I'm supportive. Thanks.
Okay, that is the 3 minutes. Thank you for signing up to speak and answering all of those questions, Garth. Council will move on to speaker number 12, Mike Parolini. Do we have speaker 12 on the line? It looks from the clerk like we don't. Speaker number 13 is Sydney Ball. And I understand we don't have Sydney Ball on the line either, so we'll move on to speaker number 14, Sarah Blythe. Do we have Sarah Blythe on the line?
Yeah, I'm here.
Okay, and we can hear you. You have 5 minutes. Go right ahead.
Yeah. Oh, geez. Just listening to all of this, and it's just so heartbreaking. All of the things that I've seen over the past few years, and which includes a person that I know who died a few years ago of an overdose in his apartment in Yaletown, and he was 20 years old, and he had lived in youth housing and then aged out of that, and just in meeting his parents and going to his funeral and knowing him the way that I did, and I don't want to give too much information out about him, but obviously it's very, I know lots of drug users live in Yaletown and around Yaletown and have for years. I mean, like Garth was saying, drug, and I'm sure the VPD would agree that there's been drug use in Yaletown for a lot of years. So I'm going to get to something that I wrote here, which would be starting with thank you for allowing me to speak, Mayor and Council, today. I'm the executive director of the Overdose Prevention Society, just so people know. I'm in support of the recommendation from Council that's put forward in Council today. Like Garth was saying, or what I'm feeling myself and just sort of reading over the recommendation, that I'm not really entirely sure why this is coming from Council, as it's not procedurally how these matters are dealt with. So I'm only assuming it's because of stigma, because I can't imagine that COVID, if it was COVID, I think people would snap to it right away. So it's very, it's very upsetting to me, and a lot of folks that see people die every day. I'm front line, so I speak to mothers and parents and and family members every day who are losing people, and I'm a loss for words. We need so much more. These overdose sites are really the bare minimum we should be doing to helping people. I agree with the VPD that we need safe supply, and I also think that they need to. These are places where drug users come to, and they come to use at these sites. So to get safe supply into, to establish this, then put safe supply there, is actually a perfect way of getting people onto something going to kill them. Also, overdose prevention sites, not only do they save lives, but they alleviate some of the issues that the community members are talking about. It sounds like they've been dealing with some issues for a long time. And providing a safe place to dispose of needles where people can use that not in the street or a doorstep or a sidewalk or a place where that they can go inside and get the help and, dispose their needles properly. We take hundreds of needles every day that could be on the street, and we provide bathrooms where people can use the bathroom instead of having to use outside. So these places not only save thousands of lives, but if they're functioning properly, they're a good member in the community and actually help alleviate a lot of the issues. When we have ever had any issues in the community, which is very rare, I might add, we do a lot of public cleanup ourselves in the neighborhood to make sure that we're a good neighbor. When we have, there were some issues with like driving in the alleyway, and so we went out and made sure the cars could get through properly, and any issue that's come forward to us, we've dealt with immediately, and we deal with we're a place that people can come to talk to someone about the issues. So I think residents will find this is a place that they can come to talk to someone, or, they could even contact me. I'm just really at wit's end with all the people dying. And I just don't, I just hope these residents and council today, I just hope that, that you really understand that what we're dealing with right now. And I guess that's all I have to say.
Thank you. Thank you very much. You have questions from Councillor DiGenova. Councillor DiGenova, go ahead.
Sorry, I'm going to try not to ask everybody a question, but thanks, Sarah, for your words. And as I start my questions, hopefully Councillor Boyle won't slap me on the wrist for saying thank you to you for all that you do in the community. And I wish we could measure how many lives that you and your organization and your group has saved. I know that sometimes it's hard to look at it that way, but that's how I see it. So thanks for doing that and for making the time to speak with us. I'm looking at ways to kind of find ways to bring people together instead of sort of pushing them apart, and sort of just in seeing sort of, emails, it's like in support or in opposition, that, trying to find that middle ground between people, and especially with the education, like what you provided with the services that can come with. Just wonder if you think that, that education will help communities and neighborhoods that might have fears or misconception that cause stigma.
Yeah. Well, I think
that's a silly question, but trying to find a way to move forward together.
I mean, obviously, when we have our overdose prevention site, our main goal is, one of our main goals is being a good neighbor, because we want to be able to stay there, and we want to show that we can do it and that other communities can do it as well. So, we have got people cleaning in the front. We've got people doing, speaking to people about different community issues. And so we really keep in touch with our community, and we have people come in, and if they've got questions, we answer them. And sometimes people become volunteers, because then they understand what we're doing, and saving lives is so important, and that we are in a crisis situation. We just have to really think about this, is that it is a declared crisis. So it's a different situation than just doing your regular community consultation. These things should be activated, and I do believe that we should communicate with the public about it, but not having more people die in the meantime. So I think you can say, let's at the very most, let's reevaluate this like not reevaluate the site, but let's talk about the site and what would make it good, and have an open discussion with community members. But to not have this go forward today for any reason would kill people, literally. And I think that we have to understand that we would be responsible for that in some way or another. So I think that we need to act like this is a crisis. We don't need to talk about it forever. And I do understand and respect the people's community concerns, but they can, a lot of it is just, unfortunately, a lot of it is just not in my backyard. And
that's my time, but I will ask staff later about the question as to why it's coming to council. I think it's city-owned space, but I didn't forget about that. Thanks, Sarah.
Yeah,
thank you.
But I know it's a city-owned space, but usually these procedurally would be dealt with in another way than to come to a public discussion, which I guess I understand.
Yes. Sorry, thanks. Sorry, that is
point of order.
Well
Point
over
of order.
the 3 minutes. Yes, a point of order from Councillor Carr.
Yes, thank you, Madam Chair. I'm raising a point of order around the statement made by Councillor DiGenova around you slapping her wrist. Under Section 6.1D of the procedure bylaw, which talks about not speaking disrespectfully to another council member or an official. I believe that you were asking Councillor DiGenova to keep her remarks to questions, not background information. And so I really take offense to the slap her wrist comment.
Okay, thank you, Councillor Carr.
Point of order afterwards. Thank you.
Okay, and as council knows, I don't chair often, so I am just checking with the clerk on your point of order, Councillor Carr. Am I required to respond, or do we just note?
You could caution Councillor DiGenova from making such comments when you are holding to the rules of procedure yourself, in terms of the asking councillors to stay focused on questions rather than background commentary.
Thank you, Councillor Carr, for that sharing advice. And I will note, councillors, we have a very long speakers list, and I have reminded a number of counselors and made reminders not directed specifically at anyone that the question time is specifically for questions. I will continue to make those sorts of reminders as we endeavor to keep this conversation on the tracks and keep things from going off the rails. So I will continue to make those reminders. Please endeavor to not take them personally as we are trying to follow procedural bylaws to make important decisions in governing a city.
Point of order.
Yes, Councillor DiGenova, you have a point of order.
Yes, thank you, Chair Boyle. Under 6.1, Section B, I do believe that another councillor, Councillor Carr, since she pointed me out, I will point out that she just put words in my mouth. What I will say is what I specifically said was, I hope you don't do this, as in, I hope you don't slap me on the wrist. And it was said, with a bit of a humorous piece to it to try and indulge me in just a few more seconds there, Councillor Boyle. But what Councillor Carr said is that I did say that you slapped me on the wrist, and that is untrue. And under Section 6.1B, that would be putting words in my mouth, and I don't think that's fair. And we can roll back the tape if she'd like to hear that. But I'm just concerned, and it's very hurtful to me that she would put words in my mouth.
Sorry, Councillor DiGenova, you were raising that as a point of order. Can you tell me which procedural point?
Well, I had mentioned, 6.1. Section B, and I'm not sure if you'd like,
Okay, so you're responding.
I won't proceed to offer you advice, but as Councillor Carr did, all I'd ask is that if members are sure of what other people have said, that's fine. But if she's not 100% sure that that's what I said, then perhaps not to misquote me. Thank you.
Okay, Councillor DiGenova, I interpreted your comment in the same way as Councillor Carr did in her point of order. I am going to try to avoid us going any further down this particular rabbit hole, but we'll just again remind councillors that the expectation is, of course, of speaking respectfully and also of asking questions during the question time to council. And for now, we'll leave it at that and see if we can rise back to the subject at hand.
On a point of privilege, I'd just like to apologize if that's how you did take it. That wasn't my intention. Thank you.
Okay, thank you, Councillor DiGenova. We will move on, Council, to speaker number 15. Speaker number 15 is Karen Ward. Karen Ward, do we have you on the line? It looks like we don't have Karen Ward on the line right now. So we will move on to speaker number 16, Meg Amwin. Meg Amwin, do we have you on the line? Speaker number 16, Meg Amwin. Just waiting a moment, Council, for speaker 16, who I'm told is on the line, so might have their... great, we can hear you. This is Meg Amwin?
Yes.
Okay, great. We can hear you. Well, you have 5 minutes and you can start when you're ready. Thank you.
Okay, thank you. Hi, my name is Meg and I'm a resident of Vancouver, and I'm here to speak in favor of the overdose prevention site at 1101 Seymour Street. So we're in the middle of an overdose crisis with more than 200 people dying in Vancouver this year. We know that overdose prevention sites save lives and that people who use drugs are not just in the downtown east side. If we're serious about the declaration of the overdose crisis as an emergency, it's obvious that this site is needed and should be welcomed as soon as possible. There's no inherent danger associated with overdose prevention sites, and the people who use drugs or are homeless are not inherently bad or dangerous. The issues that the people have raised are solved by creating access to dignified housing, low barrier access to services, and investing in amenities like public toilets. Although certain groups that are opposed to this motion may have the resources to start a campaign, I don't believe that they are representative of this city. I also want to add that overdose prevention sites are only one element in addressing this overdose crisis. We know that the war on drugs and approaches that favor enforcement and policing do not work and are instead directly responsible for the death of our friends, family, and community members. People need reliable access to a safe supply of drugs, especially during the pandemic that has disrupted drug supply and made it difficult to not use alone. In closing, overdose prevention sites save lives. This is based on decades of experience and research. Thanks for your time.
Thank you very much for signing up to speak. You have questions from Councillor Kirby-Young. If you're willing, Councillor Kirby-Young, I will advance you now.
Hi, thank you. And thanks for being here to speak. I just have one quick clarification question. You mentioned St. Paul's and the sound cut out for me, and I just didn't hear the reference. Can you clarify what you said about St. Paul's for me, please?
Sorry, I didn't mention St. Paul's.
I thought you had mentioned the St. Paul site. Is that not correct?
No, I mentioned generally just other overdose prevention sites, but not specifically St. Paul's.
Okay, thanks for the clarification.
Yeah, no worries.
Okay, are those all of your questions, Councillor Kirby-Young?
Yeah, thank you.
Okay, thank you, Meg Amwin, for signing up to speak to council. Those are all the questions the councillors have for you.
Okay, thank you.
Next up, thank you. Next up is speaker number 17, Stephen Hall. Do we have speaker 17, Stephen Hall, on the line? And it looks like we do not. Speaker number 18, Kat Cott, also appears to not be on the line. So we'll move on to speaker number 19, Murray Thompson. Murray Thompson,
hello.
do we have you on the line? Okay, we can hear you, and you have 5 minutes. Go right ahead.
Thank you. It's Murray Thompson from Vancouver. I guess I have to speak against this due to the fact that there's some concerns that haven't been mentioned. The site at 1101, above that building is senior housing, subsidized senior housing, which means the door between the two, the safe injection site and their entrance to their building, is about 15 feet. Across the street is Brooklyn Court, again, subsidized senior housing. On the other side, you have the gathering place. And if I'm correct, you're not even allowed to have a marijuana store within 300 meters of a community center, which the gathering place is, let alone a safe injection site. And above the gathering place is the New Continental, which is city-owned again, which is subsidized senior housing. And I find it quite alarming that, yes, these people do need a safe place to inject, but living in the New Continental, some of the seniors here are fearful to go out now because of what's happening in the neighborhood, let alone put a safe injection site there. I'm not speaking on behalf of AIDS Vancouver. I'm only speaking on my behalf, but I volunteer at AIDS Vancouver. AIDS Vancouver had moved to the 4th floor, which means that people all day come for appointments for counseling, case management work, whether that's housing, getting into, recovery programs, whatever. And they're going to have to share the same door, the same waiting area to get on the elevator to go up. Twice a week, or not twice a week, but 2 times a month or 3 times a month, depending on check issue day, AIDS Vancouver runs what's called a supplemental food bank or supplemental food program, which brings in around 300 to 350 people 2 times a month, like Tuesdays, Thursdays. Friday morning is reserved only for ladies because some ladies are even intimidated to go in and get groceries with men around. And that happens 2 times a month. Sometimes it happens 3 times, depends on when check issue is issued. My other comments, we hear a lot about the Howard Johnson Hotel. And when you walk by or look at it, it looks very, very nice. But if you sit there waiting for a bus and there's people congregating out front, the management and security of the building come and tell them, even though they're tenants, to go somewhere else because they don't want to look bad in the public's eye. So that is basically, my comments on this. If there's anybody that has any questions of me, I would be more than willing to answer them. And thank you for listening to me.
Thank you very much for signing up to speak. And I don't see any questions from councillors, but appreciate you making the time to phone in.
Okay, well, thank you very much.
Next up is speaker number 20, Brian Georgievetsky. Do we have Brian Georgievetsky on the line?
He was, but his line dropped.
Okay. We will move to speaker number 21, Min Pritzkupa.
Just a point of parliamentary procedure.
Yes, Councillor DiGenova.
Just in case the speaker is trying to reconnect, just wanted to make sure, because I didn't hear it mentioned when we came back from the break, they will be able to call in again, and you'll call through the list again, or the mayor will when he returns. Is that correct?
Yes, thanks.
Sorry, just wanted to make sure they knew.
Absolutely worth repeating. We will go through the list again for those who missed their name in the order. Speaker number 21, Min Pritzkupa. Do we have you on the line?
Hello, yes. Hi.
Yes, great. You have 5 minutes, up to 5 minutes, and we can hear you just fine. You can start anytime.
All right. So thank you for this opportunity to speak out. I'm against the OPS site in Yaletown. My family moved here in Yaletown in 1994, and I'm currently a resident of Yaletown with children in the neighborhood. I've seen increasingly, these are my observations, increasingly number of homelessness, aggressive behavior, and intoxication due to drugs over the last 2-3 years. And I think that goes hand in hand with the increase in homelessness and aggression in the Oppenheimer and now in Strathcona. I don't have hard data around any of this. These are my observations. Since the COVID crisis, it has become worse in the neighborhood. Again, these are my anecdotal observations. When the Roundhouse was temporarily opened up for a certain group of homeless people, I thought that was a great move. However, these are my observations. I saw 3 people in the alleyway outside the Roundhouse. I don't know what they were doing, but I had to call, loitering around the Roundhouse. I had to call the Roundhouse line at that time to report it. It was at lunchtime when school was back in June at elementary school, just a few steps away. And they were highly intoxicated on drugs when they were asked to leave the Roundhouse, because I saw them leave afterwards. And I walked around. And again, around that time, I also saw aggressive behavior, people coming out of the Roundhouse and yelling and shouting to each other. Unfortunately, we cannot report this, right? It's not an illegal activity. There's nowhere to report the increasing homelessness, aggressive behavior, and seeing people who are high on drugs. The other day, I was walking around lunchtime near the school. The kids play around the park because they don't have a playground. I saw a fellow totally high on drugs by the beach there, by the seawall. And who knows, I don't want to stigmatize people on drugs, but there has been an increasing number of violence in Yaletown. And downtown, there was the stabbing at St. Paul's by the OPS site there. Recently, there was a stabbing of a man, and the perpetrator ran to the seawall, which is right next to the school. At Cooper's Park, a teenager got stabbed in May, and there was a home invasion, like in September as well, whereby somebody went into someone's home in Yaletown. So there is crime that is increasing. Again, these are just observations from what I read. I'm not trying to stigmatize anything. I don't want to associate it to whatever group, but my observation is that there's increased crime, there's increased aggression in the street, there's increased homelessness, and there's increased evidence of people who are walking around high, and there's increased number of needles. My concern is that with this site is that, from what I hear, the assumption is that there won't be any lineups, any squatting. I don't know where the people are going to come from. The data seems to suggest that a lot of the issues are elsewhere in other districts in Vancouver and not Yaletown, that the Yaletown population has other issues. And so I don't know, it seems that perhaps it needs to be looked at where there's a need for this, rather than just assuming like because the site is already available in Yaletown, it's convenient. And my other concern is that this is right next to a playground where kids play. My kids go there and play, right? It's a family-oriented neighborhood. There's schools nearby. When kids get older, they take a bus to go to high school. And the last thing I want is them having exposure to a drug scene, to increase crime, and to random acts of violence. So I just ask that the city takes into account resident concerns, takes into account where there's really a need for this, rather than it being a convenient site because it's a city-owned property. Look at it from a holistic point of view, at both quantitative data and qualitative anecdotes. There's no way I can report that there's a homeless person who's totally high on drugs down the street. Where do I report that? You need to listen to the residents, because what we're saying is the truth. We do see it more and more so. And again, this is a very tricky issue. There's mental health support is needed, housing is needed, and I guess this needs a very holistic approach. Thank you.
That's the 5 minutes. Thank you for signing up to speak. I understand that speaker number 22 is not on the line, but speaker number 23 is. Speaker number 23 is John Malish. John Malish, do we have you on the line?
Yes, you do, Miss.
Okay, we can hear you. You have up to 5 minutes. Go right ahead.
Thank you very much for this opportunity to speak. My name is John, and I strongly oppose the motion today. I just want to interlude that when voting on a matter such as this, I did hear a few of the speakers indicating their roles earlier, which I appreciate, but I think it would be good due process for each speaker today and in the future to disclose. One, do you actually live in the area nearby this suggested site? It's really important. Anyone speaking today that is not affected by this in their daily lives indicates that they are not affected by this before they speak. Further, is the speaker financially related in any manner to the outcome of today's discussion? Are they employed by any organizations that would be part of this, or may be affected if today's decision becomes a precedent in prioritizing the funding in future endeavors? I can only hope that this data will be considered today and in the future. Apologies for my shaky voice, this is emotional. I live on 811 Helmkin, and I've lived here since 2003, before Granville was an entertainment zone, when you could not turn right on Seymour and Richards because it used to be branded as a prostitution area. My children are 10 years old and 8 years old. I'm one of the thousands of families that has been terrorized in the name of what groups seeking continuous funding are trying to brand as harm reduction, while referring to families like mine as classists, NIMBYs, or other labels designed to reduce our ability to have a voice. There is a direct correlatory relationship.
Speaker, I'm just going to pause your timer and remind you, as I've made general reminders, that this isn't the time to disparage other speakers, but to provide your own comments on the topic at hand. Thank you.
Thank you for the reminder. I'll govern myself accordingly. There is a direct correlatory relationship between May 2020 and the decline of our surrounding safety and mental well-being. It has had a net negative effect. There's a small percentage of the people in the community that have been given the opportunity to operate as if we are in a lawless society. Meanwhile, there's a large percentage of the community that wishes to live in harmony with the law and general human decency, including the safety of all people. This conflict is a direct result of the failed attempts to implant these toxic programs, and they literally require taxpayers to fund the terror that they are experiencing every day. There also seems to be a debate or lack of clarity around the quality and the authenticity of the data that we're using to sample to suggest these programs are or are not working. There have been studies in Alberta and San Francisco that clearly point to failure for these programs. Here's a quote from the Alberta report. Many residents, including minors, reported being approached for money, solicited for prostitution, or being subject to verbal or physical assault and intimidation. Numerous residents complained about drug users urinating or defecating on the property, and I go on to the point where it was just a failure, and this is a study that we have access to. What I am suggesting is that we reestablish a measurement set. Let's reestablish what are the data points that we're going to sample and ensure that all community members, including every group, has the ability to contribute to this data, and that this data be reviewed in a transparent fashion before we move forward. Let's continue the pilot. If it works, we're all for it. If it doesn't, let's not make the mistake of making it permanent. If there's any hesitation to track a fresh set of data, I look at the intentions behind groups that would not want to have a fresh set of data that we can evaluate. We do experience drug dealers being attracted to the areas. You should really see the back alleys, the sidewalks, everything going around the site on Seymour. It's at the point where at 8 a.m. we're seeing meth being smoked as we're trying to drive our kids to school or walk them to a park. I can't believe that we're categorizing a heroin injection site or a meth smoking site in the same category as a radiology site. They're not the same. There needs to be some proximity between families and parks and community areas. I also wonder if we're unintentionally becoming a drug capital of the country. I listened to the presentations earlier. They're great, but there was no mention of a data or audit around how many of these people we're helping are actually citizens or residents of British Columbia. Most of them I encounter are from Quebec. They speak French. They're from Ontario. They've moved here because the winter is warmer here and because we're very supportive of giving them programs that extend this behavior. I mean, if you're addicted to something, I understand it's hard to stop, but we're definitely perpetuating the problem if we have people moving across the country to participate. And we're funding it, and we're experiencing it every day. There was a comment made earlier that we need to move quickly, just like housing people from a forest fire in a gym. I understand the analogy. I believe it's quite a different matter, and we may be unintentionally, again, encouraging the nation's heroin addicts or meth addicts to come do drugs in a family community. Also, it was mentioned earlier that we are a culture that has, drug substances is a cultural inherent portion of our city, and sure, it's been that way since the 80s, and the harm reduction programs were born then. And 40 years later, we're spending $1 million a day, and I don't think it's getting better. We have men jumping on windshields in traffic. We have people walking into businesses and stealing furniture and walking out with it. I can't go to my recycling room without encountering someone that is doing heroin, and if I ask them to move, they pull a knife on me. It's happened twice. I've reported it to the police. The police tell me they were never consulted on half of these matters, including the moving of Oppenheimer Park. We are enduring home invasions, stabbings, chainsaws, murders. And there was this speaker, I can't talk about previous speakers, but it was mentioned that this is a class war. The only war I'm witnessing today is a war on children and on families that were here before Oppenheimer Park was moved. They were here before these programs, and we were a thriving family community. And it's since May of 2020.
5 minutes.
Thank you.
Thank you. You have questions from Councillor DiGenova.
Thank you.
Thanks so much. I'm going to try and keep my questions focused to the recommendations here because I understand a number of your other concerns and wondered if you might be able to share your comments with council by email if you felt comfortable doing that. Just, some of the key points. Thank you. And then, in talking about, and I'm trying to separate public safety and the overdose prevention site also. I mean, I understand that some of it correlates, but I mean, if there was consultation and if there was a chance to work together with the community, do you think this is something that, could possibly be accepted in an area if it was a solution to some of the issues you mentioned? I'm just asking if. I mean, you had mentioned that you didn't feel that there was much consultation. That's what I heard, but I don't want to put words in your mouth. So if you could answer that, that would be great.
Yes, ma'am. Thank you for the opportunity. When there is a movie shoot in our area, there are notices posted on our buildings. We get advance notice, like we're talking 3 weeks notice that there's going to be filming on a street, just in case we were planning to use that sidewalk. And we have not experienced that level of consultation on something that has a far larger impact on our lives. my recommendation or my answer to your question is that if the consultation could involve everybody agreeing on what are the key performance indicators we should be looking at to ensure we are A, saving the lives of those that are marginalized and need our help, B, not sacrificing the greater population's safety and mental well-being, which could perpetuate more heroin addicts and more children turning to drugs in the future, and C, how can we remove this blurred line from what is illegal and what isn't? It's not illegal, apparently, for someone to do heroin and jump on a windshield or steal furniture. But what happens if I do heroin? I'm pretty sure I go to jail if I walk in and steal something. Why is it that the taxpayer is being treated differently? We're all human beings. We all deserve a chance at safety.
Thanks. And just my last quick question to you is, are you aware that there's actually a motion on our agenda for these meetings, B9 on public safety, that's separate to this?
What I'm aware of is that there is a mobile injection site 2 blocks from my house that if it becomes permanent, it'll ruin our lives.
Oh,
That's what I'm
okay.
aware of.
Thank you for that. I just was thinking maybe some of your public safety comments, just trying to find a place to direct those to, if, but also acknowledging them. And thank you for sharing your experience with us.
Perhaps through the email communication, you could recommend where I direct those.
I would ask the chair maybe to be able to share with you. I think there's a form on the webpage where you can email our first name dot our last name at vancouver.ca for all of the council members and mayor.
Thank you for your help.
Thanks. Thank you for signing up to speak. And speaker number 24 is next. I understand speaker 24, they're in person. Trey Helton. Trey Helton, do we have you there at council in person?
Chair Boyle, he's just making his way in.
Okay, great. Thank you very much, clerk.
Could we bring the desk up? Hey, can you hear me?
We can hear you. We can hear you loud and clear, and you have up to 5 minutes. You can start when you're ready.
All right, thank you. My name is Trey Helton. I am one of the managers at Overdose Prevention Society, located at 58 East Hastings. I am for the modification or lease of Supporting Women's Alternatives Network Society and the lease of Rain City Housing and Support Housing for an overdose prevention site at both 1101 Seymour Street. I'd like to say thank you to everyone who has spoken on the issue so far. First, I want to talk a little bit about Overdose Prevention Society. OPS is a volunteer-run supervised consumption site in the downtown east side in Vancouver. We are one of the most visited sites in the downtown east side. OPS runs a really clean ship and keeps the community safe. We take pride in our neighborhood. Before OPS took over the indoor space at 58 East Hastings in 2017, the back alley and front sidewalk were very dirty. We created jobs and safe opportunities for drug users to earn money and take pride in their place so that they don't have to commit crime and keep it clean. An OPS keeps people alive, meets users face to face. We learn their first names. We eat food with them. We speak to their families and lost loved ones, provide them with updates, and encourage users to make healthy choices and changes. I can personally attest to this. I am a former heavily entrenched drug user who had no hope and believed my destiny was to die in an alleyway like many of my friends. I lived on the sidewalk in front of Insight, located at 139 East Hastings, for 3 years. If safe injection sites like Insight and OPS didn't exist, I would not be alive today helping others. That's why I am here today, speaking as a former drug user. This is very personal to me. I know firsthand the pain, suffering, and what it's like to be on the Granville Strip using drugs. Granville has always had a heavy drug problem and homeless situation. Back in the 80s, Granville was referred to as Gramville. There are currently 4 SROs on Granville Strip that I am aware of: the Regal, Siesta Room, St. Helens, and the Murray Hotel, as well as the Vogue. People are saying that our ops at 101 Seymour would bring danger and murder, citing the death of my friend, Thomas Donnelly. There have always been deaths, murders, and overdoses along the Granville Strip. 90% of those are related to the entertainment district and the nightclub scene. Why are not Yaletown residents advocating to close down the bars like District, Cabana Lounge, the Roxy, and the Granville Strip nightclub, et cetera, et cetera, et cetera? These deaths have nothing to do with ops. While I was using drugs along the Granville Strip in the year of 2000, 3 of my friends passed away in the alleyway behind the old two-tiered Burger King on Robson and Granville. Their names were Squeaky, Tanya, and Bobby. They never had an opportunity to make a choice where they could go use a safe injection site. Their families will never see them again. While I was an entrenched user in the downtown east side from 2012 to 2014, sometimes things would get too hot for me in that neighborhood, and I would often go up to the Granville Strip to hide out until things cooled down. Using on the Granville Strip is parallel to using in the downtown east side. An ops there would serve the using community as well as it's way overdue. Most recently, an ops staff member died on the Granville Strip. His name was Michael Charles McGee, born November 18th, 1976. He died abandoned and alone on the Granville sidewalk September 12th, 2020 from an illicit fentanyl overdose. The space proposed for the ops at 110 Seymour is directly across from a drop-in center known as the Gathering Place. There is already a homeless, mental health, drug user community at this location. It will save lives. There are a lot of Yaletown residents in opposition to this. Seems many of these Yaletown folks just seems like they think we're just bums and have nothing in common with, but these users are their cousins, in-laws, aunts, uncles, children, fathers, mothers, and neighbors. As a city, I believe we are leaders in practicing tolerance, acceptance, love, and compassion. Frankly, I don't understand why this ops is even an issue at city council debate. It's insulting. Thank you.
Thank you for signing up to speak and for coming all the way into City Hall to speak to us. You have questions from Councillor Weeb.
Yeah, thanks a lot for coming in today. The questions are on kind of the need and recognizing we've heard some concerns that 580 square feet might not meet the need of the community. Can you speak to what you think would be kind of the most useful facility for the neighborhood, recognizing your kind of experience and understanding of what users in the area might be looking for?
Just a place to go. I mean, 500 square feet is pretty small, but it's a start. This is long overdue. I mean, there's always using along the strip there. I couldn't say how big of a space you need, but I'd say that, you know, like there will always be users on Granville Street. It's heavily populated by the nightclubs. As a former homeless person and drug user, I was often drawn there by the bright lights and the constant action of people being around. And I always thought, you know, I could always panhandle and get a few bucks to use drugs, right? So I think there'll always be people in that neighborhood, and there's a significant need for a site somewhere along there, wherever it is. Even a 500 square foot space is a foot in the door, and it's heavily needed.
Okay, and then there's also been conversations on the need for inhalation and recognizing that where you work has a tent next door that allows people that want to smoke instead. I'm wondering, do you see that as a need for this area as well?
Absolutely. Some people will always, like, you know, they can't inject drugs anymore because I know, like, I have a family member who has no veins left and chooses to smoke fentanyl now. And when it comes to ops and like Insight and stuff, like Insight doesn't have a place for people to inhale drugs. What PHS staff members quite usually do is say, hey, if you're going to smoke your drugs, at least do it outside the place, so we can catch you if you die. At least you're on the sidewalk out front of Insight, right? So they don't have a place for people to do safe inhalation, but they encourage PHS employees encourage people to smoke outside on the sidewalk. So, I mean, if I was problem solving on that, and people had an issue with that in the neighborhood, maybe like a back alley entrance would solve that problem. If people don't want to see people smoking drugs on the sidewalk, a back alley entrance to the site would probably solve that.
Okay, thanks so much for coming to speak today. Really appreciate it.
Yeah.
Thank you, Councillor Weeb. And you also have questions from Councillor Dominato.
Hi there, and thanks for coming in today and speaking about your first-hand experience.
I actually, Councillor Weeb asked a couple of my questions, but I'm just going to follow up with one, and it was specifically about the conversation around outdoor. You signaled that maybe, the past would be, people could go out on a sidewalk. You talked about potentially a backdoor access off of an alley, but I'm just wondering if there was an opportunity to have space, both indoor space, but also adjacent outdoor space. Would that be ideal from your perspective?
Yeah, it's something. Absolutely. I mean, if it gets cold right in the winters, so at ops we have to make do with getting some space heaters and lights, because it gets dark out and you can't see what you're doing at around 5 o'clock in the wintertime. So as long as there's light for people to see what they're doing and heaters for people to stay warm, if there was like some sort of outdoor facility, that would work for sure.
Okay. Thanks for that. And thanks very much for coming in and sharing your lived experience. It's very much appreciated.
Yeah, thank you.
Thank you again, Trey Helton, for coming all the way in to speak to council. Council, we're about to, speaker number 25 has withdrawn, and we're about to move on to speaker number 26. But I am going to suggest we take a 10-minute recess before then. I understand the mayor is back to chair, so we'll switch over the screens for the mayor to chair and give everyone a chance to stretch for a moment before we refocus. Is there somebody who would move a 10-minute recess?
So move, Councillor Carr.
Second, Councillor Dominato. Thank you. And we'll do a verbal vote. All in favor of a 10-minute recess?
Aye.
Aye.
And any opposed? Okay, thank you, Council. So it's 2:37. We will come back to hear from speaker number 26 at 2. Thank you very much.
Yep, you
Okay, clerks, we're at 2:47. Hello, Council. Thanks, Councillor Boyle, for chairing. We got enough folks here to move on with the speakers?
Mayor, still we don't have quorum yet. Let me just do a quick check again. Councillor Hardwick, can you hear me?
Yes, I can.
Thank you. Councillor Swanson?
I'm here.
Thank you. Councillor Boyle's here. Councillor Fry, are you on the line? Councillor Weeb? Councillor Carr? Yes, Stewart, we only have 4 right now.
Okay.
Good afternoon. The meeting will reconvene momentarily. We're just waiting on a couple more.
Councillor Carr, are you on the line? Mayor, still you have quorum.
Great. Thanks very much, Council. So we're moving on. My understanding, we're moving on to speaker number 26, Nadia Idacernia.
Hello.
Hello. Hi. Thank you very much for calling in. You have up to 5 minutes. Whenever you're ready, I'll start your timer.
Great, thanks. Yes, hi, my name is Nadia, and I'm the president of our building here located at Helmkin and Homer, and I strongly oppose this motion. I've lived in this building for 15 years, and things have gone from bad to worse since May 2020. The neighborhood safety, illegal drug activities, overall disorder, garbage has never been this bad. Yaletown community has many kids, families, seniors, and businesses. And the real victims here are the kids growing up in this neighborhood. So the site which I oppose is moving from right here, St. Paul's Hospital, down to where someone was murdered, down to an area where there's a children's park right across the street. I don't know how that makes any sense for anybody. This Helmkin corridor, I would like to rename it Hell Street, because that's what it's become. How are we safe from this? They are aggressive. They have no respect for society, let alone themselves. We women, I'm telling you women, because I've been attacked, I've been spat on, I've been mugged, trying to steal my purse. I'm scared to come home at like 8 p.m. at night, wondering what I'm going to find on my doorstep. This is not normal. Seniors are scared, and we're affected with our mental health. People are depressed. People are anxious. And again, more so with women who are afraid and seniors to go out at night. Good neighbors don't scare you. Good neighbors don't shit on your property, scream at all hours, discard garbage everywhere. And where's the empathy for the real good neighbors here of Yaletown and downtown, where we've lived here for many years? And yeah, this guy mentioning next to Granville Street with the bars and nightclubs, it was fine. Nobody was disturbing anybody, and you know, they're doing their thing. But now they're just roaming around the streets trying to scare everybody. So this is unacceptable. We're the working class. We're contributing and respecting our community. We still want this in our neighborhood. If you care about this neighborhood, please realize what's happening here. Yaletown downtown will deteriorate. I'm already seeing it since beginning of May. It will affect the whole downtown. And if downtown deteriorates, then that affects the whole city and its worldwide reputation. So when you say about stigma, I mean, what about the stigma of the families and the kids growing up here? There's a big family children population, especially in our building here. We're afraid. We don't want this. I mean, VPD calls, I checked into some stats, have gone up 400% since last year at the same time. I mean, is that normal? Violence against women and seniors, we're the most vulnerable, has gone up. Theft, up 36%. Use of weapons. I don't walk around with, I've seen crowbars, I've seen people with baseball bats. I mean, that's gone up about 11%. So I did some research here. I mean, are these normal? VPD calls 750 calls a day, one every 2 minutes. I myself, I've never called the police so much in my life since I had all summer. VPD calls 311. This is not normal. So no, I oppose this. We don't want this. I don't want to see more drugs and all that being used. And a lot of it is illegal. I mean, since when did the law become for the law-abiding citizen? What about us? Right? I've been charged for jaywalking. I got a ticket for that. But these people here committing drug activities, illegal, especially the Murray Hotel in this corner, they don't get a ticket. So yeah, I want you to stop enabling, stop pushing for this initiative because it's not working and we don't want it. It's scaring us and think about the future of the kids growing up here. How's that normal for them growing up in a neighborhood where permissive, illegal drug is given out because this is what they need? What about like parks for kids, sidewalks for seniors?
Thanks
What
very
about
much, and
more
that is
police walking the streets?
That's the 5 minutes. So for your time is over at 5 minutes. We do have a question though from Councillor Weeb for you. Go ahead, Councillor Weeb.
Yeah, the question is, if we vote against this, we're sticking with the status quo and recognizing that we're hearing from the community that we do need to deal with the needs and we need to look at options to ensure that people are getting the adequate services they need. So what do you say when people talk about that this might deliver some of the services we need?
You know what? For me, services are like, what about services for those that contribute to society, right? If I need to go to a hospital, which I had to wait for 5-6 hours. Meanwhile, they're taking care of someone that's doing a drug overdose before me, right? And I'm not saying I'm special, but I had a pneumonia, so I had to be looked at pretty fast, and I had an infection. But they came in and there's 5-6 people taking care of this one person. Meanwhile, I'm still sitting there like the others. So what about services for us, right? We do all the right things, but yet we're not rewarded for our good behavior. You're rewarding everyone for their bad behavior.
Councillor Weeb. Councillor Weeb, do you have any other questions? No? Okay, thank you very much for your time. That's it for your questions. I'm going to move on to the next speaker. Thank you for participating. We're on to Craig Stowe. Craig Stowe, speaker number 27.
Hi, thanks for bringing me on.
No problem. Please go ahead.
Thank you, Mayor and Council, for the opportunity to speak. I do live sandwiched between Murray Hotel and the Holiday Inn. And like the previous speaker, John, I think that we should be hearing for the people that are being affected. I'm speaking today as a father of a young family and a business owner who has lived beside Granville Street for 50 years. I would support the mayor and council in really looking at this issue and voting no to the addition of a drug injection site in a residential community beside a children's park. Spreading disparity and destruction to Yaletown and Granville Street with the opening of a drug addiction center is utter insanity. Our concern really is the safety and security of our families and the employees and the frontline workers who live in this community, who live in this residential neighborhood, the hospital workers, the firefighters, the Vancouver Police Department. We talk to these people on a daily basis, and they will tell us it's never been this bad. We have no room in our community for drug dealers, none, zero. And they have moved to the area and taken over. As soon as the city shut down Oppenheimer Park, the drug dealers came, and they have no compassion for their clients, nor do the people they kill, nor the neighborhoods that they destroy. This community does realize that the hardest thing to say to those in the middle of a drug addiction is no. But what happened to just say no to drugs? The vast majority of people that live here, if they were asked for a vote, would say, we do not support that. We do not support having a drug injection site here. The word safer would infer needles gifted to drug addicts at an injection site would stay at the drug injection site. But no, they hand them boxes of needles and we pick them up daily. The essence of drug addiction is that drug addicts and those that profit from drug advocacy will do anything to get access to more drugs. Supporting drug addiction costs Canadian taxpayers, are you ready? $23 billion annually. The very fact that we really need to discuss today is drug addiction has nothing to do with housing affordability. Let's do the simple math. The high personal cost of maintaining addiction. If you're a drug addict, you're spending between $80 and $325 a day to support your habit. That's between $30,000 and $118,000 annually. And you're saying these people can't afford accommodation? Yet despite the limited supply of illegal drugs, drug sales are rapidly growing. And it's a rapidly growing industry here. Opening a drug addiction center run by Rain City, a for-profit company, will guarantee our community has an increase of drug addiction, drug crime, discarded needles, and violence to the families, the seniors, and the women that live here. I feel that people are not recognizing the fear, the violence that we are having to live through. The placement in a middle-class residential neighborhood is really going to affect businesses. They're going to go bankrupt. Property is going to go down. There's going to be an exodus of the people that actually pay and work and fund these facilities. Mark my words, a new drug addiction center will most definitely lead to an increase in deaths in Vancouver, not a decrease. It is common knowledge that Rain City Society is being evicted from their operation at St. Paul's because the drug addicts disrupted the operations of the hospital to such an extent that the frontline workers who live in this community, the nurses and doctors, demanded they be moved. Their calls for help were finally answered when one of the Rain City workers was murdered by a drug addict in the pop-up drug facility. How anyone believes that moving a drug injection site from the hospital to a residential neighborhood is a great idea needs a real reality check. Let's remember that Granville Street is a gateway to Vancouver tourism, which has been devastated, and the Vancouver Business Corps. It seems that government officials thought that East Vancouver was such a vibrant showcase of drug rehabilitation to the world that they should move it to our corridor. The more money we inject in drug addiction services in the city of Vancouver, the more drug addicts we create, the more drug addicts we attract to the city, and results in more people dying of drug overdose in Vancouver. What is the solution? And the only solution is to build a mental health drug facility outside of the city of Vancouver.
Okay, you've got some questions. Councillor Dejanova, go ahead up to 5 minutes.
Thanks very much. And so sorry, Mr. Mayor, I'm reconnected now, but which speaker is this?
This is speaker number 27, Craig Stowe.
27, thank you. Okay, thank you very much. Craig, is it okay that I call you Craig?
Absolutely.
Okay, I caught your remarks, but sorry, I was having some trouble connecting back onto my computer here. So just to ask you a few questions, I hear a lot of emotion and passion in your voice. What can we do? And you don't have to answer my questions. On the public safety side of this, I mean, we're supposed to stick to the recommendations, but are you aware that there is a motion on the agenda that addresses public safety? For these weeks, it'll be coming forward another meeting, motion B9. Are you aware of that?
I think that we're all very aware that the fact that this has created a higher level of crime and a higher level of disruption.
I'm not saying you shouldn't speak about it here. I just wanted to make sure that you also knew there was an opportunity there. I'm wondering if you might be able to share with me some of your thoughts in just a moment or so as to what you thought that we could do as a council to bring the community kind of closer together if we were to be able to, you know, is there a way that we can support a safe injection site and make people feel heard and listened to here at City Hall? Is there a way, or is that pie in the sky? I'd like to know your opinion on that. And then also, I mean, do you think clean supply would help some of those issues?
What you could do is you could put it to a vote, put a referendum and ask the people in this community if that is their priority, if that's where they'd like to spend the money, their taxpayers' money. Is it providing drugs and a safe injection site? Is it handing out boxes of needles to drug addicts?
But if clean supply could help with property theft, I'm just asking the questions here that relate to the report. I mean, and what we heard from the Vancouver Police Department earlier, if that could help, if a clean supply, which isn't specifically offered here right now, but if that could help with deterring property crime and some of the other issues and disorder you've mentioned in the community, would you support that?
Supplying people with drugs is not a solution.
Okay. Thank you for sharing that and your comments with us today.
Thank you. You also have questions from Councillor Dominato. Go ahead, Councillor Dominato.
Hi there. Yeah, just two quick questions, and maybe you've answered it with just your last answer, but I have heard from many residents and received a lot of correspondence on the subject of this proposed lease. And what I heard in the correspondence was that there was an openness to OPS within South Granville downtown neighborhood. The question and concerns that I saw the most was raised around the specific location proposed in the adjacent to Emery Barnes Park and the playground. And I'm just wondering, if, it sounds like from your last answer that you have a different perspective. It's not even about location. It's just fundamentally philosophical about whether we should be offering a safe space for people to use safely.
I don't see it as a safe space. If you're giving out boxes of needles, then people are going to go home and inject at home. A real safe injection site, if people do the research on it, they talk about Portugal, they talk about Switzerland, people come and inject within the facility and they're watched over to make sure they don't overdose and die. They're not handed boxes of needles and let go on their merry way to inject at home and die. So the idea, the word safer is not, it's an oxymoron. It's not safer to hand out boxes of needles and expect people to inject safely.
So, and I appreciate your perspective on that. I don't believe that is the model proposed here, and I will certainly, we'll follow up with our staff, but my understanding that this proposed overdose prevention site is similar to what we've seen. I've been to ones in the downtown east side where there's supervised injection. It's not sending people away with needles, but I will follow up with staff with that question. I guess the other consideration I have is that in that vein is, I guess it's to Councillor DiGenova's point, is if I've heard from many people their concerns about needles in the park, on the playgrounds, in the streets, that actually potentially overdose prevention site could offer that people are using safely, so that but then the needles themselves would stay there. Do you see that as a public safety benefit? I see
the big concern is onboarding and offboarding. People have to arrive at the site and they have to depart. So if they're arriving at the site, coming down from a high, and then injecting and leaving the site, they interact with the community. We really should be building facilities like they do in Switzerland that are outside of the city core where the temptation and the drug dealers live, and providing a real mental and a real drug facility is that rehabilitates people. What we are doing is we're amplifying what the situation is right now. Keeping them and providing them with drugs within the inner core of the city is just going to explode the issue we have right now.
That's the 3 minutes.
Yep. Thanks for your time.
Thanks very much. There's no other questions for you, sir. So thank you very much for participating today. I'm going to move on to Lily Crayon, speaker number 28.
Hi, I'm here. Can you hear me?
Yes, we can. Thanks very much. Please go ahead.
Great. Hi. My name is Lily Cryan. I live in Vancouver at Prince Edward and 26th, and I work downtown at Richards and Robson, just about 4 blocks away from 1101 Seymour. I'm calling in support for Report 6 with more space allocated for Swan and Reed City Housing Overdose Prevention Site. We are in the midst of both an overdose pandemic and the COVID pandemic. My best friend's sister, Marnie Jarvis, died from an overdose in May, largely because she was unable to attend her usual meetings and access usual services during COVID. She was my friend and she was part of my community, and her death is devastating. I don't want anyone else to die for lack of access to services. Right now, I've heard speakers arguing about whether someone's right to not die is more important than residents' property values or a sense of safety. We're seeing huge spikes in overdoses in Vancouver, and to me, the only ethical thing to do is to provide more space and services to prevent any overdose death. The indoor expanded location at 1101 Seymour Street will help people use safely. People are currently self-medicating with illicit drugs to cope with the added pressures of the pandemic, and we shouldn't be forcing people into riskier use during this stressful time. People who use drugs are members of our community. I work, again, about 4 blocks away from 1101 Seymour, and I often walk around the neighborhood to go to the park, Man City Theater, before it was closed for the pandemic, and to shop at local businesses. I've never felt unsafe in the neighborhood, and I welcome the added services so that members of my community are supported and cared for as the key members of the community that they are. Speakers ahead of me have stated that closing Oppenheimer was part of the problem. The city should take that as a reminder that displacing communities always comes at a cost, and they should not displace any more homeless folks during COVID-19 or after, and that includes Camp KT in Strathcona Park. We need housing first policies and services. In the absence of that, this expanded site is a good stopgap measure to help people in a time of immense need and crisis. The Downtown Eastside Women's Center released the Red Woman Rising Report in 2019, which City of Vancouver staff have taken up to implement the recommendations. This report aligns with the Report 6 aligns with the Red Woman Rising Report. I want to read item 25 under the heading of recommendations for Indigenous women's wellness in the Downtown Eastside Expanded Health Services on page 185. So, recommendation 25. Declare the opioid crisis a national public health emergency that disproportionately impacts Indigenous women, and expand funding for immediate health-based solutions for the opioid crisis that focus on the specific needs of Indigenous women. This includes full spectrum of recovery supports, including immediate access to Indigenous women's detox on demand and treatment centers, Indigenous-run treatment centers that use culture as treatment with Indigenous healing methods and land practices. This one is specifically Report 6, more indoor overdose prevention sites and consumption sites, including culturally safe sites for Indigenous women only, decriminalization and access to safer drug supply, opioid-assisted therapy and programs and full spectrum of substitution treatment options, longer-term funding for a range of culturally safe treatment programs, and provincial regulation and oversight over all recovery programs and facilities. Prohibition has never worked. These services for overdose prevention and sex workers help uplift the most marginalized people in our communities who need support. The stigma against drug users never helps people who use drugs, and is part of a vein in our society of making the drug use someone else's problem. The question from most counselors seem to be questions to try to discredit these services and raise the specter of crime to dislocate community members. We know that these services work well. We've seen it here with Insight and around the world. Harm reduction works, and we need to keep investing in it. Thank you. Hello?
I'm sorry, I was on mute. Thank you very much for your calling in today. And there are no counselors on the queue to ask you questions. Just want to thank you very much for calling in. And again, very sorry about your loss.
Thank you.
Thanks. Council, I think we're going back to speaker number 20, Brian Georgievsky. Mr. Georgievsky.
Can you hear me okay?
Yes, we can. Go ahead, up to 5 minutes.
Awesome. Great pronunciation things. I live in the neighborhood. We just moved here at the beginning of 2020. So we were from out east, so we're pretty new to Vancouver. There's no surprise this is a very polarizing topic, as we've read in the media before we moved here, and I guess that's sort of we're understanding now. There's arguments I've heard all day on both sides that have been very compelling, very intriguing. And I'm not going to bore anyone with with a story about why we moved here, why we chose Vancouver. But again, I really do see both sides of the issue, honestly. I see firsthand and hear about how serious this overdose crisis is. It's terrible. There's no arguing that. I mean, we live on the second floor of a building that faces the Howard Johnson. And I've had to call 911 countless times to say, can you please, I think there's someone literally dying in the alleyway. Can you please come look at them or just make sure they're okay? Few things, and I guess I should preface the conversation by saying I do oppose this motion. Few things I wish happened here first. Everyone that's called in, I hope, or at least I wish that someone asked where they live. It's easy. I mean, if you live on the other side of the city or in Burnaby or who knows where, to say that you support this, but I think living in the neighborhood gives you a little bit more of a perspective on what things are like here. Secondly, I truly can't believe it's actually a discussion. I mean, there's a children's park across the street. Again, it's a children's park. Kids, families, women, seniors. I mean, these are individuals who frequent this park all the time. I'm out there all the time. There's always just small kids running around and playing. So again, I see the value of an OPS, I promise you. But why across the street from a children's park? Another issue I have with this is that as soon as someone opposes this issue, we're considered NIMBY. I mean, we're considered bad people. We're considered people who don't mind other people dying. I don't know why those who oppose this are considered such terrible people, or at least being branded as terrible people. It's a little unfair, and it does suck that you can't actually come forward and oppose something like this without just being labeled right away. So there's stigma on both sides. One of the other questions, I know a lot of people spoke about this, is that if overdose deaths aren't even close to as high in this area as they are elsewhere, why is this being implemented here? I wish someone maybe could point that out if you haven't already. Again, the point of my entire call here, across the street from a children's park. I probably won't take up the 5 minutes. I do have a few things I'd like answered from someone. As I'm sure you guessed, why is this even being considered across from a children's park? Secondly, is the mayor of Vancouver allowed to notify the general public on his personal website to vote in favor of this motion? There was a notification that came out, I think it was either earlier this morning or earlier on this week. Subject title automatically populates to vote yes, OPS saves lives, and then includes a pre-written and populated 6-paragraph note that includes stats and a very biased opinion on why you should vote yes and what you should send to council. Were any councillors aware of this? Can someone please speak on this? It also states at the bottom that this campaign is hosted by Kennedy Stewart, Mayor of Vancouver. Want some clarification, is this a campaign or a public hearing with council? Thirdly, when this passes, because I honestly truly believe City Council is too afraid to have their name on record opposing this, what is going to be done to ensure that those that are at the park aren't, I guess, assaulted or abused or physically assaulted by anyone leaving this site? So I've heard some previous callers mention onboarding and offboarding. Someone goes into this facility, they shoot up or they inject. what's happening once they leave. That's honestly what my main concern is. I mean, we want to start a family here. We want to start having kids soon. My wife goes to the park all the time to walk her little dog. I just want some clarification on what's happening once they leave. So again, it goes back to why is this across from a children's park? There are, I bet, thousands and thousands of other places we can put this. I know that sounds NIMBY. I know those on the other side are going to say, this guy's a NIMBY. I promise, I just want some answers. And if someone can please speak on behalf of some of those points, I'd really appreciate it. Thank you.
Thanks so much. I don't have any counselors on the queue to ask you questions, so I'll thank you for calling in today, and we'll move on to the next. We have speaker number 29, James Faulkner.
Hello, how are you?
Fine, thanks. We can hear you loud and clear. Please go ahead.
Excellent. Thank you very much for the opportunity to speak. I'm a resident, an employer, and a business owner in Yaletown, and a father of a 12-year-old on our way to high school next year. And I'm also the host of the Social Ramp podcast, where we talk about these issues extensively. I strongly oppose this motion, but before I get into why, and please don't cut me off, because I've been waiting all day and actually last week to do this, so I appreciate it just having this airtime. Let me just impress upon you and the rest of the audience that the drug addiction and crime issue in the south of downtown has assembled a community of extremely bright, strategic, and influential people who maintain an unprecedented ability to affect and communicate logic and common sense. So this is the awakening of the silent majority. So if we keep pushing and pushing and pushing initiatives like this, it will bubble up and change things very quickly. So I know this is kind of new to everyone on council here, but you must either choose to be an alliance of strength and logic or on the side of dysfunction and weakness. Logic will help all those in need, but weakness will only prolong their pain. We must stop enabling drug addicts and lawless behavior and truly help these poor people with a proper business plan. We are doing one-off situations constantly, and it is not working. So now, please, let's talk about stigma, because it's been a word that has been throughout the taxonomy of this entire debate. So should there be no negative associations around the paradigm of drug addiction and the open use of lethal and illegal drugs, or should it be celebrated and a great thing that helps families, boosts productivity, and moves our culture forward? The answer is no. Stigma will not change regarding illicit drugs and the drug addicts within the underbreath and behind the closed doors of the members of this community. Vancouver residents deserve and receive what they paid for. Void of drug income-reliant crime and dysfunction. We don't want this in Yaletown. So it is NIMBYism to its fullest. This proposed site will result in a further migration of dysfunction to the radiating area. Now, these activities need to be somewhere else other than the proposed site on Seymour. Onboarding and offboarding of these, the transaction is where the issue lies. The drug addict culture and lifestyle is just not compatible in this area or any developed area. It only seems to thrive in areas that are broken, i.e. downtown east side. People are agitated upon entry and in an altered lawless state after they leave. So in order to attain their drugs, they must steal and rip off the taxpayers who are paying for their programs. So let me ask you guys, would you have your daughter or child walk to the high school King George and have to go through the addict curtain of the Granville corridor? Based on this, we, the citizens, are the marginalized. It has taken years to clean up Granville Street and the outbound arteries and inbound arteries. We've added bike lanes, beautiful parks and buildings, spent millions of dollars, got rid of open drug dealers and prostitution, and now it's gone backwards. This is the international red carpet to our city from YVR. It's the doorway to what we present as a culture. And now we want to approve, support, and encourage the assembly of people who cannot even function within the law in a location that will become a magnet for dysfunction and crime from all over the country. As city members of council, you've been given the responsibility to maintain our local, civil, and provincial and global reputation as one of the best places in the world to live. This is on your shoulders with this vote. You will all have to live with the guilt far after your tenure on council as the group that betrayed the majority and played a major hand in ruining the city we all love and pay to live in. Imagine an Uber driver explaining to a rider as they have to slow down to a heavy drug user staggering in the middle of the street on their way to one of our events or hotels on Seymour Street. The residents are not equipped from a security, conflict resolution, and self-defense perspective to handle the majority of these people. So if you truly care about the majority of people in the city, do what you're voted and empowered to do. This will be the single most pivotal decision you'll make on your tenure in council. I plead, I would love your questions.
Thanks very much. I don't see any questions on the queue for you, but appreciate you calling in.
Doesn't surprise me.
Oh, no, you do, Councillor Hardwick. Go ahead, Councillor Hardwick.
It's really hard to listen to this, as you can imagine. And you're right. It is such a damned if you do, damned if you don't on this one. It's interesting to hear both sides of the issue, but I think too about life on the street and how that's coming across for young kids and how they're going to be perceiving it. And it is a nice reminder that it is the taxpayer that's footing the bill for this stuff. I don't think that that's fully understood.
Question?
Yeah. Thank you, Mr. Mayor. How do you respond to this notion of being classist? This is something that keeps coming up in the argument that this is a classist perspective. What's your response to that?
Well, my response is that it's basic culture in everywhere around the world, that there are different tribes of people who have different abilities. There are people who build the city. There are people who just live in the city. There are people who move it forward. There are people who keep it. If we want to be classless, I don't see that ever happening anywhere in the world. It is an untenable idea. Like you can't. You're sitting there in City Hall. I'm sitting here at home. I would say there's a class difference. You have more influence than I do. That's a class. I mean, there are billionaires out there. It's a different class than me. I mean, I do understand what you're saying in terms of, like, nobody wants to watch another person die. But the problem is we have no business plan that makes sense. If this was a business, it would have been bankrupt a while ago. The problem is it has unlimited funding with zero oversight. That's why it can continue to be a dysfunctional business that has no actual profit. The profit would be less people dying, less drugs on the street, less people homeless. We don't have that. We have more people coming from all over Canada to Vancouver. So if we want something classless, I think we need to attack the problem, help people. These people are sick. I may seem like a NIMBY person. You know what? I'm tired of that brand, by the way, because, yeah, who does want that in their backyard? It shouldn't be in anyone's backyard. If I see somebody and I look in their eyes and they're completely out of it, do I feel good? I feel awful. But I'm not going to invite more of those people next to my park where my kid plays. That's not happening. Would you invite them into your front yard?
Thanks so much.
Thank you.
That's it for questions. Thanks so much. And we're on to, thank you. We're on to speaker number 30, Dallas Brody.
Hi, can you hear me?
Sure can. Please go ahead. Up to 5 minutes.
Okay. Good, thank you. My name is Dallas Brody. I'm a spokesperson for Save Our City, Vancouver. And I want to make my comment now. I've been listening all day to the various comments coming in. Intelligent bunch, you're on the phone today, I can say that. As a group, we are opposed to any more of these sites being opened anywhere in the city, not just here in Yaletown. The public or some people think that another site will help reduce overdoses, but it won't. It will only bring more addicts and more disorder into the neighborhood. The situation is also already dire in Yaletown. There are piles of garbage, discarded belongings, needles, feces, urine, noise, aggression. The proposed site is across from a park where children, families, seniors, pets, and so on are supposed to be able to safely recreate. It's bizarre that the rules that apply to cannabis stores are now being shoved aside in favor of a safe injection site for illegal drugs. Illegal drugs. Okay? You can't open a cannabis store near that park. And that's a legal drug now. It's just not reasonable. I would highly doubt you're allowed to have a liquor store right next door to a children's park. It's outrageous how the whole discussion of this has shifted into the land of loony bin. It's like we're now saying, oh, sure, let's have all of these people right next door to a park. And
Point of order, Madam Chair.
We have a point of order.
And I don't know the reference number, but the term loony bins is very stigmatizing, and I'm just flagging it for council, and I'm sorry I don't have the reference.
I'm not talking about people. I'm talking about the paradigm within which we're talking here. We're shifting the conversation into a concept that isn't even grounded in the reality of the bylaws that are already used by the city of Vancouver regarding liquor stores and cannabis stores. We've lost track of the fact that this is still an illegal drugs that are being used. These aren't even legal drugs. And we're talking about now putting a facility right next door to a park that was bumped out of the very hospital where lives could have been saved immediately. The hospital couldn't handle it. The hospital, St. Paul's Hospital, which has been handling the vast majority of these difficult cases for 20, 30 plus years. And this concept of the onboarding and offboarding, the condition that the people are in when they arrive at this site, the condition they're in when they leave, it just doesn't make sense to talk about these sites as if they stand alone and will solve all the problems. They simply won't. We argue, and I've said it already, it will make things worse for this neighborhood, and it will attract more and more people who are drug addicted to this area. Also, for the groups who say that this is NIMBY or a class war, it's my view that this is an attempt to silence legitimate concerns that people have. This is the old way of saying, oh, you're just that or you're just that. That's outrageous. We're all part of this city, and we all get to have a voice on how we feel about things. That's why this hearing is being held. Even the tone of voice of some of the advocates for this plan reveal the contempt they have for the host neighborhood that they're urging take in this site. They seem to not only have zero compassion for the people living in the neighborhood. I haven't heard one of the advocates for this site say that they are concerned about children, or that they're concerned about seniors, or people who are frightened to walk down the street at night times. I haven't heard any compassion for those people. It's a one-track issue for them. And
okay, Speaker, we just try to keep it. Speaker, if you could Speaker, if you could just not comment on what other speakers say, and just on this.
I was talking about people saying that we're NIMBYs. I think we're allowed to respond to that, Mayor.
Yeah,
and these people have also shown zero. Just a minute. I've heard zero gratitude for what has already been provided for this group, and I also would like to know how these groups would like to address the concerns that residents have. Perhaps what are the ideas they have for reducing the impact, because this is probably going to go ahead, because we know the letter you sent out today, Mayor, which seemed highly inappropriate, considering your role in the city, supposed to act for all of us. We all read it. It was shocking to read, actually. And so now I'm here. I'd like to know what these advocate groups will do to reduce the impact on the neighborhood. Will they agree to escort people to and from the site?
Yeah.
Will they provide their own security services?
And we're not here to talk about other speakers. We're just here to talk about this application.
I'm talking about, you're casting a very broad net here about what can and can't be said.
Yep, just 30 seconds.
Well, I would like to know if other groups advocating for this are going to provide other services to assist the neighborhood to absorb this site. There needs to be more said about how this is going to impact the community, and the advocates need to look at that and do some work on that part of this equation. Thank you.
Okay, thank you. I don't see any questions on the list, but appreciate you phoning in today. We're on to speaker number 36, which is Mark Poy. Mr. Poy.
Hi there.
Hi, go ahead, up to 4 minutes, please.
I'm opposed to the lease for the Rain City Support Society for Overdose Prevention at 1101 Seymour. I'd like to take this opportunity to express my views as a resident of the neighborhood.
Sure.
I believe it's helpful to gain perspective when speakers disclose whether or not they live in the neighborhood and would be directly affected by this. I've lived in Vancouver for 30 years in various areas of downtown and the West End. Previously lived at 1155 Seymour from 2012 to 2014. 2 years ago, my wife and I used our life savings to purchase a condo at the 1200 block of Seymour. I believe safe injection sites and safe supply of drugs are a good idea that will save lives. I've had friends that have died from drug overdoses in the past, but I believe it would be a huge, a monumental mistake to lease 1101 Seymour for this purpose. This is a terrible location for many reasons. I believe Rain City and the supporters of this have not done a thorough analysis to determine if the site would be workable or sustainable. This could be anywhere else in the city. Any drug addict will tell you they go where the drugs are. Emery Barnes Park was a vibrant place, hosting many enjoyable community events. You'd usually see people of all ages enjoying the park on nice days. You'd see kids on the playground. People with their dogs would fill the park. This was a wonderful place and very valuable to the community. When COVID-19 first hit, it was one of the few places people could go outside their apartments and still smile to their neighbors while staying a safe distance from each other. I remember a time when this neighborhood and the Granville core were not a desirable place to live. This was not a good thing. The city worked hard to change this into a vibrant, livable neighborhood, improving the lives of its residents and increasing property tax revenue, which pays for social services. It's worrisome when we see changes that would erase this progress. Yes, drug addiction and homelessness are serious issues that need to be dealt with, but they must be dealt with in a sustainable way that does not ignore the concerns of the majority of the residents in this neighborhood. There's already a large concentration of social services in this neighborhood, with Covenant House, Coast Clubhouse, Coast Resource Center, all concentrated on the same block, and Gathering Place only a block over. But we put up with the disturbances that they cause because it's important to help the most vulnerable in our society, and they work very hard to minimize their impact on the community. Since the Howard Johnson on Granville Street has converted into a homeless shelter, it's created a tipping point where the concentration of people with mental health or addiction issues and their associates have created an unsafe neighborhood. It's insulting when people running these services or people living outside of this neighborhood say that these services have not caused problems when residents in this area can clearly identify they have. My wife and daughter no longer feel safe to go out alone during the day in our neighborhood. You rarely see senior citizens in the park anymore. Well, before, this was a really popular spot for seniors to enjoy. Frequently, I spot drug dealers when I'm walking my dog past Emery Barnes Park. The dog park is used significantly less since needles have been found there on several occasions, and neighbors have warned each other not to go there anymore. There's constantly trash everywhere in the park and on the streets. There's frequent urine smells throughout the neighborhood. There's often homeless people passed out in the park and shooting up in the park. Emery Barnes Park is not a suitable chill-out spot for drug users post-shooting up. I've witnessed acts of violence and attacks in the neighborhood, which I never saw in the many previous years I've lived here. And I've heard stories of other violent attacks from my neighbors. Of course, a safe injection site anywhere in the city will save lives, but it's also true that a safe injection site will attract drug dealers. And not all drug users will use the site. Some will only come to this area to purchase their drugs. I believe a safe injection site is an important step for harm reduction, but this neighborhood cannot bear this high concentration of social services. The need for these services shows up in this neighborhood because the services are there. If you move these services to any other neighborhood in Vancouver, they'd be used in that neighborhood. I believe not only should we block the overdose prevention site, we should also take a second look at the impact of the mobile van and the homeless housing on Granville. From what we've seen so far, it proves that these services are not willing to work with the local residents of the neighborhood. I've heard people that are for these services, saying they make efforts to take care of the issues that arise from these services, but it's very important for them to know what they are doing is not adequate. I wonder why this is why is this not being put in another neighborhood? There are several Vancouver neighborhoods with no social services. Why not put it there? If you build it, drug users will come. I've heard several speakers say they feel this is an important service to put in this neighborhood, but I've not heard any of them say they live in the neighborhood. The value of this neighborhood has dropped significantly. Well, property in Vancouver overall has increased in value. I personally lost money on my investment. I've not heard any plans for compensation for the residents who've invested in the neighborhood.
Thanks so much. We're just at 5
Rain
minutes,
City.
so I appreciate you phoning in today. And we're over the 5, and I don't see councillors with questions for you. So thank you so much for calling in. And I'm going to move on to the next speaker. Clerks, I think it's speaker number, maybe you can just prompt me here of where we're at. Yes, speaker number 22 is called back in. We have Andrew Pollard. Andrew Pollard.
Thank you. It's good to be here. You know, I've got to start off by saying how insulting it is for the council to consider this a public consultation when you start off with the framework that either you're going to vote to sign this lease or you're going to have this mobile van parked in this area across the street from a playground, and those are the only two choices. You know, they say the road to hell is paved with good intentions, and it seems like this city council is hell-bent on paving this highway to hell through other parts of the city where it never used to exist before. I cannot believe how quickly the city has deteriorated under this framework where everyone's a victim and where literally taxpaying citizens are chased out of their home, of which the city has put countless resources into building up to a place to raise families. Instead, you're now chasing these families out and replacing them with drug addicts, illegal drug addicts. The amount of crime, now it was said that this opioid van, set up shop in May. And since May, crime has escalated at rates in this area, of which I never thought I'd see again. You know, you're saying that this is a temporary solution. No, you're creating another magnet of misery in this area where families are going to be pushed out, and you're going to have another downtown east side here. You're going to have another Strathcona. None of you are talking about solutions to actually pick these people up and help them get into the treatment they need. You're trying to give more resources to money, drugs, needles to actual addicts. And find me one situation where that has ever helped any drug addict out of this. You've turned the city into Canada's bedpan. And frankly, none of you have put together a proactive solution into figuring this out. You know, the constable who was on here before as a representative of the VPD seemed shocked that this is even on the table. He said that this is the second least area in the city where overdoses are happening. They should go to where people are actually dying, and it's certainly not Yaletown. You know, there are more overdose prevention sites in East Vancouver, and yet that still seems to be the hotbed of where most of these overdoses are taking place. Now, either these things don't work at all, and they're just serving as a magnet to bring in more drug dealers, more criminals, and once again, you know, we can talk about whether these people that are addicted to drugs are criminals. I don't care about that. If people want to use drugs, that's fine. As soon as it turns into property crime, vandalism, violent crime, and as soon as it chases good tax-paying citizens out, and they can't use their services, such as the parks, of which, you know, we've as a community have spent so much time trying to build up, then that's where the issue is. Why is this city council so hell bent on increasing the livability of the city for addicts, for people who bring criminal elements in the city, and so hell bent on chasing families out? You'd have to be crazy to want to raise a child in Yaletown now. You'd have to be. I feel so sorry for people that have made investments. There's a brand new tower that just came in. They're right on the corner of Emery Barnes Park. Geez, I can't imagine how you know, honestly, it's sitting here and the audacity of all of you to give us two options. One is you either go with us, or the other option is, well, we're going to do it anyway. It's disgusting. All of you should be ashamed of yourself. I yield my time.
Thanks. No questions for you. We'll move on to the next speaker. I think we're on, if the clerks can just prompt me here, we are on speaker number 37, who is Jesselyn Regala.
Hi.
Hello. 5 minutes whenever you're ready.
Okay, sure. So I live probably a block and a half away from 1101 Seymour Street. I've lived in this neighborhood for over 10 years. I've also worked on the Granville Strip at a nightclub. This is prior to being pregnant, of course. And I used to walk home at night. My shift would end at 3 a.m. in the morning. So that'd be like Friday, Saturday. Also Sunday nights on a long weekend. Never felt, well, I should rephrase that. Sure, I felt threatened, but I still made it home safely. No one jumped up at me. It's just the regular scare of being a woman late at night downtown or in any city. But since, I guess it's more like this past summer, I've noticed a change in the neighborhood. It has changed over time. I didn't oppose the shelter across the street from me. It's up on Hornby Street, and that's the community builders housing site. Didn't oppose that because I believe that everyone needs housing. There has been some situations that were shocking where I did have to call the police, but now with everything that's happened, especially in the past summer, I've had to sort of redirect my thoughts on what we're doing for the community and for people with addiction issues. So I oppose this site. It is close to a playground that we no longer go to. We're finding other ways to be outside. I don't have an outdoor space in my home, so that's now taken away a lot of our outdoor activities. So I guess that's just all I really wanted to share. I've lived here for over 10 years. I am part of the community. I lived in the entertainment district. I have a daughter now, and I am scared. I don't feel safe in my own neighborhood. And that really sucks because I've been here for over 10 years and I've seen it change. I thought it was for the better, but like this past summer, it hasn't been. And just to like echo what other people have said, the people that do oppose it live in this neighborhood, and the ones that are for it, they haven't stated where they're from, but it doesn't sound like they live in our neighborhood. So they don't understand how it feels or how it is on a day-to-day basis of living in this environment. So I guess that's really all. I just echo what my neighbors and what the other people have said that live in the community.
Thanks so much for calling in. There is a question from you from Councillor Kirby-Yung. Councillor Kirby-Yung, go ahead, up to 3 minutes. Might be on mute. Still can't hear you, Councillor Kirby-Yung.
Sorry about that. My system double muted. Thank you. I have one question for you, and thank you for being here. My question is this: would you, if services like this are put in place without consultation with the community or without some mitigation and measures in place to manage some of the impacts that speakers have identified, would you leave your neighborhood, or would you not move into it if you knew that these services were coming in without those plans and supports in place?
I think I would. When I moved in here, I had some friends who they had small children already, and they've moved out. So I saw this as a place where I could build a family, and I could be here long term. As of now, I don't have a choice to move out at this moment, but if I did, that would be something I would consider. I didn't grow up in the city. I grew up in the suburbs. There's a different kind of vibe of like play and safety you get out there. And I felt that when I first moved here. So I don't know how I'd feel now as my daughter gets older. She's 2.5, where she's going to be going to school and making friends in the neighborhood if there's any kids left. I would consider moving if things don't get better.
Okay, and you mentioned that you had some neighbors or families move out. Is that sort of a lot of it mostly families with children, or can you describe sort of who you see leaving the neighborhood?
Oh no, they're people with children. I have a friend who lives just a block away from me. They're on beach as well, and they're moving. They're planning on moving. They're looking for a place to leave now.
Okay. Are they looking to move out of the downtown altogether? I'm just curious what impact it's having on people.
Yeah, they're planning on leaving downtown. So I also have another friend. They just found out they're pregnant, and they live also like 2 blocks. They're like Thurlow and Beach, and they're expecting, and they've had their car broken into a few times, and they're considering leaving too. It's just gotten so bad. Like we all, we're like in our 20s or whatever when we moved down here. And we had all these like great visions of building a family and a life here. And it just seems like we don't have a choice in the matter. It's just kind of slipping away from us without our choice. I don't know if that makes sense.
Yeah, it does. I can hear the emotion in your voice, and I appreciate you sharing your experience. Thank you very much.
Thanks. I have a question from Councillor Dejanova. Go ahead, Councillor Dejanova.
Thanks very much. Ed, I'm not sure if you'll be able to answer this question, or you don't have to try if you don't want to, but just in hearing sort of a lot of emotion from other speakers, but also in, hearing your respectful comments and the way that you're voicing your opinion. Considering your situation and the concerns that you have, and you'd also noted sort of safety and you and your kids. Considering we're talking about an overdose prevention site here, not to ask the exact same question as Councillor Kirby-Yung, but what would it take to bring the community together to, consider solutions that would perhaps mitigate some of the issues that you've mentioned in the neighborhood? And do you think that, is this 100% no in your mind, or is this maybe, but I'd need to think about it and need to, have some considerations for where it goes, or like some input? I'm just wondering, not to put you on the spot, but what will it take to kind of get away from that us against them mentality on either side, in your opinion?
Okay. Yeah, so I feel like that might be, there's like a 2-parter. Like, I'm not opposed to them getting help. I don't know if having an overdose prevention site is actually helping them. And beyond that, I don't know like any more than that. I know from my experience, it's definitely changed. Where now, like, I would have never thought to call, be on an agenda or like talk to city council about anything, because I didn't feel like I really needed to. And now I feel like I do. So I don't know. I'm not opposed to them getting help. I'm opposed to seeing it in my neighborhood. I've had needles in front of our lawn or in front of our building. That's something I've never seen before. And we have the community builders shelter, like a block or like up the street from us. And that's something I've never seen. So I don't know if it's the timeline or what's happening.
Your comments also to city council. Would you mind sending them to us, the web form? Like, just sure. If you can, whatever you have jotted down. Yeah, so sorry. I didn't mean to cut you off, and I have 30 more seconds, so you can go ahead with.
Sorry.
I just wanted to make sure I asked you that. Go ahead.
Okay, sure. So then I wasn't opposed when that came into your building. The second thing, I think your question is, how can we bring our community together? I think this is helping, because now we're seeing the voices of our community and how we do not want this for these reasons. So to bring us together, there has to be some sort of compromise. If we're going to have that in our community, what's going to happen once they leave the injection site? I think a couple of other speakers before me had the same question. What happens when they leave? No one's like watching them. No one's regulating what they're doing. Okay.
That's my time. I'm so sorry, but thank you.
That's okay. All right.
Thanks. And we don't see any other councillors on the list, so thanks for calling in and sharing your perspective. We're moving on now to Natalie Gallen, speaker number 39.
Hi.
Hello, up to 5 minutes. Yep, whenever you're ready, up to 5 minutes.
Okay, I didn't thought I will talk anyway. So, my name is Nathalie Galin. I'm live in Homer Street in Yaletown for 6 years. I raise my son and I'm a single mom. I invest in Yaletown. And I work also in Gastown. So I know a little bit very well the two neighborhoods. So far in Gastown, I never see any improvement. And it's worse and worse. If you never walk on Hastings Street, I did it. And I can tell you, my son and myself, we walk on Hastings Street because I want to show my son what is it to be a drug addict, to don't, what we can do, Alexander. So it's disgusting, that's it. And I work also on Water Street because I have a little food truck. So anyway, I can serve also homeless. But when I see in Yaletown what happened at this moment is disgusting. I walk every day on not every day because I don't want to take this street anymore, but Granville Street. I can't believe how much money you spend for all these drug addicts. Because anyway, you're not solving the problems. You have to stop it. Because more and more, and it's getting worse and worse, the city. I can tell you, in Gastown, I saw, like, if you walk or if you take your car, I don't know if you go sometime, but this year is like nonsense. More people are more right than I have. I raised my son in a certain way. I'm from France, Europe, and I'm 51, and I can tell you, I never saw such a city getting disgusting and disgusting, but the prices are getting higher and higher. I pay so much tax. And when I see that, last time I was at this little park, I saw a couple, his girlfriend was totally out. The other guy has a needle in his arm in front of the children. I screamed to him and I said, what the fuck? You're putting this needle in front of the children.
Oh.
And the guy, you know what he told me? I'm going to stay with you. No, I'm going to stay with you.
I understand you're upset, but I just ask you not to use profanity. Thank you.
But it's not a profanity. I think also, so anyway, I would like to know, where do you live also? Where do you live? In West Vancouver? On the top of the mountain where no one is there? Me, really, I don't want to raise my son because I have a certain dignity. And I don't want to walk down in my neighborhood. So neither people totally out. And they are, like I say, more right than me and calling police. It was such a safe, nice neighborhood. And it's still a little bit. But I can tell you, I'm getting frustrated. And that's it. And my son too. Because first of all, is a community center. It's closed for homeless shelter. At the end, before it was like a place to play basketball, to have, people going, gathering, pretty nice. It used to be to go to Elsteroid. Now it's a little bit older. Elsteroid, they used to take the needle out. So it's true, like if you bring more dealers, more drug addicts, and if you've never been to Granville Street, please, I will bring you with me. Or we will go together to Granville, to Hastings or Hastings Street. Because I'm the person who walk over there and I can walk. But when you see people half a neck, totally full of needle, like full of drugs, that is not respectful for us. You have to respect the people who pay and also who live in this neighborhood. And so it's a reason why also I choose Yaletown, because Yaletown was the nicest place in Vancouver. But I don't know what's wrong with you guys. And also I can tell you, 20 years people work for the needle site or whatever. What kind of results they get? Me, if my business doesn't work, I close it. And no one is going to cry for me. But these people, you have not a single result and positiveness, but you still continue and spend more and spend more. At the end, we need to stop it. I don't know. I'm very frustrating. I'm European, never saw that. In France, it's a drug. You're not allowed to use cocaine in your veins.
Thanks
we
very much.
see them and we put them in prison. Not here. Here is the free things. So I don't know. You want to go with me? I'm totally fine. I'm going to go and we can work together undercover, and you will see the where we are.
Very much.
And if you didn't help Gastown, how are you going to help them now in Yaletown? Really?
Okay, that's
if
it.
you
We're
never
at
been
5
able
minutes.
to take care of your Gastown neighborhood.
Thank
so
you. We're at the 5 minutes. Thank you very much for calling in. You're over your 5 minutes, and appreciate your comments. And now we're going to move on to speaker number 42, who is Nico Branham.
Hello?
Hi. Nico Branham?
Hi. Yes,
Hi.
that's me.
5 minutes, please go ahead.
Thank you. Well, my name is Nico Branham. I'm a resident of Vancouver. I am not a resident of Yaletown, so I'll just put that up front for the Yaletown people who don't want to listen to me. I am a drug user. I sometimes go into Yaletown, although I usually try at all costs to avoid it. I live in Mount Pleasant, and I would just like to say to those folks who complain that the opioid epidemic is now at their doorstep and that they are the only ones who have to witness the effects. I can sincerely tell you, I just want you to know that is untrue. There are people all across the city who witness the effects of the opioid crisis. We do see people using drugs in the street, in our neighborhoods, near our playgrounds, at our playgrounds. And many of us have been impacted in more meaningful ways than that, as in we have friends who have been passed away from overdoses. We may have current family who are drug users. And I would just like to say that trying to compare the struggle of property damage or property value depletion as your personal struggle with the struggles of those who are more personally impacted by the opioid epidemic, I just find that to be an interesting comparison. So I hope those people can think about that later. Now to move on to the facts, what I would like to say is that people who are citing the fact that the city government and the provincial government have been pouring money into insight and overdose prevention sites and seeing no improvement, I don't know that those people are paying attention to the fact that there has really been very little money invested in these issues over the past 40 years. Most of the advocacy that's done in the downtown east side is grassroots. It's not city funded, although I understand the city does help out with the costs here and there. I would just like to say that we cannot rule out compassionate assistance before it has even been attempted at the full cost that the experts have estimated it would cost. We're nowhere near investing the amount of money that the experts have said would be needed to see any improvement in the data. I would also like to say that the BC Centre for Disease Control has been continually reporting increasing numbers of overdose deaths every month, especially since the beginning of the pandemic. And we have reached a point where those people who are opposed to any safe injection site anywhere in the city must answer the direct question, how many deaths will it take for you to accept that something in your life must change in order for justice to be served? I would say, is it too much to ask that you lay eyes on drug users while living in one of the most opioid impacted cities in Canada? If every person who passionately speaks against substance users, calls them disgusting, and openly brags about bringing their child to look at their suffering and use it as a warning, if those people were really concerned about public safety, they would be advocating for those users and not for themselves. I would also like to second the idea that if you oppose a safe injection site in your area, you're effectively communicating that you are okay with your neighborhood becoming an unsafe injection site anywhere and not in a controlled environment. Another point I would like to make is that the existence of the park and school nearby to this location, to me, illustrate the potential future of our safer, healthier, and more united city. Families and children are not immune from being affected by the opioid crisis, And in fact, families and children right now, as we speak, are being harmed and struggling through this crisis. The point that I would keep coming back to is that we are sitting around debating or just debasing the rights of unhoused folks who are drug users while prioritizing the opinions of housed people who are afraid of drug users, who smoke their government weed and drink on their Yaletown patios and act as if they are too good for this world while they turn their backs on people who are literally dying in the streets. They pretend to be pragmatic and realistic and to care about their investments and the economy, but really they are selfish, inhumane, and have no solutions, only complaints. The last thing I would like to add is that in terms of these anecdotal crime rate increase statistics that people have been citing, and the data-driven ones, which show an increase in crime since May, I would point out that quarantine is likely having a major impact on that, as well as a public lack of faith in the police system, which has been influenced by the events taking place in the United States, leading to less people reporting crime and people feeling more free to commit. Thank you.
Thanks very much. That's the 5 minutes, and there's no questions for you. Thank you for sharing your perspective. We are now going to move on to speaker number 43, Fatima Video Vecchio.
Yes. Can you hear me?
Yes, up to 5 minutes, please.
My name is Fatima Vidovecchio. I am strongly opposed to the lease for Rain City Housing and Support Society for overdose prevention site at 1101 Seymour Street. I live in Yaletown. Since the summer of 2020, Vancouver Mayor and City Council brought temporary overdose prevention services a block from my home. I recently learned that the city provided housing for people who use drugs a couple of blocks from my home. As a taxpayer and owner of my home, I had not been informed of a decision this big that has impacted my safety tremendously. Since then, I have noticed an increase in criminal activities in my neighborhood. I have been a victim of attempted break-ins, vandalism, overnight camping on my front doorstep. I live in a townhouse with a street entrance. I have found tools for breaking and entering, such as a pair of pliers under my doormat, as well as a broken piece of a screwdriver that came through my window into my house. I see disposed needles on sidewalks near the flower beds of my home, as well as in the neighboring parks. Children play in these parks and are at risk of getting in contact with needles, among other hazardous materials. Emery Barnes Park is steps away from the proposed site. How can the mayor and the council even consider this location as an option? Even though there has been an increase in police presence, I have not noticed a decrease of crime and violence on the streets near my home. I feel that the opening of a permanent overdose prevention services at 1101 Seymour Street will continue to bring criminality, violence, and danger to our neighborhood. Many of us are considering moving out of downtown core because of the quality of life here has significantly decreased. I am afraid to walk the streets alone near my home. I am confronted by folks behaving erratically who yell at me and howl at people. I understand the complexities of working with people who use drugs and need treatment and support. I'm a healthcare worker. I understand the great work Rain City Housing and Support Society is able to provide for people who use drugs. They provide a place where a person can be safely monitored while using drugs and treated immediately if they overdose, etc. What Rain City will not be able to do is to guarantee the safety of residents of Yaletown or downtown. They will not be able to guarantee that our houses will not continue to be broken into. They will not be able to guarantee that our properties will not be continue to be vandalized, and that the residents will not continue to be afraid of being physically and verbally attacked while walking on our streets. My husband was assaulted recently when he was coming home from St. Paul's Hospital. He was unexpectedly and violently hit on the chest by a passing man who was behaving erratically on the street. I have a lot of empathy and understanding for the challenges that various peoples in our community are experiencing.
I know our community is built on social, economical, and cultural diversity. That's why I chose to live in downtown Vancouver. But I'm not prepared to accept rampant violence and crime where I live. I am afraid for my life sometimes. How long can the taxpaying homeowners and residents of the downtown be expected to suffer before we can feel safe in our beautiful city again? When is the Vancouver City Council going to be concerned with my safety and the quality of my life as a resident of the downtown Vancouver? I feel that the Vancouver Mayor and Council are only concerned with the well-being of those living with drug addiction or experiencing homelessness. I feel like I'm living in a dystopia sometimes where the absurd has become the norm. I hope you are listening to your electorate and respect our request to locate the permanent Rain City housing and support society overdose prevention site in a more appropriate location where its clients can be well served without endangering previously safe communities. Please vote no to this proposal. Thank you for listening.
Thank you for your time. There are no questions for you, so I'm going to move on to the next speaker. Thanks so much for calling in. Council, we are moving on to speaker number 47, Wilkins Chung. Wilkins Chung, up to 5 minutes. Yes, I can.
Can you hear me?
5 minutes.
Great.
Yes, I can.
Thanks for taking the time to hear me speak. I have a family in Yaletown, and a lot of speakers today have spoken about how the current ops has impacted members of the community. So I won't rehash those points. I support providing assistance to those struggling with substance abuse, but the current plan of increasing ops sites only addresses consumption overdose, and this is problematic. So I'm opposing the plan to create a permanent ops or the expansion of ops in general without a comprehensive plan and investment into other pillars necessary for success. In particular, the recovery and mental health services component. Due to its proximity to a public park and an existing residential community, I believe that the other pillars are necessary in order to ensure long-term improvement in neighborhood and avoid the stigma concerns that others have brought up. We all like to point to model cities like Switzerland where decriminalization and safe injection sites have worked. However, both the city and the province have failed to address all the pillars that made those programs successful, particularly the support and recovery component. Without it, your policies will continue to cause a cycle of increased substance abuse and crime. I lived in San Francisco 7 years ago and Seattle 5 years ago, and I see Vancouver making the same mistakes that have led to excessive crime, substance abuse, and mental health issues currently present in those cities. Like Vancouver, those cities attempted to address consumption without putting in place a comprehensive support and recovery network first. And now those cities have spiraled out of control. Those involved in the decision-making process really need to take the time to study the failure cases to understand how to avoid them. Throughout this consultation, supporters have tried to paint our concerns as stigma-driven or temporary. However, this is simply not the case. There was a claim that the site has not increased crime or issues in the neighborhood because these individuals were already our neighbors. Yet the data clearly shows that there has been a large increase in crime and calls to police. It's not because of stigma. There was a claim that sufficient supply will eliminate crime because nobody will have to rob to pay for illicit drugs anymore. However, you're completely ignoring the fact that most of these attacks and crimes, in particular property damage, had nothing to do with theft or financial gain. In the instance of theft, like a couch was stolen and found in an alleyway a few blocks away. There was a claim that ops will keep consumption inside, but then someone went on to confirm that you can't keep consumption on site for inhaled substances, which is on the rise. Where do you think the drug use is going to happen? It's going to go to the park across the street where all kids play. The inspector's statement that ops should be located in areas where highest overdoses are. However, he also then went on to say that downtown has the second lowest overdose deaths. So why are we locating this location here? There was a claim that increased VPD services are not needed because ops service levels are going to remain the same. And then they go on to state that there won't be increased crime. However, this is false and backed up by data. Your team needs to take a step back and actually acknowledge that this is not a simple stigma or NIMBY issue, and there are real concerns here. Sorry, give me 1 second here. Hello, can you still hear me?
Yes, I can. You just have 2 minutes left.
Sure. So opening up more offsites isn't going to be a sustainable long-term solution. We need to address the pillars. Failure to do so will lead to the very stigma that doesn't exist right now. Possible positive actions would include using Chateau Granville, for example, as a base for substance and mental health services, since the hotel is a poor long-term housing solution anyways. And the closest site for this is Burnaby, which has insufficient beds. We need to be allocating more resources to the other pillars, or the whole plan of action will collapse like SF or Seattle. I have a family with 2 small children, and it's extremely insulting that those advocating for ops attempt to paint our concerns as simply stigma issues. Ever since Oppenheimer closed, Chateau Granville opened, and temporary offsite went up, we've seen people attacked in broad daylight and sworn at, found people drugged out in building lobbies, drug paraphernalia on the ground, and more. These are real issues, and simply focusing on the expansion of ops without other supporting pillars isn't working for anyone. The same strategy has been attempted for many years in other parts of the city. Continuing down this path will cause a significant number of people to leave the community, and while advocates will cheer this change, this will simply drive the improvements that have been made to downtown Vancouver over the past decades backwards. I'd also like to point out that the publicly available data doesn't really show ops expansion is working. The August BC CDC report shows overdose deaths increasing and prevention rates decreasing over the past few months. Also, data regarding tainted drugs doesn't reference pre-COVID baselines, so I'm not really sure it's fair to claim that the sudden emergency situation is due to COVID. I've also sent out this commentary to the City Council using a web form like previous councillors suggested. However, all I got back was a canned response, so I'm not really sure whether or not that feedback is being read.
Okay, thanks. And that's 5 minutes. Thank you very much. We do have a question for you from Councillor Dominato. Go ahead, Councillor Dominato.
Thanks, Mr. Mayor. It was actually just to ask the speaker to send in. I haven't seen that correspondence, but I do know that sometimes it doesn't come directly to us. If you would be able to email it to myself and maybe all of council, that would be helpful.
Sure. How can I get that contact information?
I'll ask our clerks to send her. I'll get them to send it directly to you because they probably have your contact info there.
Sure.
Yeah, clerks. The clerks will email you. Thank you very much for phoning in. Thanks for your question, Councillor Dominato. And we're going to move on to the next speaker, who is Shane McCarthy. Shane McCarthy.
Yeah, can we hear you?
Yeah, we can. Head up to 5 minutes. Okay. Yep, whenever you're ready.
My name's Shane McCarthy. I live at 1155 Seymour. I just wanted to call in with a few points. My opposition of the overdose prevention site proposed at 1101 Seymour. I was also, opposed to the social housing that was created without consultation of the neighborhood, the former Howard Johnson Hotel and the surrounding hostels, which obviously increased some of the concern here. I am not in opposition, however, to the services being offered, but opposed to the location and the concentration that we already have in the neighborhood. I think the services that we were talking about with overdose prevention and stuff like that, I think they work and there is a place for them in the neighborhood. Whether or not moving them into a neighborhood like this one here is going to, give you maximum benefit. Different point. In regards, I did a little bit of research with some friends and stuff, and in regards to the OPS. It appears that there could also be some issues with the bylaw, your bylaws for that building, which, indicates that you could be using it for social services. But the city's definition of social services states that it not be used for a detoxification center, which, arguably could be classified or at least considered similar to this. So if there's, not going to have a detoxification center, why would you have a overdose prevention site? Also just in context with the downtown district, some of the plans, that were outlined, it's like it's improving the general environment of the downtown district as an attractive place to live and work. In which case, more people are working at home, in this building at 1155 Seymour. It's not a very attractive place to work, live, or otherwise. if you're putting in more of these services. To encourage more people to live within the downtown district is also another point. In which case, people are obviously not being encouraged at this point. People that buy and rent in some of the buildings that are not subsidized, and create a distinctive realm for a unique and pleasing streetscape in the downtown district, which as well, moving in a safe injection site maybe looks opposite to that point. A number of other people have touched on, the safety of the neighborhood. So I'm not really going to, go too in depth into that because a lot of people have had some really good points over it. But increasing the services in the neighborhood, will increase an interest in adding more housing services to the neighborhood, like those at the Howard Johnson. The safe injection site itself may add some safety by having drug use indoors, but it will encourage more housing or more services in the neighborhood, and thus decreasing the safety. I think a lot of people in the neighborhood, maybe not even so opposed to the safe injection site, as the increase in the housing services that has increased the crime and just the particulars, the anecdotal things that people have been explaining. So then as well, proposing an overdose prevention site with a direct line of sight to a thriving city park where many children play. I mean, maybe common sense should dictate otherwise. I mean, it's just, this seems a bit off. And then I guess, I just propose to decrease the services in the area, especially where housing to increase the safety of the neighborhood that, has been diminishing since May. So there's already a large concentration of housing services, social services in the neighborhood. So why are we moving more in? And of course, you're going to be lowering the property values and decreasing the safety of the neighborhood and hurting local businesses. Is this such a sore point? I mean, if we're already doing quite a bit of work in the neighborhood for social services, do we need to be adding more? And then as well, people are going to be moving out. People are not interested in living in the neighborhood because of those decisions that have been made. If the city decides to go ahead with with this process, I mean, will you be looking at amending, the bylaws if they are or could be, in violation of those? And then just like on a personal note, we've been here for 7 years, and me and my wife, a healthcare worker, we're considering leaving the neighborhood because we feel that the community has not been heard with regards to the safety and or just the community.
Thank you so much. That you're 5 minutes, but you do have Councillor Carr does have questions for you. Go ahead, Councillor Carr.
Yes, thank you. Thank you for coming to speak to or being online to speak to council. You stated that that you support the services at the safe injection site, but just not this site or location. So can you tell me where you would support a safe injection site being located? Like, what are the characteristics of a location that would make it okay for you?
Well, not to sound maybe rude about it, but it's not my expertise. My expertise is not about finding a safe injection site, and I don't have a problem with giving money to social services such as that. And again, we necessarily didn't need one of these sites, especially visibly in the neighborhood, until everybody moved in May 2020. So I think more people are concerned about that than even the safe injection site, although there's some really good, really big arguments against the safe injection site. Personally, I don't have an issue with this program. I feel like we didn't need it in the neighborhood. I feel like if we put it in the neighborhood, they could continue to be putting things like that in the neighborhood. That's getting people to move out. So if you want to know where it is, I don't know, where do they need it most? It doesn't sound like it's here from some of the points that people have made.
So the need arose because there were people that that moved in, as you say, in the Howard Johnson. Is that right?
The Howard Johnson. Well, there is obviously it's the Oppenheimer Park being closed and moving in quite a large amount of people into the the surrounding area. I don't think that anybody is really contesting that point. Once that moved in, and everybody was complaining about it. You've heard many people complaining about May 2020, and it's a very big safety issue out here. I mean, people are happy to pay their taxes and happy to pay for social services, but they're a lot less happy to do it when you move it into your neighborhood, and then people are going to move out, and you're going to have no money.
Yeah. I'm just asking a question because, as you can imagine, I'm appreciative of you supporting the services. So it's up to us as council to figure out where those services go. So that's why I just asked.
Yeah, it is, but then it's also up to council to, it's also up to council to consult the neighborhood before moving the social housing program that happened in May. So I feel like this is the first time that I actually get to have a say about it, because all of a sudden there was a barbed wire fence in my back alley, and then all of a sudden there was some bikes, and then all of a sudden there was, people just shooting up and human feces in the alley. People climbing up balconies to my building, people breaking into my building, bear bangers, things like that. And so that was never consulted. And I think that's the bigger issue, that we wouldn't necessarily need the site, or you wouldn't have as much opposition to it if the consultation happened before the housing project.
Thanks so much. We're at the 3 minutes, Councillor Carr, so I'll have to end the questioning there. Thank you very much. We don't have any other questions for you, but I appreciate you so much coming in. Thank you. We have next speaker 49, Michael Horiza.
Yeah, hi, can you hear me okay?
Yes, I can. Thanks. Up to 5 minutes whenever you're ready.
Okay, so my name is Mike Horiza. I'm 69 years old, and I'm the resident manager at 1111 Seymour Street. It's a full rental building. It's a boutique apartment building. So we've got 3 little townhouses, and we've got 37 other apartments in the building. We've been open for 3 years, and the majority of our folks are young professionals. There's the odd family in there, and they love to take advantage of the playground and Emery Barnes Park across the street, and the dog park. You can walk to multiple grocery stores. It feels like a safe place, or it did up until the last few months. And as I said, I've been here since for the 3 years since this building opened, and it just doesn't feel safe anymore. I didn't realize I started seeing a lot of traffic, in our back alley. And our back alley kind of backs onto the Howard Johnson, and we're sort of a third of a block down the street going northbound. But there were people passed out. There were ambulance calls, or police in the lane. There were people shooting up, people defecating at our back door numerous times. We had our parkade broken into. We had the gate broken. We had to put a whole new gate in. We had every storage locker broken into. We had vehicles broken into. I was assaulted by 2 street people in the back lane, just trying to clean up the trash that they pulled the dumpster out, and then they threw it all over the place. So it's it's changing around here. I'm of 2 minds. I get that we have an addiction problem. I get the fact that we have a homeless problem. But in my active working life, I used to teach and do root cause analysis. And one of the things that we would always teach is that, quite often we put what we think are corrective actions in place to address a problem, but they have unintended negative consequences. And so we try and do things because they feel good. Like we get the Howard Johnson and we start putting people in there to address a problem, but the knock-on effect to our neighborhood is devastating. You know, we have people in our building, we don't have a no smoking rule, but we try and appeal to people's common sense, you know. And so they go outside to smoke, but they don't do that anymore because it's not safe. It's certainly not safe to smoke in the alley. And they get harangued and harassed by, you know, street people who are, you know, bumming cigarettes, trying to bum money. We've had people leave our building. So for the first time in 3 years, we've got an active turnover. So all I know is this, you know, had I not been given a heads up about this, I wouldn't have known what you're trying to do with this safe injection site. But what I do know is around the corner, there's a van that's been parked there on and off for a few months. And at times there'd be a couple of people sitting out there in deck chairs working on their suntan. And I walk 30 feet around the corner and there's two people shooting up. So I don't understand how having a safe injection van is addressing the issue. You know, like it's a phony issue. The street people, my sense is, and it's strictly non-professional, but I think there's some mental illness issues that are folded into the drug addiction problems, and they're just tough people to deal with. And, you know, my hat is off to anyone who tries to work on that issue.
Thanks very much for,
yeah.
You're just at your 5 minutes.
Okay, so just to sum up, you know, just putting it in 2 doors down from me, I don't think it's the right fit. I really don't.
Okay, thank you so much for calling in. And there's no questions today, so thanks for participating. Let's see now. We've got speaker 50. Patricia Geldert, speaker number 51.
Oh, hi. Hello?
Hi there.
Hello?
You've got up to 5 minutes whenever you're ready to go.
Oh, perfect. Thank you so much for allowing me to speak here. Oh, sorry. Let me just. My computer just did something. I'm not very political here. I just want to speak as a mom, speak as a resident of Vancouver, downtown Vancouver, and I live 2 blocks away from 1101. The site's 1101, and I'm just against the site. I don't want to be emotional about it. I don't want to blame anybody. I have my own priority, which is to be a mom and to take care of my child. And my priority is just the safety of my child. And I know I've heard a lot today about what safety means. And all I know is that I don't think that site will help anyone. Really, I think it'll help users in some way. But in the end, I think it just makes matters worse. I think I haven't heard anything about programs being started for these, for people who use. And I think, you know, helping them use drugs across the street from Emery Barnes is where I take my daughter all the time. And then them coming out of the facility, being high, and then possibly going across the park where I play with my daughter, and we have other families and other residents in the area that are wanting to go there, but now they feel afraid. Won't help anything. I don't think the downtown area, that location is a good site, is a good location for users. And so, I don't know. I don't know what to say. Like I said, I'm not very political. My only priority is my daughter. And I know I've heard from other parents who are also very intimidated at this point to go to Emery Barnes Park. And I don't know the laws, what they are to have an injection site just, you know, a couple of steps away from a public park for families and residents of downtown. I just don't think it's the right fit, personally. And that's it. Thank you.
Thank you so much for calling in today. We don't have any questions for you, so we're going to move to the next speaker. Thank you very much. Okay, Council, we're on to speaker number 52, Caitlin Shane.
Hi there, can you hear me?
Yes, we can. Please go ahead up to 5 minutes.
Great, thank you. Good afternoon, Mayor and Council, and thanks for allowing me the opportunity to speak today. I submitted a letter on October 8th, which details Pivot's concerns in full, so I will just focus on the legal issues that arise when community consultation impedes the delivery of supervised consumption services, as is the case here. As you're aware, some community members, including in Vancouver, have asserted a right to input beyond the current public hearing process, and which extends to determining whether, where, and how supervised consumption services will be provided. Now, I want to assume that Council won't be prioritizing the unevidenced concerns of these groups over the professional medical opinion of Vancouver Coastal Health that this location is optimal for an overdose prevention site. And I really don't say the word unevidenced in a disparaging way. I mean it in light of the fact that many of the concerns speakers have raised today are not actually symptomatic of overdose prevention sites and are moreover not reflected in public health evidence and scientific research conducted so far on overdose prevention services, all of which I can touch on shortly. But if in fact this input does stand to inhibit a life-saving health service, not to mention one amid dual public health emergencies, I want to underscore that this question has already been raised and settled in law, and that law is binding on the City of Vancouver. So in 2018, I represented the Canadian Drug Policy Coalition at the Federal Court of Canada, where a business association was trying to stop the opening of a supervised consumption site on the basis that it wasn't adequately consulted in Health Canada's decision to approve that site. And we made two key submissions, both of which were adopted and endorsed by the court. And those are that A, community organizations are not owed a right to weigh in on decisions regarding supervised consumption services. And B, public health is the paramount consideration for implementing these services. A direct quote from the Federal Court of Canada reads, "The principal and mandatory focus is on the question of whether an exemption would provide public health benefits. Any consideration of negative impacts on the local community is secondary and discretionary." So the same principle applies here, looking at the 2016 ministerial order that requires overdose prevention services in BC. Community consultation is nowhere stipulated as a precondition for sites. Quite the opposite. Sites are ordered to be set up, and I quote, "in any place there is a need for these services, as determined by the level of overdose-related morbidity and mortality." So if community organizations in Vancouver are given an extra legislative right to provide input in overdose prevention site determinations beyond this public community forum, Council would be fettering powers expressly granted to health professionals by the order. As I mentioned earlier, many of today's speakers have raised concerns about the public safety issues that stem from overdose prevention sites, but these concerns are not the symptoms of overdose prevention sites, and they're not reflected in the research so far done around overdose prevention sites. And I trust that there will be researchers in the queue who can speak to this better than I, but as yet, overdose prevention sites have been shown to have positive public safety outcomes, including reduced public drug use, reduced loitering and aggressive behaviors, and fewer dirty needles in parks, streets, and other public places. People who state that they're concerned about needles in their backyard should take solace in the fact that this is precisely one of the benefits of overdose prevention sites, is reducing the rate of discarded needles. Concerns about public injecting, same thing. That is the primary benefit, one of overdose prevention services. So on a final note, these impediments posed by community input taking priority over public health benefits, I want to underscore that this infringes on the Section 7 Charter right to life, liberty, and security of the person, delaying access to medical care, imposing restrictions that lead to inadequate access to services, and causing physical suffering are all state actions that have been deemed unconstitutional and that council is required to avoid here. Thank you. Those are my submissions.
Thanks very much. You have a question from Councillor Dejanova. Go ahead, Councillor Dejanova.
Thanks very much. Just a question regarding, you had talked about the data, and in one of my earlier questions, and I'm hoping to get this information that we had heard would be sent over to us in questions earlier. I had heard that, and I'm not sure exactly of the neighborhood, so I'll just say the areas, the northeast part of Vancouver, and then the south part of Vancouver. So I'm guessing southeast Vancouver would be the number 2 areas, and then this would be the third. Would you, I mean, aside from support, did you suggest that we should be looking at sort of the overdose deaths, and that's how the data should be based on how we move forward with this? Should we have them in all neighborhoods throughout the city? If you don't mind me asking, just trying to, I know you had mentioned sort of the importance of the data on that in support for a site.
Sure. So just to, and thanks for the question, just to clarify, I'm reading off of the ministerial order that was issued by then Health Minister Terry Lake in 2016 that says sites must be set up in any place there is a need for these services as determined by the level of overdose-related morbidity and mortality. And the power to determine where such services will exist is granted in that order, I believe, to the provincial health officer as well as the regional health boards. And so this kind of goes to the point of saying that the power granted in that order goes to medical professionals to make that determination on their own analyses of where there is need for the service. And if, as is the case here, Vancouver Coastal Health has identified this location as an optimal place where there is public health need, then that is the requirement to abide by.
Okay. And if what I'd heard before, and I'll ask Vancouver Coastal Health to follow up on this a little bit, is that it's very expensive to deploy a number of trailers. But if that was a possibility, and I'm not talking about, oh, gee, let's push it out somewhere else other than downtown. If it was possible to do that in what I hear are the other 2 highest areas of overdose deaths from the statistics I heard this morning. I'm just wondering, would that be something you would expect would be supported under the ministerial order?
Sorry, I'm not sure I'm understanding the question. Are you asking whether mobile overdose prevention?
Would you expect that there be something in those quadrants of the city? Should there be something in those quadrants of the city as well as this?
I think that there ought to be overdose prevention services wherever there is need, and where those medical professionals who have been granted the powers under the order to make that determination, if they have identified a particular neighborhood or area as warranting a site, then absolutely I would support that.
And we're at 3 minutes.
Thanks very much. Sorry, that's my time.
Thanks, Councillor Carr. Up to 3 minutes.
Yes, thank you very much. Appreciate you speaking to us. Thank you. 2 questions. First, you listed the sort of the benefits of an overdose prevention site. So, and I just want to run by them because I didn't think I caught all of them. That obviously reduced overdoses, but I think you said increased public safety, fewer dirty needles in the public realm. Could you just fill that list in for me?
Yeah, absolutely. So just going over my notes, and this information is pulled from data from numerous analyses on the benefits of overdose prevention services, and they are that based on these analyses, overdose prevention services have been shown to have positive public safety outcomes, including reduced public drug use, reduced loitering and aggressive behaviors, and fewer dirty needles in parks, streets, and other public places. And I would also note that the research, and I believe my colleague at the BC Centre on Substance Use can speak to this later, but there is no evidence that demonstrates that overdose prevention sites increase rates of crime. And certainly in the case of supervised consumption sites, that evidence is well established that these sites do not contribute to crime and in fact result in sort of the benefits that I've just outlined in relation to overdose prevention sites.
Okay, that's good. Thank you for going over those again. And my second question has to do with that provincial health order. I think it was Terry Lake that you mentioned at the time, that gives provincial health officials the authority to locate a site where there is need. Do you know if there's any wording in that provincial health order that requires or that suggests anything about the public health officials having to consult with the local public around this?
No, there is nothing in the ministerial order that stipulates anything about community consultation. And just to underscore the exact language from the order, it says sites are ordered to be set up, quote, in any place there is a need for these services as determined by the level of overdose-related morbidity and mortality.
When you use that word "order to be set up," what role does the council have then? Are we under obligation to follow the order from the provincial health authorities?
So, I mean, the dialogue that's happening today, that is part of the standard municipal process when my understanding is that we're talking about a property that is owned by the city and is being requested to be leased by Vancouver Coastal Health. Were this in relation to, were the property not owned by the city, then the ministerial order does not require the city to play an active role in mediating public sentiments about the site. It's by virtue of the fact that we're talking about city-owned property.
Thank you.
And we're at 3 minutes. Thanks so much. There's no other questions for you. Appreciate you calling in. Thank you. Now, Council, we're going to move to speaker number, I think it's 55, which is Tillman Dirks.
Yes. Hi, can you hear me?
Can do. And please, up to 5 minutes whenever you're ready.
Wonderful. Thank you so much. Thanks, City Council, for listening to us. It's definitely been an interesting experience listening to all my fellow speakers. I do want to acknowledge that I don't live in the neighborhood that it's planning to be, that this new overdose prevention center is planning to be set up in. And I do want to recognize that that feeling unsafe in your neighborhood is real bad, and I really do feel for the residents that are worried. But I also do want to express my strong support that this motion passes, and really urge the folks that are really worried about the conditions in their neighborhood to get curious about kind of the root causes of these things, and to listen to the health experts, and to not only ask that, you know, things like this not be built, but also to really strongly advocate for the kind of social services and the kind of fixes to the root causes of poverty, of drug use, and to be advocates for kind of improvements in that way. Those who do support these kinds of services. I do want to say, I think it's so important that we have overdose prevention sites wherever they are needed. The last speaker was really wonderful, and I thank her for her time. I live in Kitts. To my knowledge, we don't have any here, and I can imagine there would be a bit of an uproar if there were thoughts of bringing one here. But I would certainly be the first on the line to encourage that to happen. I think when you see the kinds of overdose numbers that we've seen this year, but also in previous years, I think it's It's really unconscionable that we don't take every step that we can to solve this serious public health crisis. And I'm really appreciative to the healthcare workers that are fighting this fight and making sure that people are safe. Yeah, I think that's all I have to say. Thank you.
Thank you so much. There are no questions for you. Appreciate you calling in, though.
Wonderful.
And thank you. We're going to move on to speaker number 56. Oh, Donald McPherson. Speaker number 56, Donald McPherson.
Hello. Good afternoon. It's interesting to be here and hear this discussion going on that is reminiscent of many years ago when I worked at the city myself. I'm currently the director of the Canadian Drug Policy Coalition. We're based at Simon Fraser University, and we are an organization, a national organization that works towards improving Canada's approach to drugs. And I guess these types of hearings sort of bring me back to a point of realizing that so much is broken in our systems of care, our drug policy, and that it's devastatingly sad that the point of a small service that a regional health authority is trying to open that is part of a plan to respond to what is a over 4-year-old public health emergency declared in 2016 that really has not had the kind of response that is possible, that we've seen as possible if you were to look at the COVID response that the public health provinces have mounted in the federal government. The overdose crisis, I'd just like to remind council and residents of Vancouver, I live in East Vancouver, and we have our share of a nice mix of housing and services. And this is the worst public health emergency on overdose that British Columbia and Canada has ever experienced. And just as we're tired of the COVID demands that COVID is putting upon us, and we may struggle to maintain the public health guidelines that we've been asked to maintain, we are so tired of seeing people die at the same time. And I think we can all agree upon that. And so it's really tragic when it comes down to what will be a very small service in a neighborhood in Vancouver. And I personally think overdose prevention services should be in any part of the city where they're warranted when you look at the data. So I'm really appealing to, I think, the better part of all of us, in that when we talk about COVID, we're encouraged that we're all in this together. I do not get that same sense when we're responding to the overdose crisis. I don't get the sense that we're all in this together. The citizens of the city, the people who live around all sorts of services that deal with addiction and mental health. The best case scenarios are when the service providers learn about the community learns about them, people work together. Globally, supervised consumption services or overdose prevention services have been around since the 80s in European cities, and more recently in Canadian cities. There are upwards of 100 of these services in Canada today. These kinds of services, whether they be consumption services, injection sites, overdose prevention services, they're part of the fabric because of the deterioration in our drug policies. And if people were to work together towards changing our drug policies, we might not be wanting to have these or having to have these conversations. If we had an actual sane approach to drugs. We had a approach to mental health and addiction that actually honored the lives of people who are living with addictions and mental health. And the emphasis of our thinking was on how do we protect them from society and stigma and being pushed to the margins where they are so much more vulnerable. So I really want to encourage council to think about that, and this is not easy. When I worked for the city, we developed the Vancouver Agreement. All three levels of government came together. I certainly hope you're working on making that happen again in some way, because these problems go so far beyond the neighborhood level that it's very frustrating to see them play out year after year. And it contributes to services not being scaled up as quickly as they could in the context of an emergency, and then services delayed or services denied. Tonight, 4 people are going to die in British Columbia, and I'm not happy to say that we do need more of these services where they are warranted, and I defer to the Vancouver Coastal Health Authority to determine that. And it would be sad to miss an opportunity to have a service like this in that location.
So much.
And I'll
Thanks. You do have questions? Thanks. You got questions from Councillor Dejanova and Councillor Hardwick. Councillor Dejanova, go ahead.
Thanks so much. I was hoping that we'd be hearing from you on this list, and really appreciate all of the time that you've spent, not just here, but want to thank you for your work at the City of Vancouver. I'd like to think that, even though you mentioned, and I agree, we have work to do, that we're kind of moving in the right direction, especially compared to some cities. But in considering that, maybe you've had a chance to hear some of the us against them. That's how I'm going to put it. Way that we're kind of seeing this, the fear in the community. What can we do to educate people, especially during COVID? Like you said, if we're in this together, how do we bring the community with us? What can we do? Hindsight, never 2020, but moving forward, how do we educate and bring the community in to see this as a solution to some of the issues?
I think people need to meet people in the community and begin to understand the different perspectives that people have and the different experience that people have. We need to create processes and forums that do not result in this kind of forum where it is clearly enough against them. This is a lose-lose or a win-lose, but really it's a lose-lose. If a service, such an important, and I want to emphasize small service is thwarted because of this kind of process, then we all lose. We're not better for it. There's a small victory party on one side or the other, and but the problems, it's a distraction from the scale of the problem we're actually facing, which has not gone away in spite of all the work that the City of Vancouver has done, that the province has done, the federal government has done in the last. It stems from a systemic problem that we have to get our heads around, and we have to be united to do that. We need to change. We need to get rid of the toxic illegal drug market, which is created by our drug policy, drug prohibition. We need to.
I agree with 100%, and I have 30 seconds left, so I'm so sorry. I'd love to email you. Can I email you some questions after this too?
Oh, of course, always.
But also just very quickly wanted to ask, do you think, you mentioned lose-lose, do you think that it's necessary, regardless of what happens in this decision, this is where we are today, to do some work in that way of education and consultation and moving forward together?
Always.
Okay. And should we have these overdose prevention sites
Councillor,
in areas?
you're at the end of your
I'll
break.
email you that question. Thanks so much. Thank you.
Councillor Hardwick?
Thanks. Can you hear me?
Yes, I can. Just 3 minutes.
Yeah.
Hi, I have a couple questions and appreciate your historical perspective on these. You mentioned right at the top of your remarks that we should look at the data. We were told by the VPD that geographically within the city that this was not a priority area or not an area in terms of percentage where the majority of overdose deaths were happening. I mean, what a terrible thing to be prioritizing. But they mentioned, for example, Southeast Vancouver was a more common area. Do you have any insight, forgive me, into the geographical distribution?
Well, it's clear from the data that downtown Vancouver has a lot of overdose calls. And it's clear from the data that people are dying all over British Columbia, whether they're small towns or mid-sized towns or big cities. I would go to Vancouver Coastal Health for the data. I wouldn't necessarily go to the police for data on overdose, appropriateness of overdose response services. It's clearly close enough for it's in downtown Vancouver, and the numbers are very high in Vancouver. It's the type of phenomenon that is so widespread now that it's not about which block you're on and 6 blocks this way or 2 blocks that way. You need to find these. You need to open these services as quickly as possible, and we've frankly had a very
geographic. Okay, sorry, I only have limited time. We've heard a lot about that there are local people within their neighborhoods, but we've also heard talk that there's a lot of people coming from across Canada because Vancouver is an attractive location. Do you have any comment on that?
Well, I think some of that may happen, but most people who live in the Lower Mainland, the majority of people who live in the Lower Mainland aren't from British Columbia, so there's a mobile population for sure. But Alberta has a very serious problem with overdose. Ontario has a very serious problem with overdose. This is not a Vancouver thing. It's a Canada thing now. So, and there's an urgency around this particular kind of service. I'm just going to have to interrupt you there. We just need a quick motion to extend. We have 2 questions left. Can I have a motion to extend? Seconder?
Councillor Carr.
Second.
Thank you, Councillor Carr. All in favor say yay.
Yay.
Yay. Opposed, nay. Great. Thanks. Maybe you perhaps you can finish your thought.
Yeah, thank you. Just if you could finish off.
The population of people who use drugs is across the country. It's not an East Coast, West Coast thing. We're finding fentanyl in Quebec more now, and we're finding fentanyl in Whitehorse and the Yukon. So the drug market is why this particular kind of the drug market is killing people, and that's why you're seeing that's why Terry Lake made the ministerial order and urged health authorities to scale up these kinds of services. And we're still in the throes of the overdose crisis. It's gotten worse since COVID, and we can't take our foot off the pedal. We have to try everything we can, and we also have to, of course, respect the people who live in communities and who are not knowledgeable about this or fearful about this or conflating an overdose prevention service with other kinds of criminal activity that go on that they fear. So yeah, but we have to respond to the emergency first. And yes, we do have to sort out some of this other stuff.
Thanks so much. And we're going to, last question from Councillor Boyle, up to 3 minutes.
Thank you for coming and speaking to us, Mr. McPherson. I wonder if you could speak a bit to the important shift that the Canadian Drug Policy Coalition and others have made to the public understanding of addiction as a health issue rather than a moral failing, and why that matters and how we are framing this discussion.
Yeah, we've developed. We know a lot more in 2020 than we did when we started to develop our drug policies in the early part of the 19th century. There was much more moralizing about good drugs, bad drugs, who use drugs, who use their bad drugs, and who use good drugs like alcohol and tobacco, which were the good drugs. Now we know more about addiction, and we're trying to shift the Titanic that was the war on drugs and drug prohibition to move towards a public health and human rights approach to drugs, so that people do get access to the right kinds of services. They're not stigmatized. They get help where they need help. But the other thing that's going on here is that there's addiction and mental health and addiction systems, and some people have talked about building those. That's great. We need to do that. What's happening now in the drug market is not about addiction. It's about people being poisoned to death because they take an illicit drug that has fentanyl in it. So it's a very separate, we need a poison response to that. I mean, that's what the emergency is about. It's not about addiction. It's about a poison drug supply where people are dropping dead from taking an illicit drug. And the drug market's been getting worse and worse every year. So that, it's like, imagine if your water was poisoned or your food was poisoned. You'd want quick action. You would not want to mess around with people's lives. You'd want to replace the food. And so that's what we're arguing. You need to get rid of this drug policy that has created the poison drug supply and move towards a decriminalized model and a model where people are actually using substances they know the composition of that won't kill them, and they can get help if that's what they need, and they won't be dead.
Great, thank you. Those are all my questions, and really appreciate you bringing your expertise on this to Council for this decision.
Thank you so much. That's it for questions. And so now, Council, we're going to take a recess until 6 p.m. where we'll resume hearing from the speakers, starting with speaker number 57, Zilling Zhang. So thanks, Council. We'll see you back.
Point of parliamentary procedure, Mr.
Sure.
Chair.
Yeah, go ahead.
Yeah, I'm wondering if, I'm not sure if we'll get to questions tonight to staff, but I'm wondering if it could be helpful and if staff are willing to accept sending by email to them questions that we're formulating as we're listening to speakers.
Absolutely. I think that's a great idea to send those in. And
to Mr. Johnson, our city manager.
Let's do that to start with.
Yeah, that sounds good. Happy to get any questions, and we'll prepare some answers in advance for you.
Great, thank you so much.
And then just a point of parliamentary procedure,
Sure.
Mr. Mayor.
Yes.
Just wondered, if we don't get through this by 10 tonight, what is the backup date for this, just so everyone knows?
October 20th.
Just wanted to make sure. So it's October 20th. Is there a set time for that?
There isn't yet, but we'll see how we go here. We may have to, we're hoping to get through speakers tonight. We're only halfway through the list at the moment. So if we can get through them by 10 tonight, then debate and decision would be October 20th. I'm not sure. We'll come back to you with the time.
Fingers crossed. Thanks for that.
Okay. Thanks very much. See everybody back at 6. Clerks, I see 6 folks.
Yes, Mayor Stewart, we do have quorum, so anytime you're ready.
Great, thanks so much. Okay, we're going to move on to speaker number 57, who is Ziling Zhang. Is Ziling Zhang on the line, clerks?
We're just getting set up, Mayor Stewart.
Okay, great. Thank you. Okay, Ziling Zhang, speaker number 57. Whenever you're ready to go.
Oh, hello?
Hi there.
Hi, can you hear me?
Yes, I can. Do you want to go ahead up to 5 minutes?
Hello, counselors. My name is Seling. I am a resident of Vancouver, and I'm calling in support of the proposed overdose prevention site. Firstly, I want to say how disgusted I am by the rhetoric espoused by some of those in opposition that I've seen online and heard today. I feel compelled to speak on this, my disgust specifically, because governance should not be based on who presents the most numerous united front of disgust for our fellow residents. It should be based in a critical and weighted response to where there's the greatest need and where there's the greatest harm that we can avert. This should be obvious. Even so, I'm horrified and I'm heartbroken. Nobody decides to end up doing drugs in public where any snide person can stare at them and deride. I beg you to think of the difference it makes to have the same place to return to every night, somewhere safe and dry and warm. Now use all the benefits that this kind of life affords you to do something for people who live differently through no fault of their own, through failure of policy which governs their lives, in fact. If we're speaking truly of the good of public safety, I want us first to be very clear about whose safety we're privileging. Many speakers before me have already talked about the concurrent public health crises we're in of COVID and increased drug toxicity leading to overdose. 4 to 5 people are dying of overdose in Vancouver every day. There's no reason to kill 4 to 5 people daily, just so some people will feel safer from needles on the ground that they don't have to touch and they don't have to walk on. If people are so upset about seeing drug use and evidence of drug use in the street, wouldn't a place with walls and a door be a good solution? Somewhere for people who use drugs that's safe and dry and warm where they can return to and feel human. Why do we think that someone with a door they can lock is in more danger, at more risk of harm, than someone who has no choice but to use drugs outside? The only and best messaging on overdose prevention that the government has been able to muster is the phrase, "don't use alone." This is because there's no regulation on the drug supply and no plans by the government to regulate. So people have no choice about being poisoned. It only takes one bad dose for everything to go wrong. It has nothing to do with who has the most continuous sustained drug use. Anybody who uses drugs is at risk. If this were about mercury in coffee, it would be everybody's business. If it were rat poison in beer, everyone would care. Vancouver used to be a city under alcohol prohibition, but nowadays we don't demonize people for having a glass of red wine with dinner. This is because the sanctity of human life should not change with our laws. In the future, I hope people look back and realize that the fact that some people use illegal substances did not mean they deserve death. Just because someone couldn't access a legal way to alleviate their pain doesn't mean their suffering is not real, not worthy of our care, nor that it should be a death sentence. And prescribing alternatives to street drugs is not happening enough clearly because we are still in an overdose crisis. If you're telling people not to use alone, then you have to provide a space for that to happen. The research tells us overdose prevention sites work. They save lives. The people who use and run these services tell us the same. I've seen complaints about the Howard Johnson Hotel, about the overdose prevention van parked in the same area. But if the general public were to speak with people who use drugs in Vancouver, they would understand that the Howard Johnson Hotel is only for residents and the van is temporary and would be replaced by the OPS site that we're discussing today. These are the little details you can learn if you actually speak with and listen to people who use drugs living in Vancouver. I'm just trying to highlight the importance of listening to those with expertise on a subject, people who know what they're talking about because they're living it, not just looking down on it from their condos. If you're speaking out of fear for your children's safety, then consider that you doom them to the same unfounded fear and consuming bigotry that I've been listening to all day. It's honestly appalling. I grew up with a family friend living in an RV in the backyard who struggled with addiction and was in and out of jail. I took care of his cat, and he always remembered my birthday. And if that proximity to someone who struggles is what has taught me to be compassionate, then I can only assume that your children having to see someone who lives differently than you from their playground is not going to ruin them. We've also heard a lot of discussion about this us versus them rhetoric that's come to light today. And I really do believe that the only way for this to change is by people talking to each other, not introducing life-saving services into a neighborhood just because some people are afraid of it will not bridge this divide. And furthermore, it will kill people. If we want Vancouver to be regarded as a world-class city, then we need to act like it. Make the right decision to help people, not demonize them.
Okay, thanks.
Please vote on your conscience.
Thank you. We're just after 5 minutes and we don't have questions for you. So we'll thank you for calling in this evening. And we're going to move to the next speaker, who is Howard Hezekamp.
A reminder was sent, but he hasn't joined.
Okay, thanks very much. We're moving on to Matt Henry, the speaker number 59.
Same thing, a reminder was sent, but they haven't joined.
Okay, thanks. We've got Scott Bernstein, number 60.
Actually, the next caller we have is Kelly Tompkins, number 64.
Okay, great, thanks. Kelly Tompkins, please go ahead, up to 5 minutes. Kelly Tompkins, please go ahead if you're there. Kelly Tompkins.
Mayor Stewart, Kelly Tompkins is on the line, but she may be experiencing connectivity issues. Perhaps we can go to the next available speaker, and then we can try her again. The TELUS operator is engaging her. At the next speaker that we have on the line is number 74, Alex Turris.
Great. Okay, we'll go to Alex Turris.
Hello.
Hi there. Please go ahead, up to 5 minutes.
My name's Alex Turris. I'm a resident of Vancouver, and I'm actually a community health worker in the area that we are talking about. I'm actually somebody that works directly with the folks that have moved into this area. And for that reason, and because of the work that I do, I definitely support having a supervised consumption site in this area, and I hope that City Council members vote in favor. I've seen a lot of different, opinions on both sides of the argument, and from folks that disagree with having a supervised consumption site, I see a lot of fear and not understanding necessarily what substance use and the consequences and things that happen as a result mean. And, you know, there's many myths around substance use, and one of them is that it's a moral failing. And we know that that's not true. And by we, I mean the scientific and health community know that it's a health issue. And for so long, we've looked at addiction as something that is a moral failing, that someone is a bad person because they use drugs. But we know that through evidence that that's not true. And I think that's something that gets lost in the conversation about this sort of thing, that it's often about fear and violence and criminals. And we forget that we're talking about individual people. You know, in the media and around this conversation, I often see the phrase, like the homeless population being used. And homelessness is not an entity. It's people experiencing homelessness. We need to remember that we're talking about individual people and people who are struggling with health conditions. And that's why it's vital to be providing those health services. The folks moved into an area that traditionally hasn't necessarily had those services, but there's always been supported housing and buildings in that area. And so if we look away and pretend that this issue is not happening, we're just making it worse. These are folks that need support. They're folks that need and deserve and have the right to live their lives and have dignity. And they've been failed by our society. And I think that's one thing that we need to sort of acknowledge within ourselves, is that we are all part of a society that is, as Canadians, we sort of have a social contract that we take care of each other. We have universal health care, but we forget populations and we exclude them. And that's not what we need to do. You know, if somebody has substance use, it's a medical condition. If I had diabetes, I would go to my doctor, get insulin. That's not afforded in the same way. We've had great advances, and, you know, things like safe supply are happening right now, and that's great, but that's not enough, and we need to do more. If we don't have things like supervised injection sites, we actually are making the problem worse. People access detox and treatment more when there are supervised consumption sites. We reduce our health costs when there are supervised consumption sites because people are able to access clean, safe harm reduction supplies, which allow them to avoid things like abscesses and cellulitis and that sort of thing that we don't need to have, and our healthcare system doesn't necessarily need to take care of. So, yeah, I mean, I'm completely in support of this. I'm working with folks that have newly moved into this area. There's not places for them to go. When you live in a supported housing building, you're often in a building that, especially during COVID, can't have guests. These places are single room, so you don't necessarily have the space to have somebody at home like I do. I have a living room. I can invite folks over. I can invite who I want. Nobody's telling me who I can't. When you don't have those space, of course, you're going to find yourself in public spaces like streets. I totally understand that people have fear. What we don't understand, we fear. And it's not to say that us as harm reduction workers and folks that work in this field condone violence and people, you know, their needles around and stuff like that. I don't. That's not okay. We don't, as harm reduction workers, ignore that and say, oh, no, it's okay, that happens. No, we agree that that's not good. And because we should be, you know, thinking about the safety and that sort of welfare of others around us. Of course, our harm reduction workers do. We don't just like turn a blind eye to that. We want that help and support, because if we have help and support, then there's less of that happening. So,
that's your 5 minutes, but you do have a question from Councillor Carr. Councillor Carr, go ahead.
Sure.
Yeah, thank you so much. I really appreciate you speaking to us tonight. As a community health worker, can you tell me what you think are the positive community impacts of having a safe injection site in this neighborhood?
Yeah, definitely we know from Insight and other supervised consumption sites that people are able to, they tend to access detox and treatment more because they are available through those resources. When you don't necessarily have a way to access that, then if you can get it through your consumption site, That's a way that, if we're talking about people who want to, you're like, oh, you should change your life, stop using drugs. Well, having access to those supports allows people to do that. And so, we have a whole bunch of folks that are in a new area. The more we can support them, there's better. There's also lots of evidence that people don't have to access, emergency rooms and that sort of thing as much when they're given access to clean harm reduction supplies, right? Like we brought that in the 80s and 90s when there was such an incidence with HIV in the downtown east side because people didn't have access to those clean harm reduction supplies. And that has changed, right? Like we don't have that crazy high number of folks with it. There still are people, and that's a reality, but the number of people contracting HIV is so much less in the community. And that's one of the benefits of harm reduction.
Great. Thank you. I really appreciate your input.
Thank you.
Thanks so much, Councillor Carr. And we're on to our next speaker, who is number 64, who is Kelly Tompkins.
Hello.
Hi there. If you can go ahead up to 5 minutes, please, whenever you're ready.
Okay. Thanks for the opportunity to speak. I strongly oppose the injection center on the 1100 block Seymour Street. And another thing that I strongly oppose is the letter from the mayor that was put on the site to hit, to click if it would automatically agree with the steps moving forward. So I just wanted to state that. Also, there is an elementary school that has just gone in on, actually, it might even not even be open yet, but I got a building approval for it on the Helmeken and Homer Street. So now we've got a school, an elementary school, we've got a park, and we're putting an injection site in. So my question is, we didn't have a drug problem like this, like that we're facing right now, until we had the Howard Johnsons and the residents from the Oppenheimer Park move in. So that leads me to believe that this was, they were moved into the site and of the Howard Johnson, and now we have a real problem. So now residents are speaking up about it. We don't feel it's appropriate to move it into our neighborhood, and now we're faced with it being a problem. So there's a few issues with that. They were kicked out of St. Paul's Hospital because there was a murder there. We're facing now, our neighborhood has become very unsafe. We're not even able to go out at night without feeling safe. There's drug-fueled, mentally ill people that are aggressive to the residents. We're finding needles on our property. We're finding people sleeping in our doorways. And we moved into this neighborhood because it was a safe neighborhood. And all of a sudden, because the city council decided to bring residents from another neighborhood in, and now we have a drug problem. So I don't know. I don't agree with it. I'm opposed to it. There's got to be a better answer. I think people do need help, but I don't think the help is in the downtown core. We need institutions. We need places where these people can successfully get off drugs, but it's not moving them into family neighborhoods. I don't agree with it. So, another thing that people, since we are offering free drugs, people are from all different postal codes all over Canada are moving here. They go to a place in, they could be in Jasper, Alberta, and they're told, where do you want to go? Well, I have an uncle in Vancouver, and they ship them here. So why is it that we're getting all the people? That's what's creating the problem. They're coming here from everywhere, and it's not fair to the people that have moved here. It's not fair to the neighborhood, and it's not fair that this is seems to be going through without consultation. We didn't know that what was going on with the Howard Johnson. And we just heard about this injection site going in. So there's no consultation. Why don't we have a referendum on whether how we feel about the injection site? But this is not, I just don't agree with it. So that's what I have to say.
Thanks so much for calling in. I don't see any questions for you on the queue from councillors, so we'll be moving on to the next speaker. Thanks so much. And council, we have speaker number 68, Laura Skonsnick.
Laura Skosnick. My name is Laura Skosnick. Thank you for giving me the time to speak today. I oppose the motion today. While I've voted regularly, I've never spoken like this before. I've supported the 4 pillars and the community facilities in my neighborhood. This is my home. I live on Seymour near the proposed site. I'm a citizen on my own time, not involved with any organizations related to this endeavor. I've seen tragedy and death from addiction. I've cried over lost friends. I have painful proximity to these issues. As I listen today, I wonder if the crime was better addressed in our neighborhood, if the community would be more open. While a healthcare professional may say that the Eastside injection site cannot be conflated with the crime situation, I find this confusing based on my experience as someone who was born in Vancouver. The implementation of the downtown Eastside safer injection site does not bring much confidence. If it's because I need more education, then I hope the city will educate me through more engagement. You cannot separate public safety and this site. The residents' experience with Howard Johnson has caused a serious loss of confidence. I deal with danger and fear every time I leave the door. We have 2 laws. If I ever run around threatening people, screaming, stealing, taking a dump on other people's doorsteps, would I be arrested? If I were to threaten to spit on workers, to steal goods, or if I were to physically grab workers in stores, at what point would I get away with this? At what point are people too sick to be wandering around the street high? I want to be a good neighbor and support those who are dealing with this overdose crisis, but I'm terrified of what is happening to my city and my home. It feels like addicts in the neighborhood can do anything when are addicts criminals? It's not politically correct to admit this, yet not all addicts are criminals. It's a complex issue that seems very divisive to this night. 2 very, very different sides, but I sit in the middle, very scared. Safety needs to be considered alongside this plan. I feel helpless. I no longer feel safe in my neighborhood. I'm considering moving for the first time ever to be safe. I hope you can find an overall plan that works with all layers of the government, as I feel hopeless about the state of my home. That's it. Thank you for taking the time. Hello?
Thanks so much. You do have a question from Councillor Dejanova. Councillor Dejanova, please go ahead, up to 3 minutes.
Thanks very much. Thank you very much for your very thoughtful and respectful comments that I think really hit the mark of the question that I'm going to ask you, which is about how, I'm seeing, unfortunately, the community becoming more divided over this issue, and I'm not pointing fingers at why that's happening. But what can we do to bring the community closer together on this? And I don't want to use the consultation word again, but I mean, what would make you feel safe? Because what I'm hearing from a lot of people is fear in their community, which is and public safety and crime, as you pointed out very eloquently. And actually, I have another motion coming forward, B9, which is on public safety. So I put that forward without any statement about this, not knowing this was coming on our agenda. So I do understand exactly what you're saying, but just wondering how you think we can move forward in a way that's respectful and gets people the help that they need, but at the same time helps to alleviate the fears the community's feeling.
Yeah, the overdose is a crisis, but our safety is now becoming a crisis. We can't be on the phone with the police every day. It's got to be addressed faster and calm down the neighborhood. If this goes in, I don't know. It's going to be so divided because people are so scared. So the safety of the residents also has to be addressed ASAP. Like, people are getting threatened. You're on the phone taking pictures, calling the police. This is not a good way to be living. And so I know that, yes, death is higher priority than this kind of crisis, but it's still a major crisis. We're talking stabbings and other things going on. So, like, we can't delay your proposition. It sounded like it's a special meeting, but that sounds pretty slow to someone who's living this way every day in this neighborhood.
It's the process we have to go through here. You have to have a meeting and agree to something to have another meeting. But would you welcome something like that? Do you think that might, dealing with those issues might help to alleviate some of the fears that are coming alongside this? And
I do agree with that, and thank you for bringing the proposal forward. And yes, absolutely, there's processes to these things for sure. So thank you for bringing that forward, and hopefully we can move it faster. And some group of this group will probably never change their minds, but there are people who've lived with all sorts of services in the downtown, Gastown, East Side, worked in all these neighborhoods like myself, that have never felt this way about an issue. It's because the state of fear is just so high right now with what's been going on. It's just night and day place, and it's only changed in this months, not years.
And that's my time. Maybe I'll have another 3 minutes if we have a meeting. But thank you very much, and thanks for being open-minded.
Thank you.
Thank you. And we're on to speaker number 67, it looks like, and I'll just read out the name here. Is Kim Lockhart.
Yes, that's me.
Great,
Hello?
thanks.
Can you hear me?
Hi. Yes, I can. Please go ahead, up to 5 minutes.
Yes, hi. Thank you for taking the time to listen to what I have to say. My sentiments echo very closely speaker number 6's sentiments. Just a little bit about myself. I'm a single mom of 2 young children, ages 7 and 11. I've been living in Yaletown for 20 years and currently live in a townhouse on Seymour. And for the first time in my life, in living in this neighborhood, I have been afraid for myself, for my safety, and for the safety of my children. There have been numerous incidences in the last few months that have caused me to feel this way. Some people have already mentioned certain things that have happened to them. They've happened to me too. And it's kind of come to the point now where I'm wondering whether I'm going to be staying in Yaletown. And so for me, my primary concern and why I'm so opposed to this project going up in a family dense area is for safety. Over the last few months, and it has been mostly over the last, I'd say 7-8 months that I've noticed a huge shift. I've had to explain to my children why people are defecating in front of my front doorsteps. I have had people shooting up on my front doorsteps. I have had, people urinating on my front patio. I have had to remove my furniture from my front patio. I have spent thousands of dollars on safety enforcement measures. I've had to install a gate, sensor motion light at my entrance, new alarm system. This is all at my expense. And the city isn't helping me with this. I work as a teacher trying to make ends meet with my 2 children. And I'm really running out of ideas on how to explain to my children what is transpiring. I tell them now not to leave the house, not to leave the front door without looking through the blinds at what's happening outside. Like, make sure that it's safe before you walk out. Like, to me, this is really, really concerning. I fully understand the issue. I feel terrible about the various needs on the streets right now. There are many people that suffer from addictions and from mental illness. And I would love to see them obtain support, but I think where this support is being offered is very key. The proposed project is directly across from, what used to be a highly frequented park, one of the favorite parks in the city, in the heart of the city for families. I know very few people that feel safe going there now. There are needles everywhere, people sleeping in the parks, people sleeping on benches. You know, you go there early in the morning, sometimes there's people underneath the swings, underneath the slide. It's not safe. It's not safe for families. I don't feel safe in my neighborhood, and I think that needs to be considered. What I had to say this evening.
Thank you for calling in tonight. I don't see any questions for you, so we're going to move to the next speaker. Thanks very much. And the next speaker is, okay, so speaker Jonathan Twilight Orr.
Hi, my name is Jonathan. I'm speaking in favor of this motion. It's actually been really powerful to hear everyone's comments so far, and to hear both sides of the story. I think one of the things that I would like to speak to is kind of a bit of we can hear it in the discussion tonight, where when something like an overdose prevention site is proposed, that site can all of a sudden be a flashpoint for all kinds of issues that actually are not connected to the service, and not connected to that site and not part of its mandate. So we hear discussions, legitimate discussions and concerns around safety, around homelessness, and around poverty. But these are issues that an overdose prevention site is not meant to address directly. It's not the responsibility of an overdose prevention site to solve poverty or to solve homelessness. An overdose prevention site is a critical component in meeting the needs of the population who are homeless and are suffering the effects of structural violence. But that's not its specific job. Its job is to be a place of radical kindness, and a place to keep people alive, and a place to connect people, and a place that creates community. And as an earlier speaker said, it connects people to services, it connects people to care, to open up avenues of opportunity for people where they didn't exist before. And so I think it's really important for me, at least, to always think about what it is that's being proposed and what the mandate of something like an overdose prevention site is, and what its job is and what its job isn't. No, an overdose prevention site is not going to be able to instantly solve the issues that some of the speakers have talked about that are happening in their neighborhood. But it's not its job to do that. It is part of a constellation of services and a constellation of solutions that need to happen at every level, at a community level, municipal level, provincial level, and federal level. There are multiple issues layered on top of one another. But this overdose prevention site, especially if it can exist in Yaletown, would go to a huge way to showing the community that would access these services that they're cared for. One of the things that we know drives street disorder is when people have a sense that they have been abandoned and that they've been forgotten and that they're not equal. We know that trauma drives addiction, and we know that despair drives addiction. And imagine having a disease where you had to beg to have services. Imagine having to beg to have a doctor's office and to go to counsel and to speak in defense of a cancer clinic or ambulance services or any of those kinds of things that should be a given, that should be something that our community and our city wants to do. And so people walk around with that trauma on their shoulders. People know that we're having this conversation. People in that community who need these services know that once again, there are people arguing their fate on both sides of it. And that is an incredible burden for people to walk around carrying. And the overdose prevention site can be a place to heal some of that, for people to connect with the workers there, to connect with each other, to connect with social workers, mental health care workers, with all kinds of workers. But one of the things that I've witnessed there, and I used to manage the Maple Overdose Prevention Site and the Molson Overdose Prevention Site, as well as briefly the St. Paul's overdose prevention site. One of the greatest things that happens in these places is the community that grows up between service users, and the knowledge that they share, and the bonds that they build, and the space they create, and the sense of family they create. And when people feel a sense of belonging, and when they feel accepted by their community, it goes a huge way to reducing the kinds of things that people are frustrated by in their neighborhood. Being clear that that's not what an overdose prevention site's job is to do, is to solve the problems of structural violence. Those are complicated problems that we all need to work towards solving.
15
but
seconds.
It can go a huge way to creating a sense of community that would lessen the things that are driving that.
Thank you so much. So that's the 5 minutes. I don't see any questions from council to you, so I just wanted to thank you so much for coming in this evening. We're on to speaker number 72, Catherine Clark.
Hi, can you hear me okay?
I can. Please go
Hi.
ahead. Up 5
Hi.
minutes.
Great, thank you. Okay, so first of all, I want to thank all of you. I've been listening on and off since about 9:30, and this is quite the marathon day that you've had to listen to everyone. So just first off, thank you. I am yet another Yaletown parent. I've got 2 little boys, and I live in Yaletown, but I'm actually not directly speaking on their behalf. Don't tell them, I think they're wonderful, but I'm talking from a larger platform. I'm probably the only person you're going to talk to today who has founded an elementary school in Yaletown. So I'm the co-founder and the director of the Claren Academy Society, which is a charity that runs Claren Academy. And we are an independent elementary school. We're currently located at 1035 Canby, and next year we'll be moving to 1085 Homer. We have 50 students between kindergarten and grade 5, and we're expanding every year, so hence the move to Homer Street. Most of our families live within walking distance of our school, but some come from different areas of the city. And we had a number of reasons for starting a school downtown. It's a future-focused school, and we wanted to be downtown because, as I'm sure all of you know, there's a shortage of schools in Vancouver, but also for my own kids and for the kids that we're serving, we wanted them to have an urban education and to see what's happening in our city and other cities, and to have compassion and to understand their neighbors and to take the tools that they're getting in order to make long-term change. Because every single person that's called in today and that's on the council, I'm sure will agree that this is a larger problem than is going to be solved by one overdose prevention site. And so with that, we need our kids here and our families here and seeing what's going on and talking about the larger problems. The number one, I've listened for most of the day, and I can hear that the site is probably going to go ahead. And I've heard the great questions from Councillor DeGenova asking how to bring families and current residents of Yaletown around to this. And the best thing that I can think of for you, the answer would probably be data. So for me, the biggest problem that I see that's an immediate issue in Yaletown is needles and feces and other kinds of waste. So, and when I was listening early this morning, I heard it mentioned that there wasn't a concern that increased sanitation would be needed. Maybe I misheard that. But what I would love to see would be if the council, if somebody sponsored an audit of the current setup around Yaletown, or the current situation of needles and paraphernalia and waste, and then show us once the site is open that it's improving. And that's something that I could take back to my families and say, you know, they heard us, they're working on this, because our families are leaving. I heard from another lovely family today that they're pulling their kindergartner and moving to Burnaby because of all the needles in the playgrounds. And so, I mean, there's bigger things I could talk about here. I'm a social worker by training. I firmly believe in the 4 pillars. I would love to see a comprehensive plan from Vancouver on how to address longer term drug use. I was really interested to hear the gentleman who spoke right before the break about how this is dealing with poisonous drug use. And that was interesting to me to learn. But for me right now, as a resident, as a person who feels qualified to speak for 50 children between the ages of 5 and 10, I'm telling you that my biggest concern with this site going in across from Emery Barnes will be needles. Because if people can take needles and leave the safe injection site, the needles are not all going to make it back there. And they're going to end up in our parks and in our bushes and on our streets. And that's my biggest concern. I pick up I have chopsticks in my school so that I can pick up the needles on our front steps and put them in a sharps container. I'm not going to ask my teachers to do it, so I do it. And I don't begrudge that. Like, this is our neighborhood and these are our neighbors, but I don't want it to get any worse.
Thanks so much. You do have questions from councillors. Councillor Dejanova, up to 3 minutes. Please go ahead.
Thanks very much, and thanks for making the time to even speak with us today and for listening since 9:30. My first question to you, in case I run out of time, is do you have some comments? You know, you'd mentioned a number of things, and I'm trying to furiously write them down. Could you send those to council? Would you mind? Just a few of your, especially on the audit?
I did put in a comment on the website last week, and I did get a standard response back, but I don't know if I should reply to that or send it directly to you.
That's fine. I will go and endeavor to look for that. We've received a lot of emails just over the last day here. So my next question to you is, do you think that this is becoming an issue that's conflated? I mean, I'm sure you've heard, I have another motion I've put forward. Some of those issues have been touched on, but I see public safety and some of those issues, although touching on some of the others in the 4 pillars. Do you see that as if that was addressed perhaps in a way where the community felt heard and engaged with council, that there would be ways forward and we wouldn't see the division that we're seeing here? You don't have to answer my question, but I'm looking for a way forward here.
I think it's possible. I mean, the families that we have, we're very open with them when they enroll in the school that we use downtown parks as our playgrounds. And so our families are aware that their kids are going to an urban school and they're open to it and they want to be part of this community. And if they could at least feel like they were being heard and that things were being looked at in an analytical, quantifiable way, I think that could help, but it's still, I mean, this feels like it's moving very quickly. I'm sure that people who work in this area have been wanting this for a while and don't see it the same way that we do, but it feels, it feels like some data and some research and showing that it really is helping would be helpful. But like I said, I'm a social worker. I would love to see a more comprehensive plan for the 4 pillars.
Thanks so much. Thanks for coming and for your ideas. And just in case we didn't get it, if you wouldn't mind maybe sending your email in those comments, it would be great to hear some of your ideas. And I want to make sure I don't miss it if I can't find it here.
Sure. Yeah, I'll send it to you.
Thank you. You also have a question from
Chair, I have a point of order.
Okay. Go ahead, Councillor Boyle.
I didn't want to interrupt the speaker, but I have a point of order under 7.7B, which is that this is the 4th time that Councillor Dejanova has raised her own separate private motion, which I understand is not the point of the discussion today. And so I'd like you to rule on whether that is appropriate in the context of discussing the issue in front of us.
Okay, I'm sorry, the number again was
7.7B.
Okay, I'll come back in a second to Councillor Kirby-Young and I'll rule on, come right back. Thanks very much. Okay, Council, I'm looking at 7.7B and it says council members may pose a question to a speaker except that, and B says a council member may only ask a question of a speaker to clarify the speaker's position as related to the recommendations contained in the report or the content of a member's motion. And so, Councillor Dejanova, you can probably get at the same question without mentioning the other business, but if you could do that, that would be, that'd be great. Okay.
Point of parliamentary procedure, Mr. Mayor.
Sure, go ahead.
I'm just trying. Before I had mentioned to Councillor Boyle, I'm not trying to mean to offend her, but I also don't see public safety noted in here. But lots of people are talking about public safety, so do we let people talk about that? I mean, I'm open to doing it, but it's hard not to ask if they're talking about it.
If it's a point of order, I don't.
No, it's a point of parliamentary procedure. I'm just asking.
Well, of course,
question.
it's hard to. Of course, we can't control what people from the public are saying, but we can control our own questions. So I think that's that's what we're trying to do there. So folks,
thanks. I'll try not to use the reference again to B9.
Okay, thanks very much. And we have Councillor Kirby-Young now with a question up to 3 minutes.
Thank you. Thank you for being here tonight, and I appreciate your experience with the perspective from the school. You had mentioned that you had one family or parent that had come to you that was looking to move to Burnaby, and specifically because of the related sort of social impacts and issues. Is that something that you're seeing? Have you had other families and parents indicate that they're leaving the neighborhood because of the increase in sort of the impacts of related social disorder?
Well, I mean, it's tough to say because, of course, our population self-selects. Like, people don't apply for our school unless they're looking for an urban downtown school. But we have definitely had people, like this family that I'm talking about, took advantage of not took advantage, they're, it's not nefarious, but they, in terms of the COVID response, they didn't come back right away because they weren't actually worried about COVID. They were worried about their daughter on our playgrounds, which is shocking to me. But we've had families, I have had families tell me that they can't stay in Vancouver long term because they can't let their kids go to the park alone. So we have had a few families leave for that. But it is like, I've heard a few speakers say today that are coming to it in support of the injection site that people need to meet people in order for there to be human connections and empathy and compassion. And if the families leave Yaletown because they don't feel safe, you won't have people meeting people. And that's what I'm trying to tell you, is that I'm committed to an urban downtown school and raising my children here and educating our kids here. But we need to be able to go to the park without finding needles in the bushes.
Okay, so you are, just to be clear, you are open to a diverse community and supporting different people and, potentially folks with challenges, but in a way that is done that the community can still continue to utilize the amenities and live their daily lives. Is that what I'm hearing?
Yeah, absolutely. And I want to be able to tell our students, like, yes, these people need help, and look at these long-term things that society is working on. Like, there's many pillars, and it's definitely, I live in Yaletown. I love Yaletown. I believe in raising my kids here, but I literally find needles every single day. And I just don't want it to get worse.
Okay, and the school, also to clarify, does the school utilize the park as well as you utilize it personally with your family? Just trying to get a sense of usage.
Yeah, definitely. Yeah. Our main playgrounds for the school are Cooper's, David Lamb, and Emery Barnes. But I'm also at the parks almost every day with my own two kids, for sure.
Okay, so it's an important resource for the school as well as for you as a resident.
Mm-hmm. Yeah, definitely. And I feel a responsibility to our families when they sign up for a school and they say, do you have a playground? And we say, no, we don't, but we have the beautiful Vancouver parks and we use them every day. But and I'm not even against doing a sweep of a park to make sure it's safe before our kids run into it to play. But I just don't, I'm worried that I personally don't like people being able to leave an injection site with needles. Like, okay. I think that the needle should stay there, and that seems like a quantifiable, practical thing on this specific issue.
Thanks so much.
Thank you very much. I appreciate your comments.
Councillor Fry, up to 3 minutes. Oh, you're a little faint, Councillor Fry.
Sorry, I had my. That's okay. Yeah, thanks, Mayor, and thanks, Ms. Clark, for spending some time with us today on this. You mentioned data in talking, and I appreciate that context, because I think that there's what we're definitely seeing today in this presentation that we've received and how it's been delivered to the public. I think there has been kind of a lack of data to really compel some of the issues, and I think would more information, let's just assume, based on the numbers that we have from the BC Coroner reported, 29 people have perished in your neighborhood from overdose this year. So we know that there's a need for some kind of service, and assuming that we're going to have to deliver some kind of service to ensure that people aren't dying on the streets of Yaletown. what would make this work for you? How could we make this a better fit for your community and give you that sort of security?
Well, I have to say, as I'm talking to you, a few of our families are listening in, and one of them just messaged me and said to tell the council that they are considering leaving. So I'll just put that out there. But to make it, I would say that the first thing on the street should be more social work and social services presence and more cleaning. At 8 a.m. in the morning is when we find human feces and needles on our front steps, and we clean it up at the school. And, we can't go to the park first thing in the morning because that's when there's going to be a mess. We can't do science, experiments where we can go collect things in our neighborhood because the kids aren't allowed to pick anything up off the ground. So the first frontline, most practical thing I would say is, yes, I do not want my neighbors dying. This is a priority. And number two, I want the city to be putting the same number of resources into making the streets and the parks safe and not full of hazards for our kids. If things were safer and healthier and happier, I say why not both, honestly. I mean, I've heard a lot of speakers today talking about, thinking that this is just NIMBYism, and it's not. I love this neighborhood and I love the people in it, but I also want my kids to be able to run into a park and play. And that's a practical concern that the city can fix. If there's increased sanitation and I'm not even talking about increased police presence, because that's not always the most welcoming, but just increased cleaning and community presence would make a difference. It honestly would.
Yeah.
Even if I can tell my families that you guys are listening and that you're considering taking action that's more far-reaching than just the injection site, it would help if they know that you're not dismissing this out of hand. Because it does feel like it's being pushed through. And I heard the woman from Pivot earlier saying that public consultation is not, is essentially illegal in this kind of setup. And I hear what she's saying, but at the same time, it's not. If you really want the area integrated and adopted, you need to listen to the residents that are here as well. Because if we all leave, you've got another unfortunate downtown east side situation where the only residents are unhealthy and you don't have the presence of the other neighbors who are offering something different. I mean, another person, I know I'm probably over time, but anyone who lives in Yaletown knows Todd. He cleans the streets here. He's so wonderful. I talk to him every time I see him, and I talked to him on Thanksgiving, and I told him about this site going in, and he was not happy and really wanted to know how he could speak. I told him that I would try to get a word in for him if he could, because he said essentially he's going to be around the safe injection site now cleaning all the time, and he's never going to make it down to the seawall and make the seawall beautiful. And, that's Todd shouldn't, I'm glad that he can make a living doing what he does, but he shouldn't have to. But he does, and he's concerned about the site going in. And so I told him I would try to get a word in for him.
Okay, thanks so much. Thanks for calling in. We don't have any other questions for you from council, so we're going to move on to our next speaker. Thanks so much. We have speaker number 73, Miriam Glotman.
Yes, I'm here.
Please go ahead, up to 5 minutes.
Okay. Hello. Yes, my name is Miriam Glotman, and I'm on the Strata Council, the Charleston at 499 Pacific Street, which is very close to this proposed overdose prevention site. We are extremely opposed to the site. This is not about stigma or stereotyping, or it's not about not being compassionate to vulnerable individuals. This is about real safety issues. I have lived in this neighborhood for 5 years, and the deterioration of this neighborhood in the last 6 months is very, very real. Our neighborhood is becoming increasingly more dangerous, and it's becoming more difficult to keep our families safe. While we support safe injection sites, this location directly across from a public park and playground at Emery Barnes Park is inappropriate and detrimental to our well-being as residents of the area. Our children and families need safe communities, especially in a public park where we should be able to enjoy ourselves with peace and tranquility. This park is heavily used among the residents in the area, and there's always many small children in the playground and people with dogs in the dog walking area. Emery Barnes Park used to be a beautiful park. Since COVID-19, you often find people high on drugs, sleeping on the benches, urinating, and you can find dirty needles on the ground. Just yesterday, I walked by around 4 p.m. and the park was full of families with children playing in the playground in the middle of the park. but the surrounding benches had individuals sleeping, high on drugs, and some were just loitering around. I was actually amazed at how many families were there. But what choice do we have? There are not a lot of parks and playgrounds in the area. Allowing a permanent safe injection site in this location will just exacerbate the problems we're having, and this park will no longer be a safe place to be enjoyed by families in this community. I'm also trying to figure out, I know that you have a city bylaw 16.1 that says a cannabis store cannot be within 300 meters of a park or a school. And you're considering allowing a safe injection site directly across from this park. I don't understand that. I've represented for the site said earlier today, which I heard this morning, that the drug use is currently happening in our neighborhood anyway. But what they failed to see is that our neighborhood was not like this pre-COVID. The dismantling of Oppenheimer's Park Tent City has exacerbated issues and has not solved problems. It only spread it now throughout the city, with Yaletown being one of the hardest hit areas. Our neighborhood is experiencing an alarming spike in illegal open drug use, discarded dirty needles, increased break-ins and theft, violent and aggressive behavior, urinating, and the list goes on and on. People no longer feel safe to the point that they would like to sell their properties and move elsewhere. That is real. The government purchase of the Howard Johnson just added to the negative changes in our area. Now that the proposed safe injection site is another step to solidify these changes in our neighborhood. There's a very clear trend of moving towards a situation similar to the downtown east side of Vancouver. Is this the future plan that we want for the downtown core area? It's sad. City planners have worked so hard and have done an amazing job in creating a beautiful, livable downtown area. We are the envy of the world. Now our landscaping is changing quickly, and all that was accomplished is at risk. We should be listening to our police department. Our police officers are on the front line. They know, and they just told us earlier today at this presentation, drug dealers will come to the safe injection service and this area. There will be more crime. They're telling us that there are other places in the city where deaths are much higher, and these types of services are needed more. Resources should be directed in priority. And we were just told by the Vancouver Police Department that this downtown core area is the second to the bottom in the number of deaths. Why are resources going to go to this particular area when we're hearing from the Vancouver Police Department that you should be focusing on other areas first? If the focus has to be in the downtown core, then there are better locations like St. Paul's Hospital for all the reasons a caller said earlier today. One of the councillors asked about security in this area, and the response they got was that they would hope that it would not be necessary. Hope that it would not be necessary. That is very concerning. We have heard the types of terrible crimes and behaviors in Strathcona Park. Are we supposed to sit and wait until one of the children at Emery Barnes Park is hurt so we can decide whether it is safe or not? I know you as City Council is very concerned about these people, and rightfully so. I agree with you. But how about concern for the families and children living in this neighborhood? Supporters of the site location are drawing a stigma about the non-supporters. I heard today we're all property owners that don't want drug addicts living near us. Well, Yaletown has a huge number of renters, large ranges of income levels, and social housing. We all deserve to feel safe. The majority of us are taxpayers, and it's our taxes that fund these parks and fund these programs. We need to find a way to fund both in a way that we are helping the most vulnerable, but not at the expense of our safety and the use of public parks. This is not the right location for the site. If City Council approves this, you'll be making a decision that only helps a few, while the effects are detrimental to the safety and livability of the majority of the individuals living in this area. We urge City Council to please oppose the safe injection site, 1101 Seymour Street. Please help us so we can feel safe in our neighborhood and in our own homes.
Thank you. Thanks so much. And I don't have any questions for you from Council, so we're going to move on to the next speaker. Thanks for participating tonight. Next, we have Kathy Swadling, speaker number 78.
Sorry, Council, I wasn't expecting my name to be called up right this second. Thank you. Good evening, Council. My name is Kathy Swadling, and I'm here today to ask that tenancy for the safe injection site at the Seymour location not be granted. This is not an objection to harm reduction. It's an objection to the proposed location of these services and a plea to Council to address the root causes of social and community issues. I'm a property manager with years of experience managing real estate in challenging environments, including the downtown east side. The Davie Street I remember from over a decade ago was a thriving area packed with small businesses supported by a diverse and accepting community. Davie Street today has more in common with Chinatown, a visual representation of our most vulnerable, neglected, embattled history on repeat. Businesses are struggling to survive COVID, and now they're also fighting crime, fear, and bankruptcy. Addition of a safe injection site at Emery Barnes would tip the scale and sentence this neighborhood to a commercial ghost town, and so unnecessary. The proximity of St. Paul's provides a ready-made location, one designed to provide medical services. The current social services building at 1101 Seymour houses services for foster youth and indoor sex workers. The space would better be suited to similar social services that complement the existing tenants and improve the community: senior services, First Nations services, employment services. Property manager is my job, but my perspective on social crises facing Vancouver runs much deeper and much more personal. My aunt was born to this world disadvantaged by alcohol fetal syndrome, a visible First Nations ancestry, and a whole host of medical challenges yet to be discovered, very much in line with the demographic of our homeless population here today. Adopted and loved very deeply, my Aunt Connie still eventually ended up on the streets and homeless for a period of time. I still remember my mother trying to explain to me why her sister has frozen feet and what schizophrenia is. I remember how much joy my aunt brought me, just the same. With periodic hospitalization, excellent support services, my aunt was eventually able to obtain a good quality of life. More than that, she enriched my life in immeasurable ways. Had she not received this help, I am sure she would have been another statistic, another soul lost on the streets. My aunt did access public support systems at great sacrifice to my grandparents. The point I'm making is that the wraparound services she received are actually the core services she needed. Social housing and work programs are great, same as safe injection, but for healthy people in need of helping hands, we can move them into housing, we can move them into work programs, but not people with needing safe injection. They're not there yet. The injection sites and emergency housing, they're just water pumps. You have to fix the source of the flood. Council, you'll not be popular no matter how you deal with this crisis. So embrace the moment and do what's right. Invest in saving people, not the bodies they inhabit. Invest in mental health and addiction care. Listen to the experts like those at the Treehouse and United Way, and embrace earlier intervention. Use this election year to collect the voices of Vancouver and demand better care from our province and federal government for those most desperate. You represent a first-class city. You really can make a difference. Thank you, Council, for hearing me today.
Thank you. There's no questions for you, so we're going to move on to the next speaker. Thanks so much. We've got, sorry, Council, just looking here. I think it's speaker number 79, Nagar Katami.
Hi, thank you, Mr. Mayor and City Council, for the time that is allocated for me to speak today. My name is Nagar Katami, and I am opposed to Report 6, which is modification of lease for supporting Women's Alternative Network and Rain City Housing and Support Society for Overdose Prevention. I have listened to all councils and speakers before me today, and I regret to say that the city still has no proactive solution to drug abuse and mentally ill in Vancouver, British Columbia. I'm an immigrant who moved to the city over 20 years ago. Since then, I have seen the drug abuse and issues related to that moving from destroyed historical areas of Main and East Hastings Street to Gastown, rapidly to Crosstown, and now to former Howard Johnson and Yaletown. During this time, I have watched a model being used to have affordable housing together with free injection sites, hoping to reduce and eliminate street drug use and eventually save lives. For 20 years, the model's success rate has been low, as the number of drug use has tremendously increased with higher overdose and death rates. I will not bother you to reread the stats that were provided this morning by various groups such as VCH and VPD, and also the actual low rate of crimes prior to Howard Johnson's allocation for new residents in Yaletown. My question for you is, when are we going to realize that the model adopted is not working, not responding, and it has been over 2 decades since its implementation? Why are we not instead take a closer look at the root of the problem, which is still the same: drug dealers and criminal sources plus mental illness in the city? Our VPD is highly trained to take out the sources of the criminal activity, but daily we are wasting this resource on containing and controlling crimes that are a direct result of mismanagement of criminals and dealers on our streets, and also the mentally ill. I'd like an answer for this, please. We all know best way to help a drug user who is also mentally ill is to be in a contained facility, to retrain, rehabilitate, retrain, re-educate, and then release. With current model, we're asking someone with mental issues, illness, and also who is an addict to respect themselves, the law, and neighbors. Don't you think this is so much to expect from an addict? But we certainly have quite a few social housing and safe injection sites in place that do nothing to restore and save these people from their cunning and baffling disease, just so one day they can become a responsible member of the society. Why, after 20 years, we have not allocated such a facility outside of downtown core to actually cut the root of the problem and create an equal opportunity for the ones who are in this messy system? I believe Council Fry had the same idea this morning. Quote, 6,000 square foot space with inside help and safe outside area for the smoking or inhaling, and further help to clear them of drugs and perhaps teach them a certain trade so they can stand on their own feet one day and live a natural, healthy life. I, as a woman, reside in the neighborhood in the 1100 block since June 2020. I have been verbally assaulted by the mentally ill and drug addicts on Davie Street and have been followed by two men who were very high on drugs while I was coming back home from grocery shopping one night from Fresh Market, and assaulted verbally with obscene profanity on Homer Street during daytime. My friends are escorting me back home when we visit. Isn't the purpose of a safe and affordable housing to have these guys to restart fresh, and the purpose of safe injection sites to have less HIV and similar disease transfers and safe neighborhood just simply because all have gotten their fixes? Then could you please explain to me why the back alley of Foreman Howard Johnson and the parking lots on each side, day or night, are filled by the same group that you have set up this massive and extremely expensive operation and housing for? They are shooting, inhaling, then going in the former Howard Johnson to rest. How is that helping for rehab and restore to become a responsible citizen? Why are we enabling the drug addicts? Clearly, adopted model has not been working. Clearly, the residents in downtown Vancouver's public health and safety are disregarded. We are enabling the drug users. I would like and appreciate knowing if any of you actually might have a proper and concrete plan in place to rehabilitate, retrain, re-educate, and then re-release patients. In other words, enforcing the 4 pillars by harm reduction, prevention, treatment, and enforcement. Thank you.
Thanks very much. We're at 5 minutes. Thank you very much for calling in. I don't see any questions for you, so we're going to move to the next speaker. We have Dr. Jeff Bardwell, speaker number 81.
Hi, can you hear me?
Yes, I can. Please go ahead.
Okay. Thanks to the council and Mayor Stewart for allowing me this opportunity to speak. I do not live in Neiltown, but I do live on East Hastings Street, and I've lived in other cities in neighborhoods dealing with similar challenges. I'm at UBC in the Department of Medicine, as well as at the BC Centre on Substance Use, and I specialize in overdose prevention interventions, supervised injection sites, and other public health programs that target people who use drugs, as well as those who are precariously housed. I'm speaking in favor of this motion, and I have 3 main points that I will speak to briefly, all of which are supported by the scientific literature. And a few people have talked about we don't have data or we're not sure what this is going to lead to, so I'm just going to provide some of that. And if council wishes to read further, I'm happy to send any articles. So first point, we know that people generally won't travel far to access supervised consumption services. So it's integral that these life-saving services be located across the city, and particularly in neighborhoods where there is a need. We also know from research by Dr. Dania Fast that people who live in or access services in the downtown area, the Granville corridor, folks who are accessing services here avoid other neighborhoods, including the downtown east side, for a number of reasons. And her research really emphasizes the need for more health services in this area. Second point I want to talk about is the link between housing and overdose death. The majority of overdose deaths in British Columbia occur indoors, approximately 90%. And this makes housing-based interventions a priority. And so I think given that there's already social housing in this building, as well as supportive housing nearby, this is a timely and very much needed intervention in the neighborhood. Third point, a member of the VPD earlier in the day suggested that the opening of this site will lead to an increase in crime and predatory behavior by people who sell drugs. There's simply no evidence that suggests this. Yes, there may be dealing in and around a site, but there's dealing in every neighborhood regardless of an overdose prevention site. Dr. Evan Wood, among others, did a study that found no association between the opening of a supervised consumption site and increased drug trafficking, nor crimes commonly linked to drug use. And I think there's been a few other comments from others making claims that are just not substantiated in the scientific evidence, like comments around cost to taxpayers. But there's a lot of growing evidence that suggests that these sites are cost effective across multiple jurisdictions. And then lastly, there's another concern raised regarding publicly discarded needles. And so Dr. Thomas Kerr published a study in The Lancet that found that the opening of a supervised consumption site was independently associated with the reduction in public injecting, publicly discarded needles, and other injection-related litter. So I think, like, to sum everything I've said here, one key takeaway from this is that we really need to do a better job educating our neighbors and the general public about the scientific literature on the topic in order to garner more support for these life-saving services. And I know Vancouver Coastal Health, as always, evaluates all their services. So, you know, people keep talking about data. And so this is some of the data that exists out there. And I'm, again, happy to share this with anyone who wants it. Thank you for allowing me time to speak.
Thank you so much. You have a number of questions, starting with Councillor Carr. Councillor Carr, up to 3 minutes.
Yes, thanks so much. I'm interested in, yes, you sharing the studies that you cited, including the one about people accessing services that live in the Granville Strip, the Yaletown West End area, won't travel to the downtown east side. Is that you noted that was a specific study? Is that right?
Yeah, so that was a study done by Dania Fast, and it was looking at youth who use drugs. And so issues around safety and accessing services in other neighborhoods, particularly the downtown east side. But that also really blends well with other research that talks about how people just won't travel far to access services. So it's important to have them in multiple neighborhoods.
Great. Maybe you could provide these that study and then the next one I'm going to cite to all of council. I think that I'd appreciate it for sure. The other was the study you mentioned by Dr. Evan Wood, that overdose prevention sites regarding whether they lead to increased crime. Can you just give me a very quick summary on where the source of data were for that?
Right. So I believe they looked at all of so police reports 1 year before the site opened and then 1 year after and compared them.
And so
how they got that data, I would need to. I wasn't a part of that team, so I can't speak to that. But I could send you the article.
But obviously, if they looked at the data 1 year before and 1 year after, and their conclusion is there's no evidence that there's increased crime, the crime rates stayed the same, basically, whether like once an overdose prevention site went. Do you know if it at all declined, or if it was just static?
I'm not aware. There may be literature out there. There's so much literature in this area, but I can't speak to that.
Okay. And what about the final point you made that these sites are cost effective? Cost effective in terms of what? Public money into I
mean, people often talk about cost effectiveness as being, people often see putting money into supervised injection services, as this is taxpayers are putting money into these services, but it's kind of like having a site versus not. So what do sites do? Well, sites reduce overdose. Sites reduce transmission of HIV infection, right? So the cost to a system for providing treatment to someone who has HIV or someone who has hepatitis C. So it's kind of like weighing those costs versus having the site that is reducing the spread of infectious disease. See what I'm getting at?
Thank you. I actually do. Thank you so much.
Thank you. Councillor Fry, up to three. Quite another question from Councillor Fry, up to 3 minutes.
Yeah, thanks. You mentioned overdose prevention sites leading to a reduction in needles and sort of assorted adjacent litter. What would the baseline for comparison be to that when you're talking about this reduction?
I can't answer that question. I didn't do that study. I was just I heard a comment from someone about that, and I'm like, oh, there's a study that exists about that. So you'd have to reach out to Dr. Thomas Kerr about that. He's the one who led that study.
So okay, I appreciate that. I'm writing that down. What do you think would what are the kind of symptoms that we're seeing in an OPS that would conceivably lead to the reduction in that kind of litter?
Well, I mean, if people are using, so people have concerns right now that people are using in a park that's across the street. So it kind of makes sense that if you have a site that's right across the street, people will use within that site, and therefore those needles won't be in that park, right? That's the logic there.
Yep. No, I just want you to spell it out because it is something that's come up a few times, and I know that's a concern for folks, and it would intuitively make sense that would be the case. Do you know if OPS? I know that there was a time when we used to call them needle exchange, and there was like an actual bring in a needle, get a needle kind of a policy. Is that still an option, do you think, or is that still practice?
No. There's been lots of critiques of that. That still exists in some countries, but essentially it becomes an issue around accessibility, particularly for people who are might be traveling from another suburb or something, and so they might need more access to something. So if you give someone only 1-for-1, then they might reuse that needle. They might share that needle, right? So the idea of an exchange doesn't happen now.
Do you think there's options for encouraging safe disposal on site?
Oh, absolutely. I think though, one thing that can happen, and just as a quite easy change, is to put needle boxes in the park, so people have a place to dispose them. Right.
Okay. Thanks very much. I'm out of time.
Thanks, Councillor Dominato. Up to 3 minutes.
Thanks, Dr. Bardwell. Thanks for your comments this evening. Reflected a lot of things I've read as well. I just wanted to follow up on your comments around we need to do a better job of educating people and our neighbors, and I think that's a really valid point. It's definitely come up through the discussion today, and I'm reflecting back on policy work I've done where in the lead up and prior to implementation, we did a lot of rigorous sort of engagement. A lot of the engagement was in of itself education because there's a lot of misunderstandings and around the topics I was dealing with. And I'm just curious from your perspective, do you think there's an opportunity for that, and maybe perhaps why that wasn't considered in this process? It was done with the mobile site, but not undertaken in the lead up to presenting a lease to council. Do you think that was a missed opportunity?
And I think it just depends on if people have the capacity to do education, right? I mean, are you asking me if I think that what's happening right now is premature?
No, I'm asking more in the context of it seems to me that's come up numerous times. It's not about whether or not there is a site in the neighborhood. It's that engagement piece and that education component that you touched on, and that we need to do a better job of that. And that seems to have been missed, in my opinion.
Yeah, I think there's always need for more education around what services are and someone earlier was talking about, overdose prevention sites aren't going to solve all of these problems that people are facing. So it's important to talk about what they do, what they don't do. And Sarah Blythe was talking earlier about, getting to know your neighbors and ensuring that you have those open relationships. So I don't see this as like, this is a start. A site needs to be open. We are in the middle of a public health emergency. So a site needs to be open, but that doesn't mean the site opens and then there's no conversation.
Great. Thank you very much for your time this evening.
All right, thank you.
And that's it. That's it for questions. Thanks very much. And we're going to move on to, thank you. We've got speaker number 84, Shannon Ho is next.
Hi. Can you hear me?
Go ahead, up to 5 minutes. Yes, I can. Up to 5 minutes, please go ahead.
Thank you. Good evening. Thanks for the opportunity. I'm here to oppose the motion of relocating the Overdose Prevention Center to 1101 Seymour Street. The decision of relocating the Overdose Center was made without consultation of local community, especially the local residents. Yaletown used to be a safe neighborhood. That's why I chose to move here 2 years ago. Lately, since the city moved the residents from the Oppenheimer Park to the Howard Johnson Hotel, there has been an increase in amount of homeless and people with addiction in Yaletown. It has become unsafe. I have been harassed and yelled, and sometimes with racist comments when I did nothing to provoke such behaviors. Same as my friends who live in the same neighborhood. Not just verbally, one of my friends, closest friend, had a large sharp metal object thrown at her. As a single woman, I worry about my safety even during bright daylight. And we are told there's not much that can be done by the police. I have sat through the meeting this morning, and I think the various parties failed to address why they need to set up the overdose center at this specific location. When asked about data to support the increased amount of calls, they didn't address whether the increase of calls was since the city moved the residents from the Oppenheimer Park to Howard Johnson Hotel, which, in my opinion, might be the main cause of the increasing calls. When asked about the specific location, they failed to show they have considered other considerations for this. They failed to show that they have considered other locations for this facility. When asked about the facility, they admit it's not the ideal setup for the center. It's lack of space and injection, lack of space for injections and to accommodate both injections and inhalings. When asked about the practice of social distancing, they failed to present a plan. Their response was that they were here to secure the lease and the plan will come. When asked about public safety, they only addressed the public safety for the users, not the general public. And when specifically asked about general public, their response was, all the users are already in this area, and they don't see the increase of users from other parts of the town travel to use this facility. First of all, they provide no data or number on whether the users are from, where they're from, because they commented that most of the users, they cannot be traced as they are anonymous. I personally see a spike of homeless or people with addiction since the city moved the residents to the Howard Johnson Hotel. And also, just because we are currently experiencing a hostile environment doesn't mean it's right. When asked about public counseling, their response was that as per policy, there's no require for public hearing for either housing issues or health issue. I'm sorry, I didn't get that part very clearly. But they provide example comparing setting up the center, the injection center, to setting up a community gym in the neighborhood. If that's the case, then the policy needs to be reconsidered, as there should be some distinguish between an OD center, injection center, than other community service. When asked about their consulting regarding to if they consult regarding to the exposure to the park nearby, their response was it's other departments' responsibility in the city. Should there be a collaboration between the department to provide the best solution for the neighborhood? So from the meeting, I failed to hear a clear action plan for this requirement, including community engagement, public safety, social distancing, and so on. And I heard lots of comments from this morning is, we're here to secure the lease and then the action plan will come. So who will hold them accountable if they fail to deliver or fail to ensure the safety of the general public? Thanks for your consideration and thank you for your time.
Thank you, and we don't have any questions for you, but thank you very much for participating. I'm going to move to speaker number 85, which is Ayanka Bapat.
Hello. Good evening.
Up to 5 minutes. Please go ahead.
Thank you. Good evening, respected council. My name is Ayanka Bapat, and I'm here tonight to oppose the overdose prevention services on Seymour Street. I'm a software engineer, and I moved to 1155 Seymour Street, which is right down the street from the proposed center, 8 months ago from Berlin, Germany. I picked Yaletown to live due to its excellent reputation online. However, sadly, throughout these months, I have constantly been afraid for my safety and the safety of my wife. I cannot idly stand by as the overdose prevention center solidifies the number of drug users in the area. I understand that a large part of them were moved here from Oppenheimer Park. I live right next to Howard Johnson. I would like to ask the council if they have any data on how many of the drug users are part of the Yaletown community before losing their homes. I understand that this is a frequent argument that these are members of the community and the community should come together in supporting them. I'm not against them, I'm just asking. I would suspect the percentage to be very low here. I mean, how do we justify opening a drug overdose prevention center in one of the most affluent, family-friendly neighborhoods in downtown when drug users aren't part of the community? I'm not against treatment. I'm not against compassion. I definitely believe that these drug users should be afforded help. But I'm against laws that or against bills that threaten my way of life as well. I'm against paying taxes in the 40% bracket, not being entitled here, but I'm against paying taxes and doing my part for the community and still being afraid to sit on park benches. I'm afraid, I'm against being disturbed at night due to bear bangers and loud altercations between drug users. As one of the councillors mentioned, there were 29 drug-related overdose-related deaths last year. But do you think it is fair to normalize drug use in the children's mind for the sake of members of society who are clearly breaking the law? Do you think it is fair to normalize delinquent behavior on the street? And do you think that will promote the image of Vancouver as a city where one can start a business? I, for one, will definitely consider moving away if the overdose prevention center is opened up here. In closing, I would like to say, please move this center. Do not open it in the core of the downtown. It has been done before. The residents of Oppenheimer Park who were moved to Howard Johnson, they can be moved to somewhere likely cheaper. I would like the council to answer my queries that I raised earlier. Are there any statistics on how many of the drug users were part of the Yaletown community before getting addicted? And how is it fine to allow drug usage in the street after affecting thousands of residents for the sake of a handful of addicts? Thank you.
Thank you. This is just the way this format works is that it's statements from you, and we ask you questions, but we'll have our deliberations after we hear from all the speakers. So I don't see any questions for you, so just wanted to thank you so much for coming in this evening and sharing your perspectives. Thank you. Next, we have Zoe Luba. Speaker 115, Zoe Luba, and I do hear some noise in the background, so if people could just check to make sure they're muted, that would be great. Zoe Luba?
Mayor Stewart, this is the clerk here.
Yes.
Sorry, I didn't get you the next speaker in time. We do have speaker number 88 on the line, and I believe speaker number 115 has disconnected.
Okay, great, thanks. I see now we have Diana Davidson. Oh, yes, Diana Davidson, speaker number 88. Please go ahead.
Yes, good evening. Good evening, councillors. I have requested to speak to you today as I'm opposed to the lease amendment at 1101 Seymour Street to allow for a safe injection site. I live on Richard Street and have been here for 7 years, right across the street from 1101 Seymour. I have also worked downtown for 5 years. By living and working downtown, I have witnessed firsthand the disturbing and rapid deterioration of public safety and the fabric of the community. In the last 6 to 8 months, there has been a significant increase in the area of crime, including vandalism and theft. I personally have been threatened, verbally abused, and made to feel unsafe. I feel that the community is on edge. This proposed safe injection site is in very close proximity to Emery Barnes, the busiest playground in downtown Vancouver. Having a safe injection site so close to the park would be too much for the neighborhood to bear. After listening earlier, I have some questions and deep concerns. The site is only said to be a place to do safe injection and isn't going to accommodate the inhaled and smoking of drugs. There was earlier speakers that brought up the positives and benefits of the safe injection site. But what happens to the drug users that do crystal meth and crack? Those seem to be the most popular ones lately and what the majority seem to be doing. How, as a resident, do we handle people doing drugs in the beautiful park I live across from? How do I explain to my 3- and 5-year-old niece and nephew that people can do drugs in the park? Another question I have is, what happens to the drug users once they visit the safe injection site and leave high? Will they end up in the park high? Do you think the park will be a popular place for them to go once they leave the facility? What do we know about what happens to these drug users once they get high and leave? Are they monitored? Will the city supply security within the park and the neighborhood to protect the residents and their families who are using the park? I implore and beg of you to please keep this facility at St. Paul's Hospital where it belongs, to the support and necessary services it requires. Thank you for your time. Good evening.
Thank you so much. I don't see any questions for you, so we're going to move to the next speaker. Thank you. We have Darcy Wise, speaker number 92.
I'll be brief. I've listened to the many comments over the entire day, and I'll just make my comments as follows. I work in property management, so I oversee several buildings in the Vancouver area, and some of them in the Yaletown area. So I've seen a deterioration of the neighborhood, specifically over the last 6 months, has been the largest drop. I truly believe that services are needed for the community. However, I do question why the city would try and move this site directly across from Emery Barnes Park without public consultation. And that's what concerns me. And I think after listening to all of the speakers that have come forward, I think that apart from the scientific data and that sort of thing, the neighborhood is asking that they be consulted and they have some input into what happens to their neighborhood. I've had tenants move from some of our buildings. They've been terrified. I have the manager at one of my buildings picking up needles on a daily basis that are right outside the door, and various other things that I won't go into. And it's been horrific, and specifically in the last 6 months to a year. The building is a beautiful building, one of my buildings, and the other building is great too, and it's filtering down to that building as well. And I think the real concern here is that something like this, which could have life-altering consequences to the people in the neighborhood, this should be something that they should be involved in and have a say in what happens to their neighborhood. So for that reason, I'm opposed to the site being there.
Thank you so much. We don't have any questions for you, and I'm going to move on to speaker number 91, Lori Ergus.
Yes, hello.
Hi there. Go ahead, up 5 minutes.
Hi. Thank you for very much for giving me the opportunity to speak. I am opposed to the overdose injection site proposed for Seymour Street. I really believe that this is not the correct location for a safe injection site. It is right across from Emery Barnes Park, which has been mentioned many, many times, where there's so many children and families and individuals that should be able to be there, enjoying, feeling safe in the park. Our beautiful neighborhood has really changed for the worse so drastically and so quickly. We moved to Yaletown 4 years ago with our 3 young adult children from Kerrisdale, and we just loved it here. We loved the neighborhood feeling, and we loved the different age groups, and the Yaletown feeling was just amazing. It always felt so safe and secure. But since May, after I stepped out of my condo from the COVID kind of lockdown, it's had an extreme change. And I kept hearing sirens all through while I was home. I'm not going anywhere. I couldn't understand why there was always so many sirens when everyone was home. But I guess now I understand. There's just been a huge problem. No one really knew what had happened until we got out on the streets and we started seeing all the change. And I really don't feel safe anymore here. There's people shooting drugs in my lane. There's needles, as everyone's saying, and lots of them around the building, around the grass where I walk my dog just off my lane. There are times when people are sleeping at the front of my building. Our parkade has been broken into. My son's car, which was parked on the street out front, was broken into and things were stolen. There's people defecating in the lane behind here. There are a lot of mentally challenged individuals that need help, and there's a lot of, I don't know if they're high or what, but they're screaming. The other morning, just 11 a.m., I was out, and this very high, scary guy started coming around the corner towards me, screaming, swearing, very aggressive, and it scares me. It's just not. It's not the neighborhood it used to be. I really am nervous to take my dog out at the dark, and my daughter walks to work early in the morning, and she tells me what it looks like on her way to work since COVID, and it's really sad what's happened. There's more crime in the neighborhood. I've been listening and I've been reading, and things are not going in the right direction here. And we do have beautiful parks and playgrounds, but the neighborhood and the young parents are feeling very nervous about bringing their kids there, and that's really, really sad. So I'm just hoping that maybe we could sort of stop and rethink and rewind and figure out how to make Yaletown safe, because it really seems that all this was just sort of done very sneakily. I don't know how it all just happened so quickly, but it just, I think that the neighborhood just want it back to what it was like. It just is really, it's not great to live here anymore. So thank you for your time. That's all I have to say.
Thank you. And I don't see any questions for you, so just wanted to thank you for calling in this evening. I'm going to move to the next speaker, speaker number 93, Michael Haines. Micah Haines.
Hi there.
Hi, please go ahead, up to 5 minutes.
Oh, hi, great. Great, so thanks. Yes, my name is Micah, and I am speaking today as a proud Vancouverite, a father of 2 young girls, and someone who works for a company that has a property management division in Yaletown, and we manage 2 buildings there. Lately, I can relate to the stories that I've heard from tenants about a loss of sense of security and a loss of a sense of community in the area due to a rapid rate in which families are moving out of Yaletown. I think today a lot of great points have been made on both sides of the argument, but I cannot support the new location, the new proposed location for this overdose prevention site for two main reasons. The first being that a proper consultative process, I think, is necessary for a decision this significant. It's quite a glaring issue that if not for a couple of organizations that really turned people on to the fact that this is how the city was proposing to approve this change in location. If not for them, we would not have had the turnout and the speakers that we did today. And it's great that we could hear from so many different people. But really, I think a proper platform for everyone to be heard, businesses and workers and residents alike, is very, very important. And so I'd like to make clear that I'm reserving judgment on whether Yaletown needs a new OPS or not. I think the council was elected to make those important decisions, but really I think that they cannot be made without a complete city or proponent-led public consultation, and that this could be a decision that comes back to haunt councillors looking for a second term or third term if residents aren't given a proper platform for their voices to be heard. And secondly, and lastly, I just think that proximity to the park is a major issue. And we've heard from people today as to why. It really is one of the only parks in the area for families and children to recreate. And I think that, you know, having learned that the city doesn't treat overdose prevention sites as any different from any other medical service, like an X-ray center, is quite a problem and quite shocking. I think that similar to provincial legislation about cannabis retail, I think something along those lines should apply. But that's neither here nor there. I think that's a decision for the city or something for the city to tackle down the line. But I think that in light of not having a proper public consultation and issues around the proximity of the site to the park, Emery Barnes Park, the council would be best to push this off and hear from residents and voters and people in the city before making such a big decision. Thank you very much.
Thank you. I don't see any questions for you, so we're going to move on to our next speaker, speaker number 96, Katrine Staben.
Hi, can you hear me?
Yes, we can. Please go ahead, up to 5 minutes.
All right, awesome. My name is Katrine. I live in Brava. I have 2 young kids, and we do frequent Emery Barnes on a daily basis. And it has gotten quite scary. As you've heard from everybody else, I'm not going to spend too much time on all of that. But I strongly oppose to the motion in regards of the fact that it is so close to the park. This is definitely like a big no-no for me. We've had enough to deal with over the last 6 months with everything from people sleeping in the park and, you know, telling us to fuck off when we're asked, you know, if we could use a slide. So, I'm really...
So it's going to ask you not to use profanity as your...
Oh, I'm sorry. I'm just repeating what I was told. I did not say those words. Okay.
You could abbreviate or something if you like.
Yes. Sorry.
Okay.
So yes. So technically it has been quite challenging on all different levels. So I'm really concerned that having the injection site on the corner of the street there will affect even more what has been happening to us. And even just taking the dog out at night became a scary thing for me. So I'm always on my guard. I had somebody like talking some weird stuff last week, and I got really, really scared. So yeah, that's a big factor. But what concerns me also the most is the fact that, you know, like the site at St. Paul Hospital is just 3 blocks down. And it seems like this one like failed to actually be successful in the fact that, you know, somebody got murdered and now they want to shut it down. So I just don't see how we're going to handle this 3 blocks down from the, you know, hospital. So I think that you guys should definitely do all of your, I know that a lot of council have asked for more information and see like actually if this is a good site, because yes, from the data that we have heard early this morning on, so some of the data were that actually this is not like the best area for, this is not where the a lot of overdoses are actually happening in the city right now. So, you know, so I'm sure you guys will do all your duties, but I definitely strongly oppose, and, you know, hopefully you guys make the right decision. I'm going to keep it to that for tonight.
Okay, thank you. And I don't have any questions for you, so we're going to move to our next speaker. We have speaker number 98, Alexandra Varslavan.
Hello.
Hi there.
Hello.
Up to 5. Hi, please go ahead. Up to 5 minutes.
Thank you. So my name is Alexandra, and I reside at the Wall Center located at 1050 Burrard Street. And I want to make it very clear, I am deeply opposed to this. I was deeply concerned and alarmed to find out that the Vancouver City Council has made an attempt to open such life-altering facility in our neighborhood without a thorough long-term planning, discussion, and transparency. I, as a resident, find it appalling. This is an unsettling reality, and I firmly believe that the Yaletown residents, as well as the residents of Vancouver, deserve better than that. They deserve to have the questions asked and the questions answered, something that's extremely controversial and unsafe, something that is destined to drastically alter and potentially wipe out the established, flourishing community, deserves a clear, streamlined, and transparent public process over a prolonged period of time so that everyone can have a chance to speak out. And I think it's not wrong to ask for a referendum. I feel it's that controversial. Furthermore, it's a known fact. The Yaletown residents do not want it. They've been speaking about it all day, and now we're going into the nighttime. As a matter of fact, nobody in Vancouver wants it. Nobody wants to live next door to such a facility. Nobody wants to live above it. Nobody wants to pass it on their way to work. Nobody will ever feel at peace knowing that their children have to walk by such facility on their way to school. Living next to such facilities is emotionally draining, unsafe, and is therefore unhealthy. And once again, I repeat it, nobody wants it. The key issue here, as one of them, is the issue of safety for all of us, for each and every Vancouver resident. And our safety has been deteriorating at an alarming rate over the last couple of years and months. It's not often that one can walk the streets comfortably without being approached and harassed. One needs to know the certain safe routes to take when walking on foot and where to cross the street, which alleys and lanes to avoid. These are the things I personally exercise myself, and that's why I'm speaking of them today. Things that I had to learn and adapt to, things I did not choose to do, but I was forced to. Since some of the facilities have been introduced to the area. Something that used to be so real and near is no longer there. I no longer feel safe as a person, as a resident, and most certainly as a female. I don't feel there is security for my friend and loved ones, and sadly, nobody is immune. The sense of lost safety does not pick and choose your race and skin color, your social standings and income, age, or level of education. Each and everyone is unsafe, and for as long as these controversial facilities are being introduced to the established communities, I feel we will keep losing more and more of what we once owned and cherished, our sense of safety. Safety for not even any longer our houses or some items, safety for the most cherished item, our life, the life and well-being of our loved ones. And I want to emphasize this again. Nobody is immune or privileged, no matter the resources one has at their disposal. I deeply sympathize with the people caught in the vicious cycle of substance abuse. I had a chance to witness their struggles, and I realized they need help. The proper, trained help. And as a society, we cannot let them down. But we are letting them down each and every day. And we're about to fail them once again by opening yet another injection site that will only further contribute to everyone's misery. We have to give the troubled individuals some hope, care, dignity, and a chance to feel human. And this cannot be achieved through drugs circulating on our streets. What the City Council is proposing today is yet another generic brand Band-Aid that is not aimed to hold together a deep wound that requires medical attention and stitches. These people are in need of real help. Let's please hear them. The deep bleeding wounds will never be cured with the Band-Aids. The wound will continue to bleed. It will bleed all the residents out of the once diverse and safe Yaletown. Next, it will bleed all the blood and the beauty from the veins of the entire Vancouver, the city we all love, admire, and cherish. And it won't stop there.
Thanks very much.
It will continue.
And we're at 5 minutes. But you do have a question, Councillor Hardwick. Councillor Hardwick,
Please.
Go ahead. 3 minutes. And maybe you're on mute, Councillor Hardwick. Councillor Hardwick.
Thank you. It doesn't always work from the remote.
Okay.
Thank you very much for speaking with us. You mentioned a referendum. You're not the first person to bring that up today. What does a referendum on this look like to you?
A referendum on something like this, to me, given it's a very short-term time frame that I had a chance to process this. Short time frame in a sense of once it's been introduced to me, I have given it a thought and expressed my feelings today. A referendum to me looks very simple, a yes or no answer. A yes or no answer initially to the a yes or no question, for the residents of Yaletown first and foremost. But as I mentioned earlier, since these are such life-altering facilities, and I think they are causing irreparable damage to our communities and neighborhoods, I think it's not wrong to ask nearby areas and Vancouver-wide referendum.
Referendums cost money.
Referendums cost money, but we're about to go into an election. But the human life costs money. Yes, that's true. But every single day, the downtown east side costs $1 million. What would it cost to put together a referendum just for the residents of Yaletown? We do not have these numbers, but the numbers that we do have are the numbers of everyday abuse of the residents that are established and are wanting to continue living and raising their families. And I don't think the cost of the referendum can even remotely compare to the cost of everyday human life and opening of such facilities. This is why I feel so strongly about it. We had 7,023 deaths in the past 10 years. This is a 702 annual average. This represents a 300% increase compared to the first 7 years of operation of the Insight. And how can we even today open the question of money?
Well, it comes out of our taxes. These are the choices. Thank you very much.
Thanks.
Thank you.
Councillor Fry, up to 3 minutes.
I'm really struggling with the idea of a referendum on this and the sort of notion that correlation equals causation. You are aware that the overdose crisis isn't just here where we've had supervised injection services. This is throughout North America. Yes?
Yes, I am aware of that.
So, and what other kind of things? So, I mean, this is really about human lives, and I totally respect and appreciate everything that folks have been saying about concerns about safety in the neighborhood and impacts on the neighborhood. But I'm really challenged with the idea of a referendum on something like human lives and the survival of people. It's made me deeply uncomfortable to even contemplate.
Can I move you to a question, Councillor Fry?
What exactly are you asking for a referendum for on providing overdose prevention services for folks who might otherwise die?
I don't mean to answer a question with a question, but what exactly are you proposing at this proposed location? You are proposing to alter and destroy what the Yaletown residents have built for years. So what exactly am I asking for in a referendum? I'm asking for the papers to be printed with a clear question. Do you support or do you not support this facility? And if it so happens that you receive 11,000 envelopes back, which I believe the Yaletown population is around that number, if it so happens that you get 50% or more envelopes that say, yes, I'm all for it, I will gladly send my kids to school nearby this facility, then you know what? I will never come and complain again.
Do you think we should have referendums on other health services like, I don't know, AIDS or cancer treatment and stuff that cost taxpayers money and may not benefit the majority? Do you think we should have referendums like that?
No, I do not think that. You know why? Because the issue of cancer is not endangering our public safety. People are having cancer and people are either dying or surviving. These people are not endangering my safety. These people are not endangering the safety of our loved ones. And quite honestly, I don't shy away and feel unsafe when I'm walking the streets, knowing that people have cancer. And I did not at all.
We're just at 3 minutes, so I'm just going to. We're just at 3 minutes for Councillor Fry's time, so I don't see any other questions for you. So thanks for calling in, and we're going to move to our next participant, who is Zorika Milanovic.
Hi, good evening.
Hi there.
Hi, I'm here also as many others to oppose your plan to open that overdose center. I'm one of the residents in Richard Street for more than 3 years, and also one of the resident manager who is managing one of the large buildings. Actually, I raised my voice against because of a few reasons. First, it is this decision is without any public consultation. Second, as you hear even from the last speaker, that actually nobody really wants them. Next one, it's actually working here in Yaletown, find out and experience way more crimes in the last 6 to 12 months. And also, as you know, and as many others told, that's the only park in our area. So thank you so much for listening.
Okay, thank you. I don't see any questions on the list for you, so we'll move to our next speaker. Thanks very much. We have Zoe Luba, speaker 115.
Hi there, I'm here.
Thanks very much. Please go ahead, up to 5 minutes.
Hi there, can you hear me okay?
Yes, we can.
Great. So I wanted to start off by acknowledging that I am speaking today on the unceded and still occupied territories of the Coast Salish people from the Musqueam, Tsleil-Waututh, and Squamish nations. I don't have a lot to say, but I want to speak in favor of this motion. I haven't been able to listen to much of the, quite frankly, deeply disturbing sentiments coming from people who don't seem to care if people live or die. Overdose prevention sites save lives. Like it's not complicated. It's horrible how people don't want this to happen in a neighborhood where people are dying. People who use drugs, they deserve a right to live, and overdose prevention sites help make that happen. I don't have more to say, really. I'm just deeply upset and disturbed by some of the sentiments of what I've just heard from some people who live in a neighborhood. That's it. I support the motion. It feels like a drop in the bucket. This is a public health crisis that has been impacting a community who face so many other forms of state violence, capitalist and colonial violence, anti-poor, anti-drug user, anti-sex worker sentiments are very common, and they are killing people. And the poisoned drug supply is killing people too. And when people use alone, they die. If it's not a sanctioned site, like death site, like this shouldn't even be a debate. It's quite disturbing, to be honest, to me, that people's lives seem to just be up for debate, and that it's an okay idea for us to even be having this conversation. It should just be a foregone conclusion that everyone living in the city of Vancouver matters, and everyone's lives are important and are just as valuable as the lives of people who are wealthy and own property in the neighborhood. If not more important, I would even say. That's all.
Okay, well, thank you, and you take care of yourself. We don't have any questions for you, but just want to thank you for participating in the debate tonight. Let's see. So, Council, that Zoe Luba was the last speaker that was on the line. So now we're going to go through the list. We have on the line speaker number 45, Andy Archivin. Andy Archivin, are you there?
Hello. Yeah, I'm here. Can you hear me?
Yeah, please go ahead. Up to 5 minutes.
Yeah. So I've been listening all day, and it seems like there's a lot of people that share the same opinion. I've lived in downtown Vancouver, Yaletown specifically, for the last 10 years plus. And over the last few months, you guys probably know the exact date when Seymour Street took on this project, and the Hojo took off and everything. And obviously the pandemic kind of adds to the mix, but to have all this kind of happen at the same time, and living downtown and having 2 dogs and having a girlfriend that lives up on Seymour, and I live down on Cambie, and we just walk up and down all day, every day. We really got a nice front row seat to the changes that have come. And I oppose putting a permanent facility here. In one of our buildings, we share that back lane with the Hojo. And I mean, if any of you live there or own there or paid rent there, you wouldn't want to stay there since these changes have happened. One of the council people asked if a referendum would be necessary for cancer or AIDS facilities. I mean, that's just kind of, a rude question to ask that lady. There's no public safety issues with those types of facilities. The longer these facilities stay in and around that Seymour area, where there's a lot of residential, there's parks, there's children, there's basically a residential issue. Just because you're a resident of downtown Vancouver, you shouldn't be treated as a second-rate citizen. And if this is a BC problem overall, like, it doesn't just have to be Vancouver that deals with it. So everyone having an issue with it being, permanent right there on Seymour and right there on Granville, around all these big buildings where property, the property values are all dropping. Nobody feels safe around there. I mean, the police, the VPD saying crime has spiked over the last few years. I think there's quite a few stats online and on the Vancouver Sun. the longer these places, if they do become permanent, how long until Seymour Street has the dealers hanging out there, the dealers that roam freely on East Hastings, and the VPD doesn't do much about them. I'm not too sure about why. But once the dealers follow the users, so now we have actual criminals dealing drugs there. And it just doesn't make a lot of sense. And if we're using logic, it doesn't seem like this would be the best idea. A referendum would cost money. I think the COJO costs quite a bit of money, and these facilities cost quite a bit of money. Whether someone saved up to buy and be a resident in this area in Yaletown or is paying that premium to rent, they've worked hard, they've saved up, they've made plans to come here, and then this type of facility comes in, and I guess right now it's just temporary, and they're attempting to change this lease and make it permanent. Well, it's been temporary, and it's had a negative effect on the residents and on the neighborhood, and crime has gone up. Police are getting more calls. I think the experiment has shown that this is the wrong place for it. And earlier today, I guess it seems that the overdoses aren't necessarily happening here. It's not the epicenter. So why displace the users to a residential area to get the help they need? Not so long ago, Seymour and Richards, there was a nightclub on Richards. There used to be, open prostitution happening on these corners and all that. I think the city and the residents that eventually came in and helped rejuvenate these streets, and the developers that came in and rezoned or whatever the city had to do with them to put up these buildings with multi-million-dollar condos in them. None of it adds up to build something up and then tear it all back down just a decade or two later. So I oppose it.
And I don't see any questions from councilors for you, so we'll just thank you for calling in this evening. And we're going to move to our next speaker. Council, we're going back through the list now, and we have speaker number 15, Karen Ward. Karen, go ahead.
Oh, hi. Can you hear me?
Yes, we can. Go ahead.
Hi. I'm glad to have a chance to speak again, to speak this afternoon or this evening. I wasn't able to speak this afternoon because I got benzos, so I was asleep all afternoon because I passed out from the tainted drugs. So that wasn't great, but I'm fine. And I unfortunately missed a lot of the really unpleasant comments that other speakers had to say. And I just want to add, for the sake of this whole argument, would we do this? What kind of things do we actually have to do these kinds of hearings for? I mean, low-income housing, we do this for. Rental housing, we do this. We have public hearings for where people get to talk about what they can't have in their neighborhoods. And I understand how it's great and important to feel a part of your community and to feel a part of the place where you live. But nobody actually has a neighborhood. You just live in these places in time and together, and they change. They change, and we have to adjust or we fail. People are using drugs in every neighborhood in this city, in every city in Canada. People who use drugs are dying at a rate that should alarm everyone, whether they use drugs or not. What we're doing is standing by idly and ignoring a massacre that is, will indict us all for doing nothing and for caring more about our backyards, our ability to cross the street, our ability to not be bothered. One of the things that it's struck me over a lot of years, is that people aren't bothered by the concept of the idea of people being poor, of people being homeless, of people suffering, as long as they're out of sight, as long as they don't have to watch. But when they do have to see it, that's when it becomes a problem. And I think right now, again, I need to remind council, I need to remind anybody listening, this is a pandemic. Things are really bad. They're going to get worse. We really actually do need to make a conscious effort to change how we live and to make that effort to take care of each other in a way we wouldn't necessarily before. It doesn't matter right now if there is no ideal solution, if there is no ideal overdose prevention site, if we don't have an inhalation site because the provincial government dragged its feet. That's not the important thing. We need to save the lives we can save now. And that is your responsibility as council as well. Thanks.
Thank you. You do have a question from Councillor Boyle. Councillor Boyle, go ahead.
Thank you for calling back to speak to us. I'm wondering, we've heard some concern that this will bring drug users to the neighborhood or increase the presence of drug users in the park and on the streets. And I wonder if you could speak to that concern and what impact you think the site will have for those who use drugs in the neighborhood.
If people from the West End, for example, cross Granville Street and use this site, I think they probably just want to stay alive, and that's probably a good thing. Actually, it is a good thing that, I also happen to, I don't think that it attracts people who are like, I'm suddenly going to try to use some drugs. I think if it attracts someone who stops by because they need to be safer, and they want to be safer, and they don't want to have to deal with the downtown east side, that's probably a good thing. But you know what? They're not going to stay. It's the same sense. If someone has a specialized clinic in one part of town, we don't call that an invasion. And I think that, one thing I would like to do, and I've wanted to do this for a while, is get a better sense of where drug users themselves need more services. Because we're just guessing. I mean, it is not okay for us to guess where they need services or wait until they die to find out. I mean, that's an important piece of information that we need to have, again, while they're alive. Let's find out that information and provide services where we need them. Meet people where they're at. That's the first point. I do not think it will bring, I don't remember who it was, who will bring a migration of people here. If we do need services in every municipality, in every area, and we need to stop doing crap like this for 12 hours, letting people resist having their neighbors be alive. This is ridiculous. We need to embrace and welcome people who are trying to save their own lives. Was that your question?
Yes, that was helpful. Thank you very much. That's all from me.
Great. Councillor Hardwick, up to 3 minutes.
Can you hear me?
Yep.
Good. Karen, if you have heard, there's been a lot of people that say that they feel unsafe. They feel unsafe. They've been yelled and sworn at. They, are afraid to walk down the street at night. There's a lot of, needles and feces. All of these things are really, making it, people may be sensitive to the, experience of people with, especially with intravenous drug use as part of their lives. How do you reconcile that? You know that you don't want to say people want people to die. Obviously, they don't want to do that. But how can you get people to be nicer?
I think that goes both ways. First of all, right? I think that we both are aware it's not a good situation, right? When that's what's happening. So but there are things we can do. I mean, first of all, I think that effective outreach first is like, hey, you've got this thing happening. Let's don't do that with your needles. What are you doing? Come on, I've done this in the neighborhood, and it works. Talk to people. Let's put your sharps over here. Don't throw them everywhere. No one likes that. You know that. And then it gets better. You get it. I'm hoping to be able to get. Spikes on Bikes is going to be coming down. They do an excellent job of finding the places where people are discarding needles and getting rid of them, picking them up. Let's put in definitely a needle box. VCH does that for people to put them in. Let's distribute personal containers so that people can dispose of their own safely. And let's make sure we've got a bathroom, because actually no one wants to go on the street. No one does. It's humiliating, and no one wants, everyone's in a bad space already. Let's not make them do that. Let's have some bathrooms. I mean, what we need to do, people are, as you would say, people are degraded, and now they are being aggressively degraded. They're throwing that in people's faces because they're angry. So I do think we need some
peers.
Pardon me?
Encouraging peers to be better. Encouraging peers to be more sensitive.
More responsible. More responsible and more proud of themselves and being able to come inside. I used to run a discussion group for drug users, and we would come and talk about how we can take care of the community that we're in better too. Like, that's what it's about. Bringing people into the community doesn't mean now you can do what you want. It means, like, look, we're in this together. It's a responsibility, absolutely, on the part of drug users as well. And that's what I want to be able to foster. Is not just like, go hide in the alley and do your stuff in the behind the garbage. No, take care of yourself. Be proud of yourself. Take care of the place where you are. This is all possible, Councillor, and we can do that. But we need to, start somewhere. Yeah, and actually, that's literally empowering.
Thank you. And that's it for time in the questions. Thanks. And no other questions from councillors. Thanks for calling in and taking the time tonight. And we're going to move on to Luke Baxter, speaker number 61.
Hello.
Hi there. Please go ahead.
Hi. Well, I can only speak for myself as far as what's happened to me personally. I have a 2-year-old daughter. The deterioration, I'm about 2 blocks or a block away from the Howard Johnson. And it's not just the Howard Johnson, it's the whole surrounding area. Like, I actually can't use, especially with my daughter, any of the stores now by me, because they're completely unacceptable for a little girl, especially in a pandemic. I mean, hundreds of people have now flooded onto 2-meter wide sidewalks, and they're all smoking, doing drugs, swearing. I'm a little emotional because a couple of my, I've had one guy pull a needle on me with my 2-year-old daughter while I was trying to leave my building, and he tried to force his way past us with a needle. I called the police. They didn't arrest him. They caught him and just let him go because they said he was mentally ill and there was nothing they could do. I've also recently, in the last month, had someone flash my daughter, like pull up his penis and walk towards her. I did call the police. They knew of him. They found him, and then they released him because he was mentally ill, and there's nothing they could do about it. And so now he lives in my area, and they claimed he was mentally ill, but he wasn't mentally ill enough to not realize I couldn't leave my daughter when he was. So he flashed or approached her. I obviously put myself between them, and then he went away about 20 feet and started mocking me and my daughter. So he knew what was going on. But so now he lives in my area. I mean, I can't let my wife out with my daughter at dark because it's so bad like that. As far as this area goes, it's dangerous, but it's also emotional for the people here. If you go to any of the parks, all the parents are talking about is what it's like. You see them; they look like pigeons with their heads on a swivel at all times while trying to watch children. I mean, I don't even know what the legal process is here with not allowing liquor stores or marijuana stores beside parks, but you're going to allow like class 5 drug beside a park. The van is parked beside Emery Barnes right now. You can literally see it from the park. It's a couple hundred feet. There's another one up at St. Paul's, and the children in the school system there can sit in their school and look and watch people line up and shoot up. I mean, there's got to be some type of other process than what you guys are using, because not only is it not working, the deterioration is rapid and fast. Like I said, these are only my experiences. I can't talk about other people's, but there has to be a break for the people in a pandemic. Not only has the deterioration happened over the last 3 years, but since the pandemic, you put these people in the area, and now you want to add on top. Like, the mental health of the people around here isn't even coming to anybody's consideration. The mental health of the children around here haven't even come into consideration. And all I'm hearing in this meeting is about how we have to help these people. Well, in Vancouver, there was a 4-year wait list for children to get into daycare. There's a wait list to get kids into schools and high schools here. And in a system where we're losing money every year on our tax base, you want to take this money from the children because it's really their money. We're so in debt as a province that it's not our money anymore. It's not my money. It's their money. And you want to give it to saving drug people's lives instead of getting schools that work for the people that live down here that pay taxes, instead of getting these people hopefully off drugs. Like, I believe that there's a better system when we're not using it. But by housing them in mass groups, you're creating a bigger problem. Like, these people need to be split up in smaller groups all around the city so everybody gets a little bit of it. But packing them into 1 or 2 blocks is not only destroy the community, it's destroying public health of your citizens. And that's shame. And you're doing this all on children's credit cards that aren't even up yet. And that's it. You know, you're really taking from children the right to go to schools and have support and use the playgrounds. You're giving it to a drug user because there's not enough of it. And they know that. You know, the 4-year wait list for daycare, that's crazy. You know, signing up years ahead to get to schools, that's crazy. Why? Because we don't have enough resources. So you're going to take those resources and move them into making a system that you know, and people already say it isn't perfect, isn't working, and it's upsetting, and it affects people's mental health in a big way. And you're doing all this in a pandemic. I mean, it's pretty.
Thanks so much. That's the end of your 5 minutes, but you do have a question from Councillor DeGenova. Go ahead, Councillor DeGenova.
Yeah.
Thanks very much, and thanks for making the time to speak with us. I can hear, let me know if it's not a fair representation, but the emotion in your voice and talking about, I'm sorry.
My 3 years.
I do want to ask you a question. I was just wondering, I mean, it sounds to me like, you know, you're looking for a solution that may center around public safety, but you're not feeling maybe what I heard from you, and please correct me if I'm wrong, is you're not feeling heard on that. And I'm also just wondering, if you were feeling heard, do you think that you'd be more likely to want to participate in a process that could maybe see a safe injection site or an overdose prevention site, as it's called in this report specifically, the solution and more welcome in your community? If you could find a way to incorporate that, do you feel kind of right now like you're, for lack of better words, treading water?
Well, absolutely. You've sunk a 4-block part of Vancouver into the ground. You really have. And the funnier part about this is what I don't understand that you guys don't understand is this is the entrance to Vancouver. Like, when you come from an international, as a traveler, as a tourist, you come right to the first thing you see over the Granville Bridge. Boom, that's your front door. And it's not coming from Stanley Park. It's not coming from the number 1. This is the look you want. I mean, 5 years ago, every second car commercial was coming over that bridge. That's where they used to film for car commercial, brand new car. It's beautiful, blah, blah. Not now. When you come over that bridge, what do you hit? You hit nothing but drugs and people everywhere. Like it's crazy. Like I couldn't even tell you. Like I said, a man approached my 2-year-old daughter with his penis and said, "Hey kid, do you want to see my dick?" And how do I not kill that? Like, when do I defend myself and my child? What are my liabilities? Like I don't know what to do. You can tell me.
Can I ask? Can you send us your comments in an email or on the city website?
I've already said everything.
Okay.
I mean, I can. Yeah. But I mean,
Sorry,
everything I've reported.
I will go back and look under your name for it. But just in case I can't find it, because I've been trying as we've been talking here. But thank you for sharing your experience, and I appreciate the time you've taken, and I hope that you feel safer in your community.
If I am going to say anything that will help solve this problem in a big way, you need to break up these massive hotels. Because I can see the hotel from the corner of one of my windows, and I just see drugs going in there, like in big batches. I can tell you who the drug dealers are. I could sit there and point them out. Like everybody knows. I mean, mostly what happens is it comes in cabs. The guy goes to the back. He pays for something in the back of the cab. Looks like a to-go box. Walks in, and all of a sudden, drug users are coming out in flocks right after it. Like many. Like it gets divvied up when it gets in there, and then they come out, and it's chaos for hours after that. Like I don't understand how people. Okay.
Sorry, that's all the time.
I appreciate your time and listening. Yeah, I appreciate your time.
Thank you. Thanks very much. Okay, Council, we have Christina Laffin is.
Yes, I'm here. Thank you.
Okay, thanks very much. Please go ahead.
Thank you very much for giving me the opportunity to speak. My name is Christina Laffin, and I'm a professor at the University of British Columbia. I teach in the humanities, and I'm calling today to speak in favor of the overdose prevention site at 1101 Seymour. I've never spoken at a council meeting and never felt compelled to do so until today, when I learned about the possibility of this overdose prevention site being opened, and I saw that people were being mobilized, particularly via social media, but through other means as well, to speak against today's motion. I'm a resident of the West End. I've been here for the past 15 years. I've lived for a long time close to Yaletown, and I'm someone who shops there and uses, facilities, entertainment, restaurants, other services. And I'm calling this to remind us that we're in the midst of a health crisis that is killing 5 people every day in BC. Over 1,000 people have died of overdoses so far, just in 2020. And in Vancouver, as you have noted in your presentation, we saw 259 overdose deaths over 8 months. We've seen that there's 10 times more overdose deaths happening in BC compared to the coronavirus. So I think we should let that all sink in, that there's 10 times more people dying, and yet we're mobilizing in incredible ways against the pandemic. And so my plea to City Council is that you act quickly to save lives. I've been listening over the past 10 hours, and I've listened to nearly every speaker. And what I've been hearing throughout the meeting are questions about, is this the right place at the right time? Is this location everything we might want it to be? Might people in the neighborhood feel uncomfortable about seeing people lining up for safe use or hopefully safe supply? And yet the basic question I feel we face is, do we wish to see hundreds of people dying over the next 6 months? Can we live with ourselves letting people die at our hands? The City of Vancouver presentation that you offered noted that an overdose prevention site, or an OPS, is a community-based temporary emergency health service that operates under a public health order and that does not require community consultation. Does not require community consultation. And so I appeal to all of the members of the City Council to really respect the emergency need for this OPS and to respect due process for this site opening, which is not based on whether there should be resistance among some people in the community. And I would urge you to think that drug users are also community members. It doesn't depend on whether we might all like to have input. We don't have the right to determine whether people should live or die at a time like this. And as I listened from 10 a.m. until now, I've been really dismayed to hear that this life-saving measure is being framed as though those who are worried more about physical property are the ones who should determine who lives and dies. And if they're truly worried about safety, then this would be a measure for public safety and for the safety of drug users. We're in the midst of a health crisis which is killing far more people than COVID-19 is, so I wonder why we are not taking immediate action. If safety is truly the concern, as I've been hearing all day, then the safest option is to enable an OPS site to open and to address the safety of those visiting that OPS and the safety of everyone else too. And as an educator, if I can say, I'm a Canada Research Chair here, and I'm lucky to be privileged to be working at one of the top educational institutions in Canada. I constantly am reinforcing to my students that we have to trust authoritative sources. We have to analyze problems based on reliable information. We have to trust true experts. And we've had experts come to us today drawing on decades and decades of research, and they've told us that the OPS will save lives. They've told us there's a need for it in the neighborhood. They've told us it will improve public safety, safety for all of us. And we've also heard a series of anecdotes and frankly stigmatizing statements from many who appear to be fearful. And so my plea is really that we remember people using drugs are members of our community. They're parents, they're siblings, they're youth, they're friends, they're colleagues, they're people you know. People using drugs live throughout Vancouver, and these are people who deserve to live. So the statistics about the overdose crisis, which the City of Vancouver presented kindly today, show that City Centre is the second most frequent area for overdose calls. You've shown us the policies, which also appear on your website, that indicate we've been in a public health emergency for 1,643 days. We know that overdose prevention sites save lives. So how many more days, how many more lives, how much more consultation is this going to take to ensure that we prevent overdoses and enable safe supply? How many more consultations? I'm really distressed to hear the kind of comments we've heard today, which frame this as a sort of debate or a referendum. I don't want a referendum on human lives. As somebody who values lives, who doesn't want to see more deaths, and who happens to live close by, and who also believes that we should be following expertise and evidence-based solutions, I really plead with you to approve this motion. Thank you.
Thanks so much. You do have some questions, Councillor Kirby. 3 minutes.
Hi, Ms. Lappin. Thanks for being here. I appreciate your passion for this. I have a couple of questions for you. And the first one is, so as an academic, you commented on the importance of, sort of trusting expertise and data. Do you not think it would be helpful to share some of that data with the community in an attempt to build some social support for this, as opposed to people not feeling that they have an opportunity to better understand what the service would provide and how it could be managed?
I certainly welcome education and conversations that would be ongoing, but I think we do have to face the fact that this is a crisis. We don't respond to the pandemic by saying, well, we'll figure out what everybody wants to do. Do they want to wear masks? Maybe not. Well, then we won't worry about that one. No, we actually move forward with proven, effective approaches. And so I think we should be going forward with the expertise and understanding that we have on that, while at the same time having those important conversations.
Okay, and the comment, I just want to be clear, because you had made the comment too, characterizing this as that, if this decision doesn't happen or isn't supported right now, that, that we're risking lives. But did you hear the comments from staff from Vancouver Coastal Health this morning that this is no net service increase, that this is switching from the current mobile service to an inside service?
Yes, I did. And as I was listening to that, I was thinking, as we're moving into terrible weather, why are we expecting people to be out on the street and coming to mobile services? I don't know enough about that site, but I do feel strongly that we should be enabling more sites in more locations and making them as accessible as possible.
But just to be clear, the mobile service is currently located on the side and sort of behind it. 1101 Seymour, the site is proposed, so essentially the same location. It's just transferring from outside to inside. It's not a net new service.
No, but I would be very much in favor of enabling people to come indoors. Yes, yeah.
Okay. The other question that I have is that you had commented, and I know this is an emotional issue for a lot of people, and there's lots of great comments and important considerations that everybody is bringing forward, but you had commented that this was a characterization of people concerned about property damage. Did you also hear the speakers that mentioned they personally suffered assaults or other issues? And do you think that there's a responsibility to figure out how to support those people as well?
I have heard this framed as a safety issue from many of those, and I've heard from many of the experts in the field telling us that actually it becomes a safer area if you enable people to take drugs in a safe manner. and dispose of needles and so on in a safe manner. I am convinced by the evidence that I've read about online. This is not my area of expertise, but it is something I feel strongly about in terms of protecting my fellow Vancouver residents.
And that's 3 minutes. Thanks. We're going to go on to Councillor Dejanova for 3 minutes. You maybe are on mute, Councillor Dejanova.
Thanks for reminding me, Mr. Mayor.
Yep. Okay. Go ahead.
I had similar questions to Councillor Kirby-Young, but one that I didn't have is I'm just wondering, to your last point, about the information that you have said has informed you. Do you think that it's important through consultation to educate people so that we bring people together instead of tear them apart on issues such as these?
Absolutely, but I would take saving lives as being a greater need at this moment to simple education. You know, I carry out education in my everyday life at UBC, but if a student is in crisis, I know who to refer them to and how they can get help.
And what would, I mean, you don't have to answer this question, but what would you say to the parents who are using the park with their children who have either found a needle? I know there have been children that have been pricked by needles, and or, you know, are concerned about that and no longer can use that park because of that reason, even if they do a sweep themselves ahead of time, because I don't also see that as possessions or property, but I'm hearing that as an ongoing theme here as well.
Yeah, I mean, I do feel that city property is for all of us to use. I do want it to be safe for all of us to use, but it's my understanding that OPS sites improve the safety for all of us. They don't decrease that.
Okay, thank you.
Thank you.
Thank you. Councillor Hardwick, up to 5 minutes, 3 minutes, sorry.
Can you hear me?
Yes.
Oh, great.
I can, thank you.
Thank you. Do you think location matters in determining the location based on the evidence?
Yes, I'm not quite sure where you're going with that question, or maybe I lost you at the end. But I think location matters in that I think we should have overdose prevention sites throughout Vancouver if we truly are considering everybody's needs.
So a more distributed approach.
I think so, but I think there's clearly a need in Yaletown right now.
Okay, well, yeah, we're still looking at, speaking of that, looking at the data that is being provided by various different groups. We've talked about evidence and the importance of evidence in our decision making. And obviously, your primary concern, as you've described, is around people dying through overdose. But what about saving other lives? I mean, we've seen murders and assaults and physical violence. How does that play into your way of looking at things?
Honestly, it feels a bit like a straw man argument there, in that the number of deaths we're seeing based on overdose are so high. I think we have to look at this as, you know, whose safety are we talking about? Don't all lives matter in the sense of drug users? And in that case, why are we not helping everyone, right? So my perspective is really based on safety for all, and not just, you know, a segment of the population in that area.
Yeah, but are you saying that the safety of drug users is more important than the safety of the people?
No, absolutely not. I think the safety of everyone is you know, paramount, and that's what we're aiming for in the city. But I do think that overdose prevention sites, that's part of the mandate. You know, yes, they are serving drug users, but taking people off the streets and into such sites is a win-win. So I don't quite understand why that would be jeopardizing the safety of others.
Well, just the police department has spoken to us and there's no question that crime is up, not down. And this is a concern across the city, but in the downtown peninsula in particular. So it's not that clear at all when we're seeing evidence that's saying that crime is up, and at the same time we're being told that overdose prevention centers would reduce crime. So I'm just trying, we're all trying to balance.
I do wonder why we're attributing that, though, to. Yeah, I think there's an unfortunate tendency to assume all crime is being done by those we don't want to necessarily be seeing. And so, this idea that overdose prevention sites are somehow immediately linked to crime, I'd like to see further evidence proving that. And I'm really concerned about this idea that those who are seen as using drugs are somehow seen as the problem.
Thanks, and we're at the 3 minutes. Thank you very much. There's no further questions for you, so thank you very much for calling in tonight. And now I'm going to move to Ryan, who's speaker 111.
Perfect.
Ryan,
thank you. Can you hear me?
Yes, I can. Please go ahead.
Well, thanks for being there tonight for so late. I appreciate you guys. I hope that the members of the council have taken the time to actually go visit the proposed site where currently there is that safe injection ban. It's been parked in the area for about 2 months, and the changes to the community are actually very, very apparent, as spoken by the speakers before me. The area is becoming dirtier. The alley is becoming a bathroom. The police presence has skyrocketed. Addicts are openly shooting up and smoking crack, as they wait for others. And there's been lots of talk about evidence, but this is the evidence. You have the case study of what is happening in real time right now. The police reports, I bet you there's hundreds of police reports from that exact intersection. I guarantee it. And so as you're looking for evidence, why aren't we all just talking about what's happening right now? How many assaults were there in that city block? Like how many needles are actually spread through the alleys? Do we get the building managers close by to collect the needles and start counting them? That there is already a safe injection ban there. It's supposed to be cleaning up the area, but it's not. And that's not me just saying that. That's the actual reality of the situation. And I can support helping our most vulnerable. And I think it's very, very important for a good society to do that. But I also think there needs to be assurances to the immediate community that they're going to be protected as well in real time. And that's it.
Okay, thank you so much for calling in. I don't see any questions for you on the queue, and I'm going to move to the next speaker, 101, Sarah McCauley.
Hi there, can you hear me?
I can. Please go ahead.
Hi, thanks very much. My name is Sarah. My husband, Luke, has already actually spoken this evening. He mentioned among it that our daughter and himself were out walking and unfortunately had a man pull his penis out and show our daughter and run away in the area. And so obviously as a concerned parent, there have been challenges. We live at 1188 Howe Street. We moved here about 3 years ago, just before my daughter was born. She's almost 3. We had lived at 111 West Georgia Street near the stadiums prior to that. And moved to the West End because of the resources for Petra. Great parks nearby, community centers, this area. And my husband was a business owner in the Granville Entertainment District. I have managed upscale restaurants and hotels in Yaletown and the downtown core for 15 years, and I'm now a hospitality instructor for a private college in the downtown area. We've lived in this area for 20 years and always felt really safe here. When we moved to the West End, the people in this area are colorful and are eclectic, but it always felt safe and it always felt like a community. And that's really not the case anymore. Obviously the incident that happened with my daughter and being flashed and exposed, but we've also been threatened on our own doorstep with needles. We've had also, the last speaker talked about openly smoking crack cocaine. We've had smoke blown towards our daughter who's in a stroller, so at that head level. And certainly in the last 6 months since the pandemic started, it has become increasingly worse. One of those issues, which I'm sure has been brought up many times and probably by my husband, is the transition of the Howard Johnson Hotel, which went from, travelers and tourists and a nightclub to now having people shooting up openly on the street. We went out to go out for a nice Sunday afternoon and are greeted by open illicit drug use in the area. And it's challenging. It's challenging because it's been a threat to our safety, to our daughter's safety. And that's not to mention the damage that it's done to the businesses in the area. Now, I understand that this is my personal view, and certainly the insinuation that we don't care, that concerned citizens don't care about human life, I think is just incorrect and perhaps ignorant, because certainly we don't want to see people in very vulnerable situations succumb to mental illness and illicit drug use. But we also have to protect our children and protect our community as well. And the way we feel, particularly with these sites like the Howard Johnson going up, which we understand are needed, but not having a discussion about what the real impacts are on our community. And I have to say a quick thank you to Councillor Fry, who I know has been down to the neighborhood and spoken to us, to myself, my husband, and we've seen him talking to other people in the community. And hopefully there is an understanding from the councillors that this is not about this is not about a lack of understanding or a lack of compassion. It's about for other people to understand we are part of this community too, and we want to see it flourish in the way we know it can. But the challenge with overloading certain areas, and I wholeheartedly agree with the fact that we have seen a huge rise in crime in this area, and we have not seen the resources from the police force or from the government helping to protect us in this area. We're still being very, very exposed. I think really, from not only from a parent's perspective, but from someone who has run businesses and been a general manager of multi-million-dollar industry businesses in these neighborhoods, I fully understand the impact. I'm not saying that we shouldn't have overdose prevention sites. That is not my statement. I don't want people to perish from drug use. I just don't want to have to worry about bringing my daughter out in the morning because I'm afraid that I'm going to be attacked by someone who is, under duress for whatever reason. I don't think that and I think that oversimplifying it and looking at an overall and general statistic and saying that these help the community, I understand that, and I'm sure that I agree in many ways. What many of the residents and citizens in this area are saying is that right now we're at a saturation point. We're at a tipping point. And if we continue to degrade the businesses and the families and the community support in this area, it will be very, very hard to bring this community back when we're already under such economic stresses from COVID-19. I really, really want to stress that this is not about having a lack of compassion for human life. It's about making sure that all citizens are comfortable in the community and that we're meeting the needs and the health needs of everyone who's involved in these situations. I really appreciate your time and listening to us today.
Hello?
Mayor, you're on mute.
Hello? Okay. I was just wondering. Thanks. Thank you, Councillor Fry. Mayor, I did want to proceed with questions unless you said I could. Are you still on mute, Mr. Mayor? I better wait for him.
Yes.
I hope he'll reset.
Okay.
I'm on mute.
Okay.
I thought you were on mute. I was yelling, you're on mute, you're on mute. That's me. Okay, sorry about that. Okay, Councillor,
you wish,
please
you
go
wish,
ahead.
maybe.
Up to 3 minutes, yeah. Okay.
I might wish at this point, but thank you, Mr. Mayor, for resetting my time. I thank you for sharing with council how you feel, and I wanted to ask you the same question that I'd asked your husband, because I think that it's important. We're hearing people talk about, it's property and it's lives, but I understand, being the mom of a toddler myself, it also, there's concerns about safety for young kids, and I'm talking about needle safety. That's the only safety I'm talking about right now, because of the situations we've heard, but considering the very disturbing and alarming information that was also shared by your husband about an incident, I just wanted to make sure the Vancouver police, that has been reported. They didn't just attend to it, but it was reported to them, correct?
It was reported. It was reported. A case number was given. My husband was called back and said, "Listen, this guy is known to us. He is someone who has been to court before, suffers from mental health. We want to make sure you make a statement so that when we can act on this." So it was fully in. My husband saw him, 3 weeks ago, maybe on the street, because he must be living in this area. He's seen him several times since. Called the police, but the police had said that the Crown had not processed the charge yet, and I might not be using the right language. I apologize. But the charges actually had not been processed.
Reported.
And so it was
I do have more questions for you. So
yeah,
I don't mean to cut you off, but
go. No, okay.
Thanks. I wanted to make sure that it was reported and they had that information in case it was to happen to someone else also. But also just wanted to ask you, I mean, if there was a way to sort of improve making you feel safe, would you feel, and I'm assuming that you're speaking in opposition, but I don't want to put words in your mouth. I mean, would it make you less reluctant, perhaps is the best way to say it, to the 4 pillars and the safe injection site?
Yeah. So yes, I am opposed. But yes, if we saw an increase in support, whether it's police, or even some of the ambassadors that are around in that area, because it's not something we've seen. We actually saw an uptick in the police, in some of the coverage during COVID-19 to make sure that people weren't on the play structures and too close together. And we had made a comment that, wow, we wish they were here every day so that they can ensure that we are safe. Because really, this is about the fact that the resources are just not there. We're not seeing that police protection. We're not seeing them walk through our community. We're not seeing them ensure that the parks are safe, right? Because what's happened now, especially in Emery Barnes, is there is a ring around the outside of the park where all of the drug use and all of the illicit activity is going on. They stay mainly away from the actual the play. Yeah.
Okay, I'm out of time, but maybe Councillor Fry will give you more. Thank you.
That's 3 minutes.
Councillor Fry? Yeah, thanks. And thanks for your comments and your perspective on this, because I think it's quite balanced. And I think, reflecting on the saturation of services and stuff is completely legitimate, and your sort of lived experience as a parent in the neighborhood. I mean, we're also faced with the reality that there are a significant amount of people who are dying of overdoses in this neighborhood, and that we collectively need to intervene somehow. So with the assumption that, the understanding that we need to do some kind of intervention to keep people safe, what would make this work better for you in your minds? What are some operational considerations we might?
I think if we're going to put the resources towards, because as we said before, there's already a temporary site there. There already is activity in that place, on that corner. If there was policy involved where there was a mandatory amount of regulation when it came to police coming through through that area, regular walk through, and I mean constantly walking through. If there was consistently some sort of police or authoritative, voice in that area. But I think that needs to, that doesn't happen after, that needs to come along with it and should be regulated in a very structured way. So not, okay, well, we're going to put more boots on the ground, actually having mandated and regulated policies that are going to ensure that is going to happen, because that's really the only way. And I want to make this analogy. If I were to build a soccer field, right, and we put some lessons on there and everyone came to play and they had teams and it was all structured, you would still have people come to that park when it was not open to use it for the same purposes. And I would say the same thing about drug use. If we're going to put a permanent site there, it is going to attract the type of activities which are associated with it. And therefore, we need constant and vigilant supervision on not only behalf of the site itself, but on the community. And that really needs, again, not to be an afterthought. It needs to be a forethought. It needs to be regulated and mandated.
Okay, anything else in the last 30 seconds that you might see as operationally?
That is it. And again, Councillor Fry, I just want to thank you again for coming down to the community and actually having a look. And if other councillors have not done the same, I strongly urge you to come down and talk to people in the community and to make sure that we're creating a safe environment for all Vancouverites.
Thanks very much. And that's it, clerks. I'm going to turn to you now. I'm just checking. And was that our last speaker?
It is the clerk here, Mayor Stewart, and yes, there are no other speakers on the line.
Okay, thanks so much. So, council, we've gone through the list twice as our procedural bylaws suggest we do. So that is
point of parliamentary procedure.
Sure, go ahead, Councillor Ignova.
Mr. Mayor, I was just wondering, after an extremely long day, if it might be possible to have a 15-minute break.
Yeah, absolutely.
Thank you.
I was just going to ask, would somebody like to move the motion and then second it, and then we can take a break and then come back for debate and decision?
Councillor Boyle, I'd be happy to move the motion.
Point of procedure, Mr. Mayor. A second. We have questions to staff. Point of procedure. I think
just one second. All at
Sorry,
once.
I was on mute, I thought. My apologies.
So we've had it moved and seconded, but a point of procedure by Councillor Kirby-Young.
Yeah, I have a point of procedure. I thought that we agreed earlier, and it was confirmed. I'm not sure if you were in the meeting at that point, Mr. Mayor, that we would have a chance for further questions of staff first prior to moving forward.
And you absolutely do through points of information. So that's...
that wasn't, I don't believe that's what was agreed on earlier before when Councillor Boyle was showing. That's my point of procedure, is that we would proceed with.
Well, we've had it moved and seconded, and you can ask questions through points of information. Did you have...
no, Mr. Mayor, we agreed to an actual question opportunity for staff earlier. That was decided in the meeting earlier prior to you.
Was there a motion moved, Councillor Kirby-Young, to that effect?
Yes.
Can I check with the clerk? Was there a motion moved that we would have a second round of questions to ask the clerk?
Mayor Stewart, it is the clerk here. It was not in the form of a formal motion, but the clerk and the city manager had indicated there would be additional opportunity to ask questions of staff.
Mr. Mayor, Sadhu, city manager here. Yeah, there was a back and forth around this, and I did agree that we would have staff available to answer questions after the speakers.
Okay, I mean, it doesn't matter, I guess, if there are points of information or not. If council would like to have just a regular round of questions rather than through points of information, then can I have a motion to that effect?
Yes, Councillor Kirby-Young.
Second, Councillor DeGenova.
Thank you, heard Councillor Carr second. All in favor, say yay.
Yay. Yay.
Opposed, say nay. Okay, great. So we'll have a second round of questions, but we'll start at 9:15. Come back after 15 minutes. Okay, thanks so much. it's 9:15, and so we'll start with our questions. I have Councillor DeGenova on the list.
Point of parliamentary procedure.
Sure, Councillor Carr.
Yeah, thanks very much. Mr. Mayor, you weren't chairing at the time, but I did ask staff if we could, as councillors, send in questions to staff.
That's true. I was here. I remember that now.
Oh, sorry.
Okay.
My apologies. My memory is not gone. And they said that they did, and they would respond back. So I guess I'm concerned that I would have to repeat.
So Mayor Stewart, this is the clerk here.
Welcome to Telus. Enter your attendee ID number, followed by pound.
You know what? I mean, it might be interesting from the public point of view, but if those answers are in written form and that's what they would say verbally, I mean, I can certainly just read them.
Okay. That sounds fine. We're happy to, Mr. Mayor, we're happy to answer additional questions if councillors have them now.
Okay, thanks. Where are we at here? I'm just looking at the, it was sent at 8:16, I think, the questions, and there was 10 that were answered.
Thank you so much. Those were mine. Thank you.
Okay, thanks. So, Councillor DeGenova? 1, 2, 3, 4. Okay, we'll go to Councillor Swanson. Councillor Swanson? Councillor Kirby-Young.
Yeah, I was hoping that I'd like to move that we could have staff respond to those and read those questions in the record, because I just think with the volume of email and the amount of speakers, I haven't been able to read them, and I think it would be great for the public to see those well as practice.
It's not our normal practice. I don't think that we're going to get to debate and decision tonight, so you would have time to digest it.
If we're not doing debate and decision tonight, then I'd be more comfortable. I have time to read them. I just feel that I need to do that before we do proceed to debate and decision.
Okay. While we have staff here now, do you have questions that you'd like to ask?
I haven't been able to read the staff memo yet or the other questions, so that will inform my questions.
Okay. So we move around to questions, but we're not going to ask them. Okay, Councillor.
Well, I understood that staff would be able to respond and provide. Mr. Mayor, could you please not be so rude to me? I feel it's misogynistic, and I'm really getting upset by how you're treating me relative to other councillors. I'm not able to work in this environment if I'm not able to answer a question, which I'm doing so perfectly professionally and politely.
Councillor Dominato, go ahead, up to 5 minutes.
Mr. Mayor, you just did it again, and you ignored me completely. It is misogynistic behavior, and I cannot deal with it anymore. It is not appropriate.
Councillor Dominato.
Thanks, Mr. Mayor. I have a question, follow-up, and I apologize for sending it in a bit late to staff, but whether they'd be able to follow up. My question was related to the Lugat, and they had done some follow-up around the restaurant space there, and I understand from talking to the chair that they're looking at that as a gathering space potentially, which I think is fantastic. And also, I think they're considering potentially an OPS within that space, and I'm just wondering if we were able to get that confirmation.
Hi, Councillor Dominato. It's Sandra Singh, General Manager, Arts, Culture and Community Services. To our knowledge, we haven't had confirmation yet. That question came in. We haven't been able to reach out yet to Atira. However, they do have an OPS for the residents in the Lugat. It's possible that they're looking at either expanding it or relocating it to that restaurant area. They are planning that space for programming and service space for the residents, and their focus, BC Housing's, Atira's, and BCH's focus for that community is to help stabilize that resident group and community in their new homes.
Okay, thank you. Yeah, no, I've actually visited and toured the Lugat and seen the mezzanine site, and that seems to be working well. But I'd heard also that they were looking at something additional within the restaurant space as well. So that's great. And I'm trying to find my notes from today. I think I'd indicated I'd follow up on a question that was raised by a resident or a couple of residents around the current OPS at St. Paul's and operations around handing out needles. People were characterized, and I didn't think that was accurate, but it was characterized that boxes of needles are being handed out, and I didn't actually think that was the case. I visited other OPS sites, and it's not the case. People are coming in to safely use and with supervision, and so I just wanted to know if we could get some clarification on that.
Sure, it's Sandra here. Maybe I'll ask Chris Van Veen from BCH to answer that question.
Thank you, Sandra. Yeah, it's Chris Van Veen, Director of Strategy and Public Health Planning at BCH. So all the OPSs and SCSs in our region also operate as needle distribution and recovery centers. So if you were a user that wanted to come in and use drugs at the site, but also if you live, say, several blocks away and wanted to take home some injecting equipment, along with a safe plastic box to put those in when you were finished and bring back to the site at a later date, you would be able to do that. So they will provide harm reduction equipment for people to take home and use, but also offer the opportunity for people to bring their syringes back to the site for safe recovery. The social housing sites in general also provide safe needle distribution with Stericycle pickup for residents.
Okay, great. Thank you. Appreciate that clarification. Thanks.
Is that it, Councillor Domino?
Yeah, that's it right now.
Thanks. Councillor Carr, up to 5 minutes.
Oh, yes, thank you. My first question has to do with the mobile van that's currently providing services at the site. We've had two different sort of takes on the impact of that. One staff said that they've fielded few comments and no specific incidents around it. The other is that the speakers talked about, I guess, having a lot of negative community impact. I wonder if staff can respond to that.